Very good morning to one and all. Extremely sorry for the inconvenience. We are facing some technical issues. Okay. I will welcome all to the second day of 4th International Conference on Nursing Sciences and Healthcare organized by the Society for Nursing Practices and BioLeagues Worldwide. Theme, Leading Innovations and Pathways, Transforming the Future of Nursing. Extremely sorry for the inconvenience. We are facing some technical issues. Okay. I will welcome all to the second day of 4th International Conference on Nursing Sciences and Healthcare organized by the Society for Nursing Practices and BioLeagues Worldwide.
I kindly request everyone to please be available in Zoom for a few more minutes.
Hello. Am I audible, ma'am? Sorry, we are facing some technical
Yes, you are
issues.
audible.
Just let me know whether my voice is repeating twice or thrice. No, Varla.
So that we are having some technical issue. Whoever is speaking, their voice is echoing and repeating again and again. We spoke to Ranjan sir also. Ranjan sir told to leave the meeting and restart and come back again. So we are doing that, sir. Link will be same. Link will not have nothing will be happen to the link. Link will be same. So yeah, okay, sir.
Anita. Huh? Mhm. Good morning, all.
Morning, ma'am.
Sorry for the technical issue. We'll be starting in 2 minutes. Good morning, all. Welcome you all to yet another great day, which we are celebrating our fourth international conference, second day. We really apologize from our side for the technical issue faced. We have sorted out, and we hope that this will not happen again. Welcome all to the second day of fourth international conference on nursing sciences and healthcare, organized by a Society of Nursing Practices and BioLeagues Worldwide. As everyone knows, the theme of today is Leading Innovations and Pathway Transforming the Future of Nursing. I'm sure that you had a great day yesterday with all our participants. Hope to see the same enthusiasm from all our participants and attendees today, and also our experts. I would like to welcome our honorable dignitaries of today, our keynote speakers, who will be taking over the session for the morning one. I'd like to welcome our eminent keynote speakers, Dr. Karpagavalli Nageshwaran, Dean cum Principal of Ganpat University, Kumud and Bhupesh Institute of Nursing, North Gujarat, India. I'd also like to welcome Mr. Ravi Bharat, Associate Professor, Ganpat University, Kumud and Bhupesh Institute of Nursing, North Gujarat, India. Dr. Hemam Sangeeta Devi, Principal, SCA College of Nursing, Bangalore, India. I'd like to welcome Professor Jesslyn Jabuni, Vice Principal, SCA College of Nursing, Bangalore, India. I'd like to welcome Professor Mr. Ashokan R., Head of the Department of Medical Surgical Nursing and in charge of Research and Development, Kalinga Institute of Nursing Sciences, KIIT, deemed to be University, Bhubaneswar, Odisha, India. I'd like to welcome Ms. Maitri Chowdhury, Principal, Nurses Training Institute, AGMC, and GBP Hospital, Agartala, West Tripura, India. I would like to welcome J. Nesamani Sojna, Assistant Professor, Department of Obstetrics and Gynecological Nursing, College of Nursing, Aligarh Muslim University, Aligarh, UP, India. Welcome you all once again for the fourth International Conference on Nursing Sciences and Healthcare. Hope you'll all be having a great day with us. We are happy to announce yet another grand global nursing conference organized by Society for Nursing Practices and Narayana College of Nursing, Nellore, India. It is the 5th International Conference on Futuristic Nursing, which will be conducted on 29th and 30th of next month, that is October 2022, at Narayana College of Nursing, Nellore, Andhra Pradesh, India. The conference will grandly emphasize on the theme Futuristic Nursing, Navigating Beyond the Horizon. It is a hybrid event which incorporates virtual and physical. Physically, it is conducted in the renowned institution that is Narayana College of Nursing, Nellore, Andhra Pradesh, India. All the participants are requested to join the event and experience the future of nursing physically. The main keynote speakings that will be discussing on the sessions based on the future of nursing, physical to digital, the future of healthcare, pathways transforming the future of nursing, digital health technologies, and bioinformatics. Do not miss the opportunity to be a part of 5th International Nursing Conference, which is based on the futuristic nursing. Mark your dates on your calendar and be the part of this global meeting. Now we will be having a short video on 5th International Conference. Once again, welcome you all to this global nursing event. Now I'd call upon our first keynote speaker. Professor Mr. Ashokan R. is currently working as a head of department, medical surgical nursing, and in charge of research and development, Kalinga Institute of Nursing Sciences, KIIT, deemed to be University, Bhubaneswar, Odisha, India. He has more than 15 years of experience in the field of nursing education and clinical nursing practices and has done many publications in national and international journals to his credit. He has attended international conferences at Sydney and also been a keynote speaker for many national and international conferences. He has been trained in various workshops. He also holds the prestigious membership in various nursing associations. Over to you, sir.
Thank you so much, ma'am. So kindly allow to me to go for the slide presentations.
You can share from your side and start the presentation, sir.
So I hope so. This slide is visible for everybody. Yes. So I'm audible. Whether my voice is audible?
Sir, you're audible, sir.
Yeah. Thank you. So before starting my presentations, I'm so much thankful to the SFNP, BioLeagues, academic partners of this 4th International Conference. I'm so much happy I am being a keynote speaker for this first presentations. With that, I am starting my presentations. Being a nurse, we have to improve each and every day because changing environment, global is changing the needs and the demand. So we also should change ourselves to fulfill and we have to excellence in our practices. For that, the one nurse, not all the nurses, we have to take the step forward. When we have the complete confidence, we have the risk-taking attitude. If we are taking the next step forward, we can go for the greater height in our professions. So that attitude, that courage, it should need for everybody. So then only you can go for the different heights where the other professions will see that nursing is this much improvement. So my topic is that elevating the scope of nursing practices. Myself, Professor Ashokan R, Department of Medical Surgical Nursing, Kalinga Institute of Nursing Sciences, deemed to be University, Bhubaneswar, India. So before going for my presentations, I'm so much thankful to my Honorable Dr. Achyuta Samantha, founder, sir, Kit and Kiss, who is taking care for that more than 60,000 children by providing the free educations completely and food and accommodations, everything. I'm so much thankful, sir, for being a great social reformer. So we all know that very well that the heart is an important organ in the body, which is helping to pump the blood from different part of the body and it's reaching equally without any disturbances. How it is possible? Heart is pumping with the different branches which is helping to reach the blood in different part of the body. So then only it is equal distribution is all over the body. That's why that growth and development is taking place. The same like in nursing profession also, we need for the equal distributions. And we need for the different branches where we can able to provide for the quality and excellent care in all over the world, which we need for the clear planning and directions. So what is the nursing practice? We are in the proportions, we are doing that, and we are taking care for the patients. So it's a general term where used to tell for that nursing practice is underpinned by the values that guide which the nursing care is provided for patients or the needed persons. As per the American Nurses Associations, which provide for the leadership is determining the goals, objectives, and professional practice of the nursing. Where the American Nurses Association is given for the definition that a caring-based practice in which process of diagnosis and treatment are applied to the human experiences of the health and illness. This is the definitions where it is given for the nursing practices. So another definitions, that's Oncology Nursing Certifications Corporations given that the nursing practice may be a work experience that is direct and or indirect patient care in clinical practice, nursing administrations, educations, research, and consultation in the specialty represented by the credentials. So this is only the definitions which is given by the latest, that is 2021, where the nursing practice. So why we have to know and what we have to know about the scope of nursing practices. And before going for the scope of nursing practice, we have to know what is the scope of nursing practices. As a nurse, where we are practicing and giving care to the clinical area, where we will have for the different range of the roles and functions, responsibilities and activities, which a registered nurse is educated, competent, and have the authority to perform. So that's the scope of nursing practices, which will give for the level of professionalism as demonstrated by the behavior and attitude of the nurses, how we are handling, which way we are giving care to the patients, how we are seeing the environment surroundings. So what are the scope of the nursing practice according to the ICE? After completing for the entry level of the nursing professions, the nurses will have for the many confusions. What we have to do it, which side I have to go for that, which will give for the good directions for me. So there is so many confusions are there. So finding the scope of nursing practices and we have taking the right directions is very important. Here, the scope of nursing practice is not limited to the specific tasks or functions or the responsibilities, but it is a combination of the knowledge, judgment, and the skill that allow the nurses to perform direct care, giving and evaluate its impact, and advocate for the patients and for the health, supervise and delegate to others, lead, manage, teach, and take research and develop health policies for the healthcare systems. So mainly the scope of nursing practices, which is dynamic and responsive. Why it is dynamic? It's changeable according to the changing environment. We have to more dynamic in that according to changing environment, and we have to take the responsibility and accountability for the providing complete care according to the changing environment. So changing the health needs, knowledge development and technological advances. So we have to review ourselves periodically to understand that what is the scope of the practices, which is needed for the current situations, which is essential to provide for the excellent care for the needed or the communities, which will support for the good health outcomes. And also the scope of the practice, which will be sufficiently broad and flexible to permit the freedom for innovations, growth and change. Where we are having the freedom to the innovations, then only will come out for the new outcomes or the new innovations, which will guide for us to go for the more sophisticated way of giving for the excellent care to the patients and the communities. So this understanding the scope of nursing practice, we should know that what are the factors will influence for that. Without understanding the factors influencing, directly going for the scope of nursing practices, it's a little difficult to understand. So before that, we have to understand what is the factors that will influence for that. There are so many factors out there. The political factors, social, environmental issues, economics and trade, legal traditions, and healthcare system and cultural norms. Other than that, there is a contextual factors also, that is increasing specialization and diversity of the practice settings, increasing patient acuity in all health and social care facilities, and also advanced and expanded nursing practices. So these are some of the factors, and additionally some more factors also there which will influence for the scope of nursing practices, like health workforce shortages. Yes, still after COVID, we are facing for the workforce shortage to give the complete care as per the need of the societies. So we need for the more manpower to give the complete care for the needed persons. So that workforce we have to develop it, and we have to get it, and we have to maintain, and we have to ensure that we are providing for the adequate manpower, providing the needed persons of care adequately. And second one is a workforce planning. We have to plan properly for that. We have the complete data that how many nurses are there, how many are from graduate, how many are postgraduate, the different categories. These details we have to have. Based on the details, we can able to plan for the workforce according to the need. Either should go for that any task which we have to perform or which we have to go for that, we should have for the workforce planning. And next one is the task shifting. Yes, the changing environment, technological advancement, and presently that aging populations increasing. There is a many numbers of the non-communicable diseases, mainly for the chronic conditions, where it is increasing. It's making for the task shifting for the nurses, which we have to turn it into the what we are doing to that. We have to focus for the other areas. So this is another influencing factors. And next one is the new cadres. In coming to the nursing, there is a many unregulated healthcare workers also is there. So who has to do for the what task in the clinical area? The professional nurses will do for the professional activities. Unregulated healthcare workers, they will carry out for the other activities, like example management, leadership, certain areas which is needed to help for the nurses to come out for the good quality of the care. So the new cadre is another factors which is influencing. And next one is the technology and the healthcare delivery. So information communication technology advances which will make for the nurses should be more advanced, changing environment. Now presently we are having the 4G connectivity. Next, very soon we'll come for the 5G connectivity. So after 5G connectivity, the changes how the world is seeing that healthcare professionals, it will be completely will change. So we have to ready for that, how we are going to handle for that, the need and expectations of the for peoples or the community persons. So we should be very more advanced, and it should be technologically very strong to handle for that. So these are the certain factors which will influence for the scope of nursing practices. There is one of the study which is conducted, that's in 2022. That's the scope of nursing practices as perceived by the nurses working in Saudi Arabia. This study was measured the scope of practice of the nurses in Saudi Arabia, where they have used for the descriptive cross-sectional design among 922 nurses. The two categories they have assessed. One is a low complexity nursing task, and another one is a high complexity of the nursing task. Where the low complexity of the nursing task, which is shown that insignificant differences to no matter the nurse's positions, but where the practice Bachelor of Nursing in and advanced degree nurses than the diploma education. And another same category, that's high complexity of the nursing task, where it is practiced significantly more on the postgraduate prepared nurses than the diploma educated nurses. So it shows that the range of variation nursing practices and that the lack of internal regulations has no effect on the nursing duties. So this is one of the study which is showing about the scope of nursing practices. Now coming to the how should they elevate the scope of the nursing practices? Yes, we have to elevate the scope of nursing practices because we have to focus all over the world to give for the complete and excellent care to the everyone needed persons, and even the making for the preventive aspect of the care. So how should elevate the scope of nursing practices? There's so many factors are there under that. The first one is that belongs to the associations. I'm a nurse. We are the nurse. We should belong to the associations. Why we should be belongs to the associations? Where we can able to attend for the many meetings, the chapter meetings, and we can able to gain the more information, more detailed, the updated information which is presently existing, And these societies are which association, what they are focusing for that, the improvement of the nursing practices, how we can able to make it ready ourselves to go forward for that in the increasing the scope of nursing practices. That is a networking where we have to focus for the future jobs and the references, which will helpful for the everyone to make it forward to go for the nursing professions. And second one is continuing your education. Yes, it's very important. After completing the first level, I should not stop it there only. I should go for the next level. Even after completing second level, I have to go for the third level. Why I have to go for that? Because when you are going for the greater height, then you can able to see for everything clearly. It's like microscope examinations, we can able to see for that. So we can able to rectify the problems and we can able to plan ourselves to the improvement of the nursing practices, how we can make it forward to the nursing professionals. So that's why we need to continue for our educations. That will help to everyone to stay up to date with the knowing the each specialty or the different professionals where you want it in the particular area. And you have to take for the different courses, it may be online or offline, or you have to go for the many seminars, webinars, conferences, and the workshops, which will give for the more recent information, which we can able to update yourself, and you should be trend in the societies. And you can advance your degree after BSc, MSc, after MSc, you have to go for PhD. Like that advances your degree. After the degree, PhD, you have to go for the postdoctoral degree, like that. It will be more advanced for the making the nurses, nursing professionals. So whenever you go for the whatever you decided, I'm going for the particular course or the particular degree, it's very important to learning the new skills and obtaining the new degrees. That's very important. So that's why now India is focusing for the skill development instead of other areas focusing for that. So that should make for the well-rounded development for everybody, even the nurses also. So where we can able to focus complete or the comprehensive care for the patients. This is the second one. Third one is a mentor new nurses. Yes, mentoring is very important. The person who is coming to the professionals, we will need to give for the guidance and take the persons to the forward. How should go for the next levels? So on the job, more formally through the colleges where we are using for the mentor to help to the juniors or the subordinates to make it to the higher levels, or giving the hand to the come up forward to the persons. And by teaching what we know, the mentor actually learns more through the questions and explaining procedures and the process. It's very important, the crucial in bringing the next generation of the nurses to the practices. Why we have to do the mentor? Yes, it's very important. Because I said recently that the technological advancement, where environment is changing. Earlier, no internet connections, no computers. That situation is different. Now, internet is there, computer is there. 2G become 3G, 3G become 4G, 4G become 5G. It will go on that continuously. So, how much advances is coming in the societies, we have to update it ourselves, which need for the guidance and counseling, and we should give the support from the elder person. So, its mentoring is very important, where it will make for the positive experiences and others. And fourth one is the write letters. It's another importance. Yes, when you are working in the clinical area or any setup, we are facing the many problems. Or with the other group of the my own colleagues with that I am facing the problems. I have to intimate to the persons who can able to change the problems, the policy makers. Then they will aware that yes, the nurses are facing this problem. We have to rectify these problems. So that's very important to write the letters. That's a stopping ratio, it may be, or other issues which we are facing in the job. And it will make for the perfect position to speak up to the held great changes in the policies. It will make for the better proportions compared to the which is existing presently. And next one is to continue to project the professional image. We all know that nursing images earlier and before Corona or after Corona. We may aware very well that during the Corona, where there is no preventive measures, there is no treatment, there is no vaccinations. The world is believing and trusting that the healthcare professionals, and especially for the major health professionals, is the nurses to come forward to giving and taking care for the situations. So the nurses image was increased, and now presently is greater level is we are in the images. So this image we have to take for the next level. We have to develop and we have to promote in the next level that images of the nurses. That should be do for the continuously and uphold our reputations by using our code of ethics. And another important is the social media presence. Yes, nurses, we are the nurses, but still when you are posting anything in the social media, we have the concern that we are the nurse, what we are doing, whether it's right or wrong, whether we have to do it or not. Because that will reflect in the image of the nurses also, for not only for one, every nurses. And look and act like a professional person in 24/7. Yes, it's another important. We have our own responsibility and accountabilities. We are incorrect and we are in the straightforward. Nobody will ask you anything that why you are wrong or what you are doing that like that. So we should be very perfect in our professions. We should be a role model for the other professions where we can able to improve for the professional image. And even when you are working in the working in the clinical area or in the hospital setup, we have to be a professional appearance is another important, like good grooming and work wear appropriate with the professional persons is very important for to maintain for the professional image of the nurses. And next one is to consider the specializations. It is very important where we are to moving towards the general to the specializations. When you are completing the BSc or GN, we are the general nurses. But when we are moving to the master level, when you are going for the PhD, where we are more specialization to the persons, that will make for the narrow focus on the particular aspect, which will give for the more depth to understand where we are not focused, where we want to focus more detail to understand that. So that's why it's very important to focus for the specialization. Yes, now present environment, present society is expecting that not only for the doctors should be a specialized, nurses also should be specialized to take the care or give the care to the patients. Yes, I am the patient for certain condition means I need for the particular specialized nurses only to take care for me. That expectation, that changes, that trend it's going on presently, that will make the changes in the future also. So we should be ready for that to handle that. And becoming certified in your specialty area will help to advance your practices. And follow the nursing blocks is another importance. The seniors are the dignitaries that are higher level persons in the nursing profession, leaders are the supervisors. The thousands of the resources which is available, they are writing the blocks. So we have to follow that nursing blocks, which will give for the clarity that nursing means what, nursing what you have to do it, how we have to shape the nursing, how we have to take the nursing to the next level. This will give for the pulse on the industry news. We can able to understand presently what is existing, what the changes, what is the trend, what the nursing profession is moving towards that. So what we are expecting to change for in the societies. And it will demonstrating for the leadership and industry awareness begins. And it will give for the cutting edges idea in the nursing practices, where we can able to more aware about it. That's the reasons we have to follow for the nursing blocks. And talk about your ambitions. This is another importance. Where we are working in the clinical area, being a nurse, sometimes I may be frustrated working environment or working certain department because I'm not interested in this department. I'm interested for the other department or other areas. So as a supervisors and as a juniors, you both have to mutually talking, or you have to talk with your seniors or the supervisors. They will understand your interest. And they will try to make you where you are more interested, there will place for that when you are appropriate in that situations. So that will help you for the take you in the great opportunities that the great height for in the not only for you in the profession also. So and it should be placed on the committees within the organization to get know about the nurses from the different departments, to understand the roles and the interested of the persons who is working in the different areas. And experiences different nursing units. This is another importance. Why different units? I became a leader. I want to be a supervisor. I should be expert in my particular field. First, basically, I should start with the general. When you are general, I should be choked with the different department. I should know, understand that all the areas properly. Then I have to go for the narrowing of my proportions. That will make for the more valuable information, more valuable outputs for the hospitals. So then only I can able to control and manage for the all areas, which will give for that handling the so easy, and I can able to lead the whole groups. That will be make for the better outcome for the nursing professionals. Look into the continuing education opportunities. earlier I said that we have to focus for the continuous education opportunities. It may be any form. We have to always try to update ourselves. I want to note it here that many times I have seen that the nurses who is completing the BS nursing or GNM nursing, the particular year what they have learned, nursing diagnosis, framing or writing for the nursing diagnosis. They are still after many years completing also their level writing of nursing diagnosis same only. Where it is updated also, it's not changing. But it should need to change in the changing environment. That should need for the continuing education. So we have to see the opportunities in the form of the seminar, webinar, conferences, online educations, offline educations, advances of the courses. Many things are there. So we have to cover for the new advancements, techniques and practices for the nurses. That will make for your the greater height in your proportions. And decision makers are looking to the nurses who can transition their mindset and ready to hold the new challenges. And it will give further great confident to you to take further step forward. I am ready to take further responsibility. I am ready to take further risk to handle further certain things. So that attitude that we are thinking to the nurses, we have to create it by doing further continuing education opportunities. And completing more some professional development around the non-clinical areas is very important, because we are only focusing nursing, it's not only enough. We have to focus for the non-nursing area also, which we need support for the give better or the excellent care to the patients. For example, leadership, educational skills, communications, conflict management. There's many areas are there where we have to focus that area also. Take the next step in college education. Yes. Yeah, I completed for the BS nursing. I should not stop it there. I should go for the next level master degree. Why I had to complete for BS nursing? It will give for the opening door and become a professional imperative for me. And going for the next level master of the sciences, I became a better qualified for the leadership and managerial positions. Still, I'm going for the next level, the doctor of nursing practice. It will influence the high level policy changes in healthcare. I will do it with the other association or group of the members to make for the policies to take the nursing should be in the next level, where it should need further the level we have to improve in one level to another level. It should need for the best nurses and the leaders. And the leaders or the best nurses do not always have for the long list of the credentials behind their name. It should exhibit only the excellence in their own work. That will make for the next level of the nursing profession. And nurses can raise the level of the nursing professionalism. How we can raise the professionalism? By way of the behavior, the attitude of the seeing the patients, the patient attenders, environment, societies, co-workers, and the other area also, how we are seeing for that, how we are behaving, how we are handling, how we are disciplined, doing the activities, taking the responsibility, accountabilities. That will make for the nurses to the professionalism. So that we need of the aware where the present societies and future also will expect from the nurses. So you should be a way how you have to handle for the persons. And next one is the food caring first. What is the food caring first? Where you have to genuinely care for each patient. We are doing, but still we have to take care for these areas. Completely we have to genuinely care for each patient. Where we have to accept the patient as a unique, respect his individual rights, meets all his physical, psychological, social, spiritual needs. Where it will include for the respect for the dignity, irrespective of the nationality, race, creed, color, age, sex, politics, and social status. And be professional, responsible, and accountable. Why you have to professional, responsible, accountable? Somebody is trusting on me, trusting to me. I can able to do it. I can able to take care of that. I can able to do it for better or the excellent way. So that responsibility and accountability we have to create it. Automatically trust will come for that our own professions. From other than that, other professions also to that nurses. That means no longer seen as a subservient to the medical practitioners. We are the independent practitioners. We have to develop ourselves to be more responsible and accountable to my own profession. So you have to use the initiatives and take decisions. That's a risk-taking attitude, risk-taking behavior. I am ready to come forward. Uniqueness, individualities. leadership qualities, come forward for that any of the activities. This type of the activities which will make for the more professional and the responsible and accountable. Next one is to develop and maintain the professional standards. We have our own code of ethics where we have to follow when you are in the taking care of the patients or in the communities. So the nurse's responsibility to continue to evaluate their own practice again to set the standards. So why we have to set the standard? Changing environment, needs and demands is changing, the technology is improving. So we have to review ourselves that standards which we want to practice, which we want to change it according to the changing environment. This commitment to the quality patient care, the nurses should strive to the continuously raise those standards. And next one is to maintain the professional competency. The skill India, we are telling that many times. What is the skill India? The competency. The best quality of care the patient is only possible by nurse accept the responsibility for increasing our professional knowledge and developing for the new skills and keep up to date in the practices. Then only it will make for the person should be a professional competent, where the person can able to inquire the mind and learn all the times. No limit learning to the required for the CPD points of the registrations. And next one is a participant in the professional affairs. We have to participate in the professional affairs where we can able to update ourselves. We become a member or we become an active participant in the promoting the profession and addressing the current issues in the nursing and healthcare. Where in the professional groups, for example, nursing associations, societies representing different nursing specialties, are more successful individuals bringing to the change through the voice of the members. And active in professional groups and sharing your experience, which will make to give for the professional development and recognitions, where the people will understand the nursing means what, the nurses are doing what, where they are in their height. That will make for the greater height to the nursing professions. And next one is make a differences. Yes, this always is very important. So today is not stable for tomorrow. Today what you learned is not updated for tomorrow. So we have to make differences. We have to change ourselves. How we have to change that to contribute to the future of your professions. How we should contribute? We have to take for the forward-taking attitude or the behavior. That what you as a nurse do or say does make a difference. We all should be always be proud of the nurses. We should not the shy or should not hold. I am telling as a nurse in the public forums or in the public platforms. So always look and you should feel yourself being a nurse. I should be professional. I am not dependent for anybody. I am the independent practitioners where I can able to give the complete care to the patients because of I am a nurse. Next one is the changing state regulations. This is another importance. The autonomous practice of the nurse practitioners, which will give that more clarity for the persons, that regulatory bodies will give for that. What is your roles and responsibility and activities you can carry out the particular areas at the particular geographic location. So most commonly it is a nurse practitioners, but also it will include for the certified nurse midwives, certified registered nurses, anesthetists, and clinical nurse specialist. So where the institutional barriers for the other nurses, for example, registered nurses, licensed nurses, practical nurses, to allow them to practice to the top their educational training. Still, if you are telling in India, there is a restrictions are there that independent practitioners, we cannot able to completely go to give care to the patients. It may be community center or in the clinical center. There's the restrictions are there. That restriction should overcome. We have to remove that all the restrictions. Give for the complete independent to the nurses, where can able to give for the complete care to the nurses. For example, prescribing medicines, diagnosing a patient, providing the treatment independent of the physicians. Even when it is allowed, there are administrative burdens which will not allow to do for that nurses. So we have to overcome for this all the things which we can able to take for the our scope of the nursing practices in the next level. And increasing the access to the high quality care. Yes, the patients and the community and the society is expecting for the high quality care, where earlier is a generalized nurse, now they are focusing for the specialized nurse. We also should ready to give for the specialized care to the needed persons, that's high quality care. So in these aspects, where we have to focus more significantly, more importantly in the rural area, where it is not focused that much adequately, where especially the rural and underserved communities, where the physicians are not focused, the nurses can able to focus that area to improve the nursing practices to the next level. And reducing the administrative burdens. Many times the nurses are not able to provide a complete care to the patient, raising the administrative burdens. So this administrative burdens, we have to reduce it. Earlier I said that the non-responsible nursing personnel, unauthorized, unrecognized health professionals, we can utilize for this administrative areas where the nurses will be completely freedom. They can able to focus to give for the complete care to the patients without any disturbances. So they can able to move to the different area to treat the patients, to cover the nurses completely. So that should reduce that administrative burden for the nurses. And improving care access through the workforce. How we have to improve the care access? Significantly have to boost for the primary care efforts, mainly for in the low income areas or low income places. And we have to focus for the deficit in number of the primary care providers, meeting the needs of the population is another important. And main important, we have to empower ourselves being a nurse. We should have for the greater guidance. We should have for the greater guidance and great leaders under the supervisions and the directions. We can able to empower ourselves. That need for continuously to take the next level of the nurses to come forward and taking to the societies, see the greater height of the nurses. That is, the study was conducted in 2010. The studies that strategies for enhancing the autonomy and the control over the nursing practices. The clinical nurse autonomy and control over the nursing practices have been associated with increased nurse satisfaction and improved patient outcome, both elements of the healthy work environment. In this article is mainly focused for the strategies for the enhancing autonomy and the strategies for the enhancing CO, that is means control over nursing practice. So it will be describing the importance of the articulating expectations for the autonomous practices, enhancing competence in the clinical expertise, establishing the participative decision making, and developing the nurses' skills in the making decisions. In addition, we have this study is focused for the critical role of the nurse leaders and the need to work upstream to influence the social, political, economical factor affecting for the nursing practice are discussed. And another study, 2011, it was conducted, the future of nursing, that means leading change, advancing the health, where the nurses have the opportunity to play the central role in transforming the healthcare system to create the more accessible, high quality, value-driven environment for the patients. So in the system, we have to capitalize on this opportunity. However, the constraints of the outdated policies, regulations, and cultural barriers, and including those related to scope of the practice, will have to be lifted and more notable for the advanced practice registered nurses. So coming to the summary. So today presentations, we have seen about that. What is the nursing practice, scope of the nursing practices, what are the factors influencing the nursing practices, and how we can able to elevate the scope of the nursing practices. So if any doubt is there, clarifications, I'm ready to clarify for that. So I'm going forward. Coming to the conclusions. You have to decide it. Your professionals should be the comfortable zone professionals or the super professionals. The comfortable zone professionals where they will be stand their own comfortable area only. They won't come out from the comfort area to the risk areas. If you are standing in the comfort area, you cannot able to grow yourself. You have to stand there only. We can follow for the norms which is prescribed with that much only. So you cannot show that we are the higher level achieved or we are the greater persons anytime. So we want to go from the comfort zone proportional to the super proportional means we have to take the risk-taking attitude, risk-taking behavior, come forward, volunteerism, and leadership qualities we have to develop, and we have to make for the greater risk to the next level to the professions. Then only we can able to become a super professionals. That other professional will see that nursing is this much improvement or this much gone for the greater height. So this is very important, where we have to turn from the one level to the another level. It's very essential changing environment. These are also my references. Thank you.
Thank you so much, Professor Mr. Ashokan R. That was really a great presentation on elevating the scope of nursing practice.
Thank you.
Thank you, sir. Now, I would call upon our second keynote speaker, Ms. Maitri Chowdhury. Ms. Maitri Chowdhury is currently working as a principal, Nurses Training Institute, AGMC and GBP Hospital, West Tripura, Agartala, India. And she has 10 years of experience in it. She has a great academic record with gold medals in both UG and PG studies. She has been honored with many awards. She has also presented and published in more than 25 scientific papers in national and international journals, which is Scopus and Web of Science indexed. Over to you, ma'am.
Good morning. Am I audible, ma'am?
Yes, you are audible, ma'am. You can
Okay.
share your screen and you can on your video and start presenting.
Okay, ma'am.
Thank you. Ma'am, your
Yes,
voice
yes,
is
ma'am.
like echoing. I hope you have joined in two different systems. Make sure that one of the system is in mute.
Yes. প্রথম স্ক্রিনে প্রথমটা Good morning, ma'am. Good morning, ma'am. Am I audible?
Yes, ma'am, you are audible, but it is a bit echoing. Just look after it.
Hello.
Yes, you can start with your presentation.
Hello. Good morning, ma'am. Good morning. Hello, ma'am.
Yes, ma'am.
Hello.
Yes, you can start.
Is it visible, my screen?
Your screen is visible. You can switch on your video.
Video slideshow.
Your face is not visible to us, ma'am. The slide is visible. If you're not able to turn on the video, no problem, you can continue.
Slideshow. 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 Okay. Yes, ma'am.
Yes, you can start with your presentation.
Okay, ma'am. I welcome all of the participants for 4th International Conference on Nursing Science and Healthcare. Today is the 30th September 2022. That is virtual presentation in Malaysia. Theme of the conference is Leading Innovations and Pathways Transforming the Future of Nursing. The title of presentation of my that is removing barriers to practice and care. Myself, Maitri Chaudhary, working as a principal in Tripura Government College of Nursing. So I thank you for giving me a valuable and very important opportunities for presenting my topic. So I start with the Nightingale place. I solemnly place myself before God and in the presence of this assembly to pass my life in purity and to practice my profession faithfully. I shall abstain from whatever is deleterious and mischievous and shall not take or knowingly administer any harmful drug. I shall do all in my power to maintain and elevate the standard of my profession and will hold in confidence all personal matters committed to my keeping and all family affairs coming to my knowledge in the practice of my calling. I shall be loyal to my work and devoted towards the welfare of those committed to my care. In introduction, brief history of nursing. Nursing, it is an oldest and noblest profession focused on the care of the individual and families and communities for promotion of health, prevention, diagnosis, and treatment of disease towards maintaining optimal health and quality of life. Nurses may be differentiated from other healthcare providers by their approach to patient care, training, and scope of practice. Before the foundation of modern nursing, members of religious orders such as nuns and monks often provided nursing-like care. Modern nursing is began in the 19th century with the history of Florence Nightingale. Florence Nightingale, she is the pioneer of modern nursing and arrived in Crimea in 1855. She is renamed as the Lady of the Lamb after the Crimean War. There are two distinct approaches of care: interdependent, that is with physicians, and independent as nursing professionals. In addition, they educate the public and promote health and wellness. Nurses comprise the largest component of healthcare, but the traditional role of many nurses providing care within the widening scope of physicians has shaped the public image of nurses. Nurse practitioners are qualified with highest degree in advanced nursing practice and eligible to practice independently in different healthcare settings. The greatest nursing theories and their contribution towards the nursing care and practice. There are the many theories and the leaders of the nursing. The first nursing theories appeared in late 18th century with a strong emphasis was placed on nursing education. In 1860, Florence Nightingale defined nursing in the environmental theory as the act of utilizing the patient's environment to assist him in his recovery. They put the patient in best condition, the nature can act upon him. She also found there are 5 important environmental factors: fresh air, pure water, efficient drainage, cleanliness, sanitation, and direct sunlight. Then in 1952, Hildegard Peplow introduced her theory of interpersonal relationship that emphasized the nurse-client relationship as the foundation of nursing practice. Then in 1955, Virginia Henderson conceptualized the nurse's role in assisting sick and healthy individuals to gain independence in meeting the 14 fundamental needs of people. In 1960, Faye Abdullah published her work typology of 21 nursing problems, that is patient-centered approach. In 1962, Ida Jean Orlando emphasized the reciprocal relationship between patient and nurse and meeting the patient's immediate need for help. In 1968, Dorothy Johnson pioneered behavioral system model fostering the efficient and behavioral functioning of the patient to prevent illness. In 1970, Martha Rogers viewed nursing as both science and arts. In 1971, Dorothy Orem stated in her theory that nursing care is required if the client is unable to fulfill biological, psychological, developmental, and social needs. In 1971, Imogen King's theory of goal attainment stated nurse-patient relationship is the for meeting goals towards good health. In 1972, Betty Newman theory of stress reduction is the goal of the system model for nursing practice. In 1979, Sister Calista Roy viewed the individual as a set of interrelated systems, maintain the balance between them. In 1979, Jean Watson highlighted humanistic aspect of scientific knowledge and nursing practice. So we have seen that there are so many nursing theorists. Previously, they have founded the modern nursing as well as for practicing nursing in the various cities. And nursing encompasses autonomous and collaborative care of individuals of all ages, families, groups, and communities, sick or well, and in all the health settings. Nursing includes the promotion of health, prevention of disease, and the care of ill, disabled, and dying people, advocacy, promotion, and safe environment, research participation in shaping the health policy and in patients' health. The use of clinical judgment in the provision of care to enable people to improve, maintain, or recover health problems and to achieve the best possible quality of life. That was defined as Royal College of Nursing in 2003. Nursing is the protection, promotion, and optimization of health and abilities, prevention of illness and injury, elevation of disease, suffering through the diagnosis and treatment of human responses, and advocacy in healthcare for individual families and communities. That is the definition given by the American Association of Nursing. Who is nurse? The nurse is a person who has completed a program of basic generalized nursing education and is authorized by the appropriate regulatory authorities for practicing nursing in his or her country. The nurse is prepared and authorized to engage in the general scope of nursing practice, including the promotion of health, prevention of illness, and care of physically ill, mentally ill, and as disabled people of all ages and in all health care and other community settings, to carry out healthcare teaching, to participate fully as a member of the healthcare team, to supervise and train nursing and healthcare auxiliaries, etc. But there are so many barriers for implementing all these applications and scientific and principles of nursing, as there are so many barriers. So as per Indian Nursing Council, different category of nurses, these are ANM, GNM, BSc Nursing, MSc Nursing, PhD in Nursing, and other specialized courses such as nurse clinician, nurse practitioners, etc. Areas and setting of nursing practice includes the community and hospital settings, as well as cardiac nursing, orthopedic nursing, palliative care, pre-operative nursing, obstetrical nursing, oncology nursing, nursing informatics, telenursing, radiology, and emergency nursing. Nurses practice in a wide range of settings, including hospital, home, school, and pharmaceutical companies. Now, the nursing practice, what is nursing practice? Nursing practice is the actual provision of nursing care. On the basis of specific nursing theory, those who have prescribed the previous leaders and theorists of nurses implement the nursing care plan using the nursing process. That is to be patient-centered approach. Generally, 6 steps of nursing practice includes the assessment, diagnosis, identify outcome, then implementation, then evaluation. Then what is the barrier? A barrier is something such as a rule, law, or policy that makes it difficult or impossible for something to happen or be achieved. Or it may be any obstacles or parameters that limit the purpose of channel of communication between the transmitter and the receiver of the communication. The following are some of the main barriers, such as linguistic barriers, that is language barrier, psychological barriers, emotional, that is emotions like anger, frustration, humor can blur the decision-making capacities. Then physical barriers, noise, closed doors, faulty equipments used for communication, closed cabins, these are the physical barriers. Then physiological barriers include shrilliness of voice, dyslexia. Then technological barriers include sometimes technological advance, it may be the barrier of, in some cases. Then organizational structure barriers includes the most of these barriers arise because of misinformation and lack of appropriate transparency available to the employees. Perception barriers, that is different people perceive the same thing differently. Attitude barriers, certain people like to be left alone. They may be introverted, or they can show the positive or negative attitudes. Then it may also vary. The common barriers nursing personnel faced in their practice area includes the organizational aspects, shortage of nurse, heavy workload and hardness of work, lack of access to a rich library with nursing journals, lack of internet access at work, no cooperation by physicians. In case of individual aspects, there are so many barriers, includes the lack of time to read literature, insufficient proficiency in English language, lack of ability to work with computer, lack of autonomy to change practice, lack of knowledge, lack of amenities, physical and mental fatigue. Then barriers for implementation of evidence-based practice includes the lack of knowledge and skills to use evidence like research finding, misperceptions about evidence-based practice and research, time mismanagement, the lack of motivation, the lack of resources and training were the perceived barriers to the implementation of evidence-based practice, peer pressure to continue the practice that are stepped in traditional behavior that is done. Then barriers to professionalism includes lack of value for research in practice, lack of administrative support, lack of knowledge mentors, research report not easily available, complexity of research reports, lack of in-service and continuing education, variability in educational preparation, gender issues, historical influence. For removing all these barriers, first of all, we have to follow the qualities of a good nurse. Acronym qualities, that is Q for quietness, U understanding, alertness, or ability to inspire confidence, loyalty, love for the fellow man, intelligence and common sense, technical competencies, integrity, that is in theory and skills, and then education, empathy, sympathy, and self-reliance. Then how to remove these barriers? First of all, we have to identify or assess the barriers with a particular system, setting in a particular system. Assess baseline knowledge, attitude and skills, beliefs and behaviors regarding evidence-based practice. Practitioners must possess basic knowledge and skills about the evidence-based practice. Then application of team nursing approach in anywhere where there are practice issue or caring of the individual. Then use of dynamic practice model, that is nursing practice model, that is nursing care model. In anywhere where there is a chance for caring the patients or individual, whether it in community setting or in hospital setting. Then apply scientific principles while applying the or planning care for a patient's, whether it may be in community rural setting or it may be in hospital. Then use of nursing process efficiently, that are assessment, nursing diagnosis, planning, implementation, and evaluation, and it should be the patient-centered planning. Then use of effective communication skill. Communication is one of the most important barrier, as we are the individual regarding the nursing personnel. So we have to be very much conscious about the communication skills, regarding communication skill, mainly the written communications, the non-verbal communications, presentation skills, active listening, then verbal communication, trust, personal connections, compassion, and patients educations, and education as a whole in general public. Then overcoming profession-related barriers to using evidence-based practice, incorporation of research finding into the curriculum, encourage participation in research activities, use of findings in various fields of nursing practice, initiate journal drafts, proposed demands on researchers. Researchers demonstrate the proposed studies potential for clinical practice, encourage student nurses to refer journals and incorporate in their practice. Then very recently, I have conducted a study that is ongoing, an assessment of barrier in nursing in Indian health facilities. And that is, I have used one survey questionnaires and Google circulation. Then only 45 responses till now I have received. Then out of these 45 responses, female respondent was 97.8% and male is 2.2%. Then regarding the age group, that is below 20 years, only 2.2%, and 20 and more above 20, that is 97.8%. And then regarding religion, among these 45 respondents, 84.4% they were Hindu, and other religion in 15.6%. Then regarding the educational background, from ANM 2.2%, GNM 68.9%, BSc nursing 20%, 6.7% that is MSc nursing, and PhD in nursing only 2.2%. And regarding the occupation, the 22, that is 48.9%, they were the student nurses. Then 31.1% means they were the government employee. Then 20% they were the non-governmental employee. Then regarding the barriers related to the available resources, that are lack of time to provide comprehensive patient care, that are agree 86% of respondents and disagree 16.3%. Then regarding language barrier to understand patient psychology, out of 44 respondents, 72.7% were agree and 27.3% were disagree. Then regarding unmanageable patient load due to staff shortage, out of 45 respondents, 95.6% were agree and 4.4% were disagree. Nurse confront a high risk of health hazards. Out of 44 respondents, 88.6% were agree and 11.4% were disagree. Then regarding emerging challenges among nurses due to lack of teamwork and harmonious relationship in the working setting. Out of 45 respondents, 84.4% were agree and 15.6% were disagree. Regarding long working hours hampered quality patient care due to exhausted state of mind and body, out of 45 respondents, 82.2% were agree and 17.8% were disagree. Then regarding lack of well-planned administrative policy for recruitment often lowered the interest of caring patient. Out of 44 respondents, 72.7% were agree and 29.5% were disagree. Then regarding barriers related to the administrative policy, that is less opportunities for higher studies is a major barrier to acquire up-to-date knowledge and skills for better implementation in caring patients. Out of 45 respondents, 84.4% were agree and 15.6% were disagree. The barrier related to the recognition, too many barriers to participate in research activities. Out of 45 respondents, 91.1% were agree and 8.9% were disagree. Barriers related to the recognition, that is lack of support system and recognition, leads to poor projection of nurses' performance. Out of 44 respondents, 90.9% were agree, 9.1% were disagree. Then regarding poor system of remuneration and less salary arise dissatisfaction among the nurses. Out of 45 respondents, 86.7% were agree and 15.6% were disagree. Shortage of resources often create a major problem to accomplish objectives of patient care. Out of 44 respondents, 86.4% were agree, 15.9% were disagree. Almost in all healthcare facilities,
ma'am.
nurses have to busy with non-nursing role. Out of
Excuse me, ma'am.
45 respondents, 60% were agree and 40% were disagree.
Excuse
Effective
me, ma'am.
communication is an important aspect of patient care. That is, out of 45 respondents, 95.6% were agree and 4.4% were disagree. So we have seen that the communication is the skill. We should improve our communication skill for removing all these barriers. Then application of leadership skills in nursing also helpful for
Excuse me,
removing
ma'am.
the
Please make sure that your
barriers in
PPT is
nursing
coinciding
practice.
with your presentation.
Then
Just look after whether your PPT is coinciding with your presentation. Ma'am, your voice was audible, but your PPT screen is not changing. Make sure that you sort it out. Ma'am, your screen is visible. You can go to the slide which you wanted to present and start presenting. Make sure that you're changing your slide simultaneously with your presentation. You can start from where you left, ma'am. No need to start from the beginning.
Okay, ma'am. Ma'am, now I'm audible.
Yes, ma'am, you're audible. Your screen
There
is
is
also visible. No, ma'am, no. You just make sure that you are changing your slide coinciding with your presentation.
Okay, ma'am. Now it's visible.
Yes, ma'am. Is it visible?
Then shall I start from beginning?
No need to start from the beginning, ma'am. You were being in that barriers nursing slide, na? From there itself you can start. No need to start from the beginning.
Sorry, ma'am.
Your voice and everything was audible. You can go to the from the leftover area. You can start. You can go to the end. You please go to around 20 to 26 slides. You
So regarding removing barriers, we have to identify the barriers. That's baseline knowledge, attitude and skills, beliefs and behaviors regarding evidence-based barrier. Practitioners must possess basic knowledge and skills about the evidence-based barrier. So then application of team nursing approach for removing the barriers in any settings of the hospital or it may be in community. Then use of dynamic practice model, that is dynamic nursing care model. So it can be used for removing the barriers in any settings. Then apply scientific principles in using the appropriate nursing process while caring the patients. Then use of effective communication skills for barrier. That is the effective communication skill is most important for any other any related to nursing care or any other settings like hospital or it may be in school, home or community. Then overcoming profession related barriers to using evidence-based practice, incorporation of research findings into the curriculum, encourage participation in research activities, use of findings in various fields of nursing practice, initiate journal clubs, propose demands on researchers that the researcher demonstrate the proposed studies potential for clinical practice, then encourage student nurses to refer journals and incorporate in their practice. Then recently assessment of barriers in nursing in Indian health facilities has been conducted by me and that is an exploratory studies. Then according to these studies, then gender that is out of 45 respondents, 97.8% were female and 2.2% were male. Then age group below 20 years, 2.2%, only the age 20 years below. Then 20 and more, that was 97.8%. And regarding religion, out of 45 respondents, 84.4% were Hindu and 15.6% were other religion. Then regarding the educational background, ANM 2.2%, GNM 68.9%, 20% were from BSc nursing and 6.7% were from MSc nursing and PhD only 2.2%. Then regarding occupational, breakdown, that is for out of 45 respondents, 48.9% were from student nurses, 31.1% government employees, and 20% were the non-governmental employees. Regarding barrier related to the available resources, lack of time to provide comprehensive patient care, out of 43 respondents, 86% were agree and 16.3% were disagree. Regarding barrier related to available resources, that is language barrier to understand the patient psychology, out of 44 respondents, 72.7% were agree and 27.3% were disagree. Then unmanageable patient load due to shortage of staff, out of 45 respondents, 95.6% were agree, 4.4% were disagree. Regarding nurse confront a high risk of health hazards, out of 44 respondents, 39, that is 86.6% were agree and 11.4% were disagree. Regarding emerging challenges among nurses due to lack of teamwork and harmonious relationship in the any settings, out of 45 respondents, 84.4% were agree, 15.6% were disagree. Regarding barrier related to administrative policy, that is long working hours, hampered quality of patient care due to exhausted state of mind and body, out of 45 respondents, 82.2% were agree, 17.8% were disagree. That is regarding lack of well-planned administrative policy for recruitment often lower the interest of caring of patient. Out of 44 respondents, 72.7% were agree, 29.5% were disagree. Less opportunities for higher studies is a major barrier to acquire up-to-date knowledge and skills for better implementation in caring patient. Out of 45 respondents, 84.4% were agree and 15.6% were disagree. And too many barriers to participate in research activities. Out of 45 respondents, 91.1% were agree and 8.9% were disagree. And lack of support system and recognition leads to
wakefulness of consciousness perceptual arousal transformation such as
लोगों में नहीं दिया था
medical.
हमारा कलेक्शन लोगों बाकी कर लिया
almost in all healthcare facilities, nurses have to busy with non-nursing roles. And out of 45 respondents, 60% were agree and 40% were disagree. Effective communication is an important aspect of patient care. Out of 45% respondents, 95.6% were agree and 4.4% were disagree. Then for removing all these barriers, you should apply the leadership skills in nursing also. Then or in organizational and system focused leadership, then patient focused leadership, then mentoring and coaching, then enhancing professional nursing practice, and facilitating collaboration, advocating. All these leadership skills can remove the barriers related to the nursing practice and care. Then in 2010, the Institute of Medicine released the Future of Nursing, and that is leading change and advancing health, which offers a series of recommendations pertaining to roles for nurses in the new healthcare landscape. That recommendations, one from the Future of Nursing, that removes scope of practice barriers. That is, advanced practice registered nurses should be able to practice to the full extent for their education and training. To achieve this goal, the committee recommended the following actions: expand the Medicare program to include coverage of advanced practice registered nurses service that are within the scope of practice under applicable state law. Then reform scope of practice regulations to conform the National Council of State Boards of Nursing Models, Nursing Practice Act, and Model Nursing Administrative Rules. Provide direct reimbursement to advanced practice registered nurses who are practicing within their scope of practice under state law. clarify the requirements for hospital participation in the medicine program to ensure that advanced practice registered nurses are eligible for clinical privileges, admitting privileges and membership on medical staff. Review existing and proposed state regulations concerning advanced practice registered nurses to identify those that have anti-competitive effects without contributing to the health and safety of the public. States to amend that to allow advanced practice registered nurses to provide care to patient in all circumstances in which they are qualified to do so. In conclusion, you can say the use of common strength of a nurses such as communication skill, caring and nature, empathy, critical thinking, patience, respectfulness, flexibility and versatility, then emotional stability, accountability and responsibility will be helpful to remove the all barriers in all aspects of practicing and caring patient. Continued work is needed to remove scope of practice barriers. This shift of policy and practice context, the future of nursing has created an opportunity for nurses, physicians and other providers to work together to find common ground in the new context of healthcare facilities. And these are the reference I have used. Some of these are here showing. Then thank you very much. Any questions? Hello, ma'am.
Yes, ma'am. Thank you for your wonderful presentation.
Thank you, ma'am.
Thank you. I welcome our next keynote speaker, Dr. Karpagavalli Nageshwaran. Dr. Karpagavalli Nageshwaran is currently working as a Dean cum Principal at Ganpat University, Kumud and Bhupesh Institute of Nursing, India. She has completed her graduation from Dr. MGR University, Chennai, and her post-graduation from Bharati Vidyapeeth University, Pune. And she has also completed her PhD from MGMIHS, Navi Mumbai. She has also completed her MSc in clinical psychology. She is a gold medalist in her MSc Nursing and was awarded as a Best Nursing Tutor by TNAI, Pune City in 2015. She has worked in various capacities in different hospitals and in College of Nursing nationally over her 20 years of experience, and has also done many publications in national and international journals and research presentations in national and international conferences. She is a peer reviewer, editorial member for many national and international conferences. She has attended, participated and organized team members and resource person in conducting conferences, workshops, seminars in various levels. I hand over the session to Dr. Karpagavalli Nageshwaran. Over to you, ma'am.
Thank you, Shushmita, for your wonderful introduction. Good morning, one and all. It is a privilege for me to sharing in such a professional platform. I like to thank SNF, BioLeagues and other co-academic partners to given me an opportunity. My slides are visible to you. Am I audible and my slides are visible to you?
Yes, ma'am, you are audible and the slides are visible. You can share your slide. Yes, you can put it on a slide.
Yeah, I'm sharing it.
Yes, ma'am, you can put it on the slideshow.
Will do. Is it okay now?
Yes, ma'am, it is perfect and you can continue.
Okay. Thank you, one and all. Today we are going to have a discussion on nurse leaders in boardroom. the skills what we have to develop on a successful board. Nurse leaders in boardroom. It's nothing about nurse leaders, because when we work or our profession prepare ourselves for a nurse leader. When we care for the patients, we determine what is need for a patient, we assess. These are analytical skills. These things help us to develop our leaders. Why? We have few outlines which we are going to cover in this presentation. Why nurse leaders? What is the need for an hour? How I can prepare myself? Why? Knowledge and skills. Because when compared with an earlier decades, now nursing is moving on to the knowledge and skills. Before GNM, EBBS, even education as well as in clinical sites. Now nurse practitioners course and advanced. Previous speaker has mentioned rightly that before we have dependently for physicians and other things, now we are focusing on independency in our practices. Skills, especially during COVID-19 taught us how nurses are technically also competent. Offline, online, both the blended modes also and telenursing. These are all the skills. Now we are enhancing it. Then scope of nursing. Scope of nursing is widened in a largest view in expanded and extended. I need not to go in and brief because from yesterday onwards, we are hearing about extended and expanded goals in many views. Then changing trends. That's what I have told you, mentioned previously also, from dependency to independency. Also, the client's awareness about nursing and nurses' image in the society. These are all the things makes us, we have to board on the rules. Need of an hour for an nursing to board on the rules, because reviews and research supports that in developed countries like USA, UK, 26% of nurse leaders boarding on their boardrooms, especially taking in decisions in policy making and other things. As a nurse, when we are taking care of the patients, ultimately, the patients are our stakeholders. Quality of the patients, patient satisfaction, and improve the healthcare. These are all the dimensions which need to be taken care, especially when we go for an NABH accreditations and ACT accreditations. These are all the platforms which were given key dimensions and given more importance. As a nurse, when we are taking care of the patients, we must know about the patients and we have to play a role in when we are taking care of the patients, as well as a nursing community, we have to take care of our too. So when we can make policies and other things, nurses boardroom is a need of an hour. There is one Curtis work, I like to quote it here. When you want to write a story, you have to hold your pen on your hand. Otherwise, if you give a pen to others, they will write their emotions and feel what you are expected, that cannot be done. When we nurses, we have to address our issues, our problems. We nurses should hold our positions. We have to raise for our things. Then nurse leaders in a boardroom. When we start with then junior positions like a staff nurses and other things, this is I was what it is. Currently, what position I have, I am. Then what I will be. When I want to become a nurse leader, how I will visualize the things. What is my future? What is my future for my professions? These things we have to keep it in our mind. The skills when we want to board it in the board. The previous speaker also rightly mentioned about the communication skill. Communication, it is an essential skill. Few things he has scored it, that is an active listening. As a nurse, we have to board on it. We have to understand the patients as well as we have to understand our team members too. Then nonverbal communication. This plays a significant role when we board on it. In reflections, understanding the problem and reflect to solve their problems. Then open-mindedness and non-judgmental attitude. These are all the few key elements in the communication skill when we put the things in the platform to make our colleagues or our panel to understand and accept and come for conclusions. Then introspection. introspections, we understand our own strength and weaknesses. Where am I good in communication? Am I good in leadership? Or where I need to improve? Because nurses are born as a leader or acquired as a leadership, both the way we can develop. Because nursing profession gives an n number of opportunity to develop our leadership qualities. So we have to introspect ourselves. What is my strength? How I can improve myself, both knowledge as well as in skills. Then emotional intelligence. Emotional intelligence is a key tool for the nurses when we take care of the patients, when we board for ourselves also. Emotional intelligence covers many dimensions, which includes first one, understanding our emotions, where I'm getting angry, where I can also, we should understand others' emotions too, how they will react, how the situations are. Then controlling the emotion, that plays on very, very important. If I'm getting an angry or trigger the moment of something, few of the time, example, when we go for an patients with the patient get an angry, we won't reflect on the patients with an angry. Same thing when we board on something, they discuss something, our emotion should be controlled. Same well as we have to understand others' emotions also. These things, this emotional skill, intelligence plays on very, very important skills that help us to progress our views and come for some conclusions when we boarding it. Then team management. What is my view and how I understanding my team and how I am making my team to understand my concepts or policies, which is good for an institution, which is good for an organization or any other point of view it. Then encourage the team, because positive rewards, encouragement, these few of the key elements, because as a human being, we expect rewards. If it is a positive rewards, if it is small things, say good, look, and appreciate them. This appreciation makes the person motivate to work ahead. Then interpersonal relationships. Interpersonal relationship, when we work in a team, it plays a very, very important. We have to understand, then we cannot be an dominant or we cannot be an autocratic. We have to have a transformer leaderships. We have to have a transformer ideas. That current trends, I also will learn, you also will learn. It isn't like a give and take policies. Our interpersonal relationship will play a very, very important role. Then critical thinking. In the critical thinking, here, I like to incorporate the problem solving thinking also. Understand, analyze the situation and where the problems are, how the problems can be solved. Also, how we can enhance our policies or how we can come for a decision making. Ultimately, the organization goal is that output. The output of the hospital, that may be on patient satisfaction, output of an education institution, that may be on student success. So as a nurse, when we are in a nursing administration, patient quality care, patients satisfaction, this plays on very, very important. When we are in nursing education as an administrator, like a principal or a dean or a professors, our ultimate aim will be on stakeholders, that is preparing and student nurses and leading student nurses their success. Here we have to encourage research too. Research, it is an evident practice that helps us adding the knowledge to the profession as well as adding the and motivating ourselves to finding new for something. These are all the few skills which help us to board ourselves successfully and help us to making decision making. And few skills, the American Nurses Association status that focus on excellence, that is very much important. That's what I have mentioned in the previous slide, what I was, what I am, what I will be. Okay, today we maybe have a little less skills, but what is my vision of that? Focus on excellence, target important tasks, that we have to prioritize our needs. What is very essential, and less essentials. Then cultivate new leaders. as a nurse leaders, it's our responsibility to bring in young leaders and prepare next generation to leave a footpath for our profession. Then establish individual accountability. We should make the persons to be responsible, also accountable for their work. Acknowledge and reward success. That's what I have told. In the interpersonal relationship, acknowledges the person's work, what it has done, then we have to reward them. Then embrace advanced education. We have to motivate ourselves as well as our colleagues, our co-workers, go ahead for their professional upliftment. This is also ultimately helping them for their personal development too. 6 ways nurse can develop their leadership skills are: work on strengths and weaknesses. That's what I have mentioned in the introspections. Be positive and enthusiastic. Optimistic attitude, it is a key tool to success in the personal as well as in a professional life. And enthusiasm. Enthusiasm, it is a blossom. It's a flagrant. It's help us not to be an active for ourselves as well as our environment too. Maintain your morals and values. Morals and values are key to help us to develop ourselves as well as our professional development. Develop an excellent communication skill. Nurse works with people, so communication skill is a primary tool for a nursing and nurses to carry for their professional. Continuously expand your knowledge. Knowledge and skills are a changing scenario. Health is a dynamic process and health is a dynamic profession. So as a nurse, it is our moral responsibility lies. We have to update our knowledge and skills. Join professional and community organizations, because like joining and professional organizations, communities help us to have a professional contacts, help us to have develop our knowledge as well as skills. Thanks for your timing. Any questions, I like to answer it.
Thank you
Any
so
questions
much,
from?
ma'am. Thank you so much, ma'am. That was really a wonderful presentation. Any questions from the audience? Thank you, ma'am. We now move on to our next keynote speaker, Mr. Ravi Barot. I welcome you, sir. Mr. Ravi Barot, currently working as an associate professor at Ganpat University, Kumud and Bhupesh Institute of Nursing, North Gujarat, India. He has over 8 years of experience in the field of nursing and clinical nursing. He has done many national and international publications and paper presentations in national and international webinars and conferences. He has also conducted and organized international webinars and conferences. Over to you, sir.
Thank you, ma'am. Am I audible?
Yes, sir, you are audible. But one request, I hope both the system is showing the Unmute session.
Am I audible, ma'am?
Yes, sir, you are audible. You can share your slide with the slideshow and you can proceed with your presentation.
Good morning, all respected dignitaries present in this fourth international conference and also all the delegates. It's a proud privilege to be a part of this conference as a keynote speaker on the topic of future nursing leadership. Before going to the session, this is my outline of the session: limbs of leadership and nursing leadership, function of nursing leader, quality of nursing leader, current scenario in nursing leader, need for changes in nursing leadership, future of nursing in the different areas like nursing education, nursing practice, community nursing, nursing research, and various challenges in the leadership on nursing. Nursing practices has come into existence over the 100 years of ago. With the pass of the time, nursing practice and services become more refined, and the roles and responsibility are changing accordingly. The nursing practice, even leadership, is still
Excuse me, sir.
for...
Sorry to interrupt.
Yes.
Sorry to interrupt, sir. So we are hearing some echo from your side. Any one of the system you mute it and reduce all the volume. The system which you are using for the screen sharing, just mute the system and reduce the volume fully, sir, so that we can avoid the echoing. The volume should be on for only the system which you are having the video on.
Now is it okay?
Yes, sir. You can click over slideshow and present.
Yes.
Thank you, sir. Thank you so much.
Nursing practice has come into existence over 100 years ago. With the pass of the time, nursing practice and services become more refined, and the role and responsibilities are changing accordingly. The nursing practice, even the leadership, is still striving for more excellence, for making the services more benefiting to the needs of the society. A forethought of what the future of nursing leadership might be essential to modify professional attire. So today we are going to have a session on future of nursing leadership. This is the outline of the session. Now, before going to the further slides, we have a eye-opening video of Dr. APJ Abdul Kalam sir for the leadership. So have a look of this.
ఏ రోజు తీసుకుందాం మనం ఒక్కటే కూడా
Excuse me, sir.
Yes.
We could not see your video, sir. It is still in the outline of the session.
Now, is it okay?
I was highly frightened. I will be the culprit because I am the project director, mission director. What Satish Dhawan said, Chairman, Indian Space Research Organization, said, dear friends, we have failed today. This is the first time I have to give all the success, all the failures. I want to support my technologists and scientists and staff so that next year they succeed. So he took the whole blame himself. And then media asked, you have put Bay of Bengal so many crores, you have put it like that, lot of criticism. He received the criticism. He assured them in a year we will succeed with our team. It's a very good team. Next year, here only interesting happened. Next year, July 18th, 1980, when he succeeded, Professor Dhawan said, you go and conduct the press conference. Do you follow what it means? It means when the failure occurred, the leader took it up. When the success came, he gives to his team. That's the first thing that happened. Next year, July 18th, 1980, when he succeeded, Professor Dhawan said, you go and conduct the press conference. Do you follow what it means? It means when the failure occurred, the leader took it up. When the success came, he gives to his team. That's the first.
So I think some interrupted video we have seen. I think I might be you are not able to, I think, have a vision of whole video. So this video, I am explaining about this video. So this video is explain about the true leadership of Dr. APJ Abdul Kalam, sir. So like in the first time, the failure of launching the satellites, he himself took the responsibility of the failure. And second time, when he got the success, he gave the credit to all entire efforts of the team members. It's a true example of transformational leadership. So this is what about the quality of normal leader, what we expect in the nursing leader. We become can we become a leader? Nurse, or we are questioning our in mind. Nurses leader is inborn or made. Which are the areas of nursing leader? So just to have a look of this all the question which is coming in our mind. So what is the leadership? So the leadership is the one who inspire, motive the action, having can-do responsibility, strong leadership skills, the key to leading the change. What are the function of good leader? If we will see the function of good leader, so these are the various key function and roles of the good leader. It's a visioning. Good leader is having a good vision for doing a task and even the team building. He is selecting a team as based on the vision, what he planned for the task. Then after that, the coaching of the team. So what all team members are there, he is involving in the coaching of the team members to guide them, to educate them regarding the completion of the task. Even he is empowering the team member to work as freely in the and freedom. Also, he is giving, even after empowering the all the employees or the team, he is promoting a quality function. He is expecting that the team member should have quality work. He is promoting the quality work. Even the valuing after completion of core work of the team is valuing the team effort which is made by the various team members. So these are the good function of the team leader. Now we have a view of the quality of good leaders. So what are the qualities of the good leaders? Different quality of good leaders. So like first one, intelligence is should be a good intelligence, or he is a good intelligence. He is a good critical feature that the maturity is mature enough to take various decisions in the various conditions. Even the patient he should have a good vision. Even the inner motives to do something innovative, to do something more efficiently. Even he is having a sense of responsibility of any of the tasks, maybe the failure or maybe a success. He should be having empathy and even the human relation attitude, having a good relationship with all the team members in the performing of any of the tasks. Then emotional balance in any of certain condition, in the failure or success, he will be a good emotional stability is having. So these are the qualities of the good leader. Good nursing leader, you will see also video which is really observed for some time.
Hello and welcome to Nurse Leadership Module.
These are the key components of the nursing
on
leadership.
key skills and competencies necessary for nurses to develop to be able to function as effective leaders. They do with their practice expertise. Regardless of the work position a nurse holds, may she be a staff nurse, charge nurse, manager, director, or educator, each one is to dismiss the idea of considering self as being just a nurse, rather is expected to provide leadership in any given situation. That said, nurses must be able to develop the skills and competencies that would enable them to positively impact patient care experience. Such skills and competencies of a nurse leader are as follows. Motivation and team building skills. A nurse leader must possess the ability to motivate and promote teamwork among nurses and other healthcare professionals. Plays a significant role in fostering a work environment through facilitating practices that would influence peers to take pride and feel ownership of what they do. Building a foundation for safety culture begins with high-quality training of employees and continues on with fostering cohesive interdisciplinary collaboration to effectively enhance both employee and patient satisfaction. A nurse leader must be able to create a motivating climate for the team, establish organizational communication, manage conflict, facilitate collaboration, engage in negotiation, and comply with organizational rules and regulations. Effective communication. Effective communication is a vital component of creating culture of safety within the organization. Accurate reporting and patient care updates is highly expected of nurse leaders, between nurses and physicians, with other healthcare team workers, and with patients and patients' family members as well. To become effective communicator, the nurse leader must be able to send clear message to the team, listen actively to the message being conveyed, monitor responses, provide feedback, and determine what receivers see and hear. Collaboration skills. Collaboration is an integral component of quality healthcare. As frequently defined, interdisciplinary collaboration is a process of interaction between two or more disciplines for which shared knowledge and ideas are studied or analyzed with the intention of coming up with the most reasonable and logical solution to a problem. A nurse leader must be able to create a supportive environment, develop a sense of success and establishment of an esprit de corps and interprofessional cohesiveness, and place value and understanding on the unique contributions of the other discipline's role. The process of collaboration usually results in a discovery of mutual goals with the patient's well-being as the primary focus. Critical thinking and problem-solving skills. According to Zacho Smith, nurse leaders who desire to succeed in times of trying changes find creative thinking and problem-solving abilities essential tools in achieving goals. Critical thinking and problem-solving is a major attribute in the field of nursing, as it helps the nurse leader in fulfilling their role effectively and efficiently. Critical thinking involves taking into consideration several details related to the situation in order to properly evaluate, analyze the case, and consequently come up with a sound logical judgment. A nurse leader examines assumptions, interprets and evaluates arguments, envisions and explores alternatives, develops reflective criticism to achieve logical decision, and she is expected to base her decisions on evidence. Effective delegation and evaluation skills. Another important component of creating safety culture is the nurse's ability to delegate. According to Waite, delegation is a skill that maximizes the available resources in the interest of patient care. This could entail having in-depth understanding of patients' needs and available resources in order to facilitate nurse-patient matching. An effective delegator must be able to understand what patients and families need, engage the appropriate caregivers in the plan of care, maximize the available resources on the patient's behalf, and be able to evaluate the outcome of patient care in order to make improvements when necessary. Visionary. To have a vision is to have a foresight of where, when, and what a nurse leader aspires to achieve for the team. That said, the nurse leader must be able to trigger inspiration among the team by conveying passion for the vision, rallying people around it, and striving to get the team to commit to the achievement of it. A nurse leader is future-oriented, insightful, strategic, shares dreams and visions to team members, and owns great perception of wisdom. Those are the key skills and competencies expected of a nurse leader. Apparently, the core foundation of healthcare practice and systems, including its characteristics, are vividly evolving in front of our very eyes. Come 21st century, nurse leaders will be facing many challenges as the patterns of healthcare delivery become more complicated across nursing practice. The increasing complexity in clinical practice attributed to the increasing demand for more improved delivery of quality care, as well as the high-speed emergence of system innovations, may cause pressure buildup among nurse leaders, especially if not equipped with the skills and competencies necessary to stand up for the role effectively. A nurse leader emerges into the role and take charge by leading the workforce in employing quality and safe nursing practice. Thank you for watching.
So this is the key competency of nursing leadership, what we have seen. So what is a nursing leadership as per Durham and Fisher? It put forward the following description for the nursing leadership: administrative competency, adequate education, business skill, clinical expertise, and an understanding of the leadership principles. So these are the various key components of or key competencies of the nursing leaders. Now, what is the current scenario of the nursing leadership? So nursing leadership play a submissive role previously, like nurses are working as an advocate, educator, counselor, and advisor and all. So now if we compare with the current scenarios, nursing profession plays a role of transformation leadership. And the transformation leadership, the changing in the role of nurses or nursing leader according to the current scenario and situations and the trends. Why the needs for change in the nursing leadership is that to continue or maintain the professional status of the nurses, establish their significance to the consumer society, changing in the nurse practice due to the technical evolution and advancement, changing in the essential to increase the competency to face emerging disturbances like COVID-19, last 2 years, what we have faced, even the bioterrorism, to bring a more competent nurses to the reforming the nursing education system, to practice more collaboratively with the other healthcare, to practice the evidence-based in calculating the latest research activities and nursing activities. So these are the needs for changing in the nursing leadership. We'll go another part of the future of the nursing leaders. So these are the different areas of the future of the nursing, like nursing education, nursing practice, community nursing, and nursing research. So these are the various areas where the future of nursing leaders are. So we'll see gradually one by one, like a nursing educator. So integration of the education and the practices. So there will be an integration in the theory and practice can help the leaders to bridging the gap between the theory and practice. So these are the various rules which the nurse in the field of nurse education, the nursing leaders are playing to bridging the gap. Even the blended learning, there are various new utilization of the learning for the student nurses, like a smart classroom and techno-friendly. The nursing leaders for working on it. Even the simulatory learning. And the simulatory learning, many medicals and nursing fraternity and courses, the techniques is utilized for evaluating the sequential learning process by like OSCE and OSPE methods. So these are also like a new revolution in the nursing education. And even the video conferencing, with the help of video conferencing, learning can be made very fast and feasibly. Even the no paper form, promotes the utilization of various applications like Edmodo, Google Class, then other applications such as changing the role of nurse leader in the field of education. Even the new education programs. So new education program, as we have seen, like revision of the curriculum and policy making in the nursing leaders, they are involving the nursing leaders. So recently we underwent the changes in the syllabus pattern of BSc nursing course. So in that the nursing leaders are involved, which is a true example of autonomy leadership in the nursing education field. Even the other programs like a doctorate in nursing practices, the European countries have started the doctorate in the nursing practices many years before, but currently India is implementing this this after completing the nurse practitioner course as a pilot project. Even they are promoting a super specialties. So India nurses is also implementing various super specialties for courses for the nursing leaders, like forensic nursing. Recently they have implemented in the new curriculum. So these are the various leading role which is there in the field of nursing education. We will see a various leading role in the nursing practices or in the future of nursing in the nursing practices. So nursing informatics. So in that nursing informatics, the nurses are having a leading role to utilize utilization of the technology for the client need-based care. Many healthcare awareness site also are being utilized, like a Medline and Sinhal and all. Even the e-health resources also utilized in the means of nursing informatics. So e-reports are maintained by the many medical and hospital management information systems. So the roles of the nurse are changing drastically. Even the telenursing. The telenursing, by utilization of the telemedicine technology to deliver a nursing care and conduct the nursing practices. These are also different role is emerging in the field of the nursing in the future of nursing leaders. Even the transcultural nursing. According to the transcultural nursing in today's society, where much respect is endowed to the culture diversity, nurses required to culture sensitivity, culture awareness to assess, plan, and implementation of the nursing care according to the client. Even the palliative care nursing. The palliative care nursing come into existence as a specialized branch of nursing. So a specialized branch of nursing focusing on the quality of the life of the patient. Even the hospice nursing. In that, the concept of the hospice nursing designed to provide a comfort and support to the patient and their family in life-threatening illnesses. So these are the various rules and new futures of the nursing leaders. Even the robotic nursing, many of the mechanical device with the intellectual abilities may come into being, who will be programmed such way to replace the actual human nurses, but they are not able to replace the nursing process or nursing practices. Even the genomic and genetic nursing, this in the future will make a genetic literacy regarding the genetic mapping and sequencing to treat the genetic disorders. Even the space nursing, in future of nursing leader may have to go on space expedition with the astronauts, as they have a lot of health problems during the space travel. Even the forensic nursing, the nurses also have an emerging role in the field of forensic science to deal with the legal issues which are arising in societies. Even the specialized nursing practices, in today's evolutionary and techno nursing world, the role are in the more specific in that nurses play a leading role in the healthcare, like a nurse lead diabetes care, nurse lead heart care, nurse lead midwifery care, and nurse lead interventions. So there are various specifications of the nursing areas or nursing practices which are emerging in the future of nursing leaders. Now we'll see about the community nursing areas. In that community nursing area, nurses play a leading role in the community health care settings. In that, firstly, the home care settings, so nurses also play a leading role in the community health setting. In the nurses are engaging in specialized home-based care in the providing a nursing care in the home care settings. Even the ambulatory care, nurses are also engaging with the healthcare and on the ambulatory basis at the patient side without delaying providing a nursing care. Even the family nursing, nurses also have a leading role in providing family nursing care. They are trained in the health dynamics of the family as a unity of the health. Now the community health officer, the nurses are also playing a leading role in the healthcare in the rural areas. They are working as a community health officer to resolve the health issues of the rural population. So these are the various leading role in the area of community nursing. Now we'll see the various role in the nursing research. So the transformation also observed in the leadership in the nursing research. So action research. So nurses are play a leading role in action research. The action research is undertaken by a large organization or institute, assisted or guided by a professional researchers with aim of improving their strategy, practice, knowledge within which they practice. Now, another one is biophysiological research. Nursing research also focuses on leading role of nurses in actual physiology and biological phenomena. Another one is testing and nursing theories. The nursing theories are also tested in nursing research. So after there is various roles are like research are collaborating in various doing for testing the nursing theories. Now let us together to take a look the issues and challenges concerned today's nursing leaders may have to encounter. So what are the various challenges the nursing leaders are encountering while performing in different areas and different tasks? So the major challenges is supremacy of the medical profession over the nursing profession, then cost of healthcare, then social image. We are responsible for our social status, cannot blame to others. Then lack of unity and fallow feelingness. So this is the various challenges, major challenges what we are feeling in the field of nursing. Now, what are the other challenges? What challenges are faced by the future of the nursing, like a quality assurance? In the quality assurance of the nursing, education will become a difficult in increasing number. Distance education plays come up role. Then technical advancement. A technological advancement with the increased use of machine may be a compromise with the humanistic component of the nursing. Example like robotic nursing is a practice which is no intellectual component, may not be able to give a care as the human nurses are giving. even advancement related ethical issues. So increase the advancement in the genetics will rise more ethical issues and dilemma, which is eventually affect the nursing practices. The shortage in the nursing person. There is estimated that there will be a serious shortage in the nursing profession in the future, especially in the field of nursing education. This will be ultimately leading to a restriction nursing education program and may possible reduce its quality also. Then lack of workplace satisfaction or safety. Then lack of workplace safety is will continue to remain a challenge for the nurses, especially from the person as no security measure are available even in the best hospital areas. With the increased specialty in the medical and nursing field, the nurse's role will become less defined. Like chest physiotherapy was initially performed by the it was the role of the nurse and the doctor earlier, but now respiratory therapists have taken up this responsibilities. Similarly, other nursing action also become a specialized of the other profession in the future. The shortage of nursing staff maybe create a barrier. The shortage of nursing staff create a barrier of provision of quality nursing care. Increase then the alternative therapies. Increase the acceptance and the demand for the alternative and complementary therapy will restrict the nursing practices. Then the emerging and re-emerging diseases. Nursing science will be address the healthcare issues like emerging and re-emerging diseases and the allied professionals, such as group like visiting nurses, like a hospital technician nurses, who are not trained profession, yet providing a nursing care at a lower cost with compromise in the nursing care quality are a major threat to the profession. So these are the various challenges what the nursing leaders are following in future of the nursing. So these are the various challenges in the field of nursing education. So the challenges are fragmentation of the higher education system, then lack of access, especially in socio-economical advantages areas, lack of teacher and institutional autonomy, inadequate mechanism for the career management and progression of the faculty and institutional leaders, suboptimal governance and leadership of higher educational institutions. A regulatory system allowing a fake colleges to thrive while constraining excellence and innovative institutions. So these are the various challenges in the field of nursing education. If we will see the challenges in the field of nursing research, so lack of understanding about the research, absence of novelty, then no any interest and motivation, lack of research experience in the supervising the faculty, limited understanding for the research methodology by the student, lack of relevant, valid, reliable research in the instruments, lack of funding for the nursing research in India, poor library resources for full text nursing research papers, lack of writing and comprehension skills, unethical practice in the nursing research, especially PG nursing and a casual approach in the thesis evaluation, lack of professional recognition of the nursing research, even it is not government property, number of evidence-based and research utilization in the practice and the education, inappropriate knowledge about the publication, no publication at the right journal utilization, and utilizing a pre-directory journal, then serious problem of the plagiarism. So these are the various nursing challenges in the field of nursing research. Beer Brand rightly said about the portrait of nursing leader. If anything goes bad, I did it. If anything goes semi-bad, we did it. If anything goes really good, then you did it. It is the portrait of nursing leader. Now it goes without saying that unless we provide opportunity in our nursing education service system for assertiveness combined with the fellow feeling, the goal of professional nursing standard in India will not remain a dream, will remain only a dream. To make it possible, we need a transformational leadership to emerge from our own group. So this is the parachute principle. The mind is like a parachute. If it is work when it's open. So this was about my presentation. Ben Sweetland rightly said, we cannot hold a torch to light another's path without brighten our path. So this was about my presentation for future of nursing leadership. Thank you.
Thank you so much, sir. That was really a wonderful session. The session perfectly illustrates with the saying by Dr. APJ Abdul Kalam, which goes as, the leadership is not about titles, positions, or flowchart. It is about one's life influencing the other in a positive attitude. Your session gave us a positive attitude on the leadership in nursing field. Thank you so much, sir.
Thank you. एक्चुअली वो वीडियो इतना अच्छा
Now we move on to our next keynote speaker, J. Nesamani Sonja. Welcome you, ma'am. J. Nesamani Sonja, currently working as an assistant professor, Department of Obstetrics and Gynecological Nursing, College of Nursing, Aligarh Muslim University, Aligarh, Uttar Pradesh, India. She has over 10 years of experience in the field of nursing. She has conducted many national and international conferences and attended it also. She has published her papers in international and nursing journals. To her credit, she has attended international conferences in Sydney. She has trained in various workshops. She has also the prestigious membership in various nursing associations, including Society for Nursing Practices. Over to you, ma'am. Ms. Nesamani Sonja. You can switch on your video and audio and start your presentation, ma'am. Excuse me, ma'am. You have started sharing your screen. Please go to the PPT session. You can put your PPT in the slideshow. Yes, ma'am, you can start presenting. Excuse me, ma'am, your voice is not audible.
Yes, ma'am.
Yes, you are audible.
Thank you. Thank you.
Please increase your volume, ma'am. Please make sure that any one of the system alone has the volume. என்ன பண்றாங்க?
Is this visible, ma'am?
Yes, ma'am.
The presentation outline consists of the introduction, history and development, forensic nursing define, a framework to guide forensic nursing practice, roles and responsibilities of forensic nurses, present and future trends in forensic nursing. I didn't invent forensic science and medicine. I just was one of the first people to recognize how interesting it is by Patricia Cornwell. Forensics is not about the dead people, it's about the law. It's not about the dead people, but it's about the law. Forensic nursing is characterized as the appliance of the nursing method in public or legal cases. So it is characterized by, we can say there is an appliance of the nursing method that is applicable the public and the legal cases. So forensic nursing is an innovative and evolving nursing specialty that seeks to address healthcare issues that have a medico-legal component. So we have to concentrate on these innovative aspects because of the emerging nursing specialty on forensic nursing. So essentially we can say it is the appliance of nursing method in the public and the legal cases. Then now we'll see what is forensic nursing. The application of forensic science that is combined with the clinical nursing practice as they apply to the public or legal proceedings in the law enforcement arena. That means that we can say this is the clinical nursing approach, we can only apply to the public or the legal proceedings. Then it is the application of forensic aspects of healthcare combined with biopsychosocial education of the registered nurse in the scientific investigation and treatment of trauma, death, violent or criminal activity and traumatic accidents within the clinical or community institution. So like the situation may arise like the trauma or the death or that violence or maybe the criminal activities that may happen at any time. So we have to be concentrate on especially the nurse, registered nurse has to she has to take or pay the attention for the scientific investigation and the treatment. It defines the evolving field of forensic nursing, introduces an innovative framework for the provision of forensic healthcare and identifies the opportunities and challenges inherent in the development of forensic nursing practice. That means the framework is made mainly for we have to identify the opportunities and we have to face the challenges ahead and for the development of the forensic nursing practice. Now we will see what is the definition of forensic nurse. This the new nursing specialty. It is nothing but we all perform the normal role of a nurse. The previous speakers they were concentrated more on this, but now we will see the specialty that we have to. It's a new nursing specialty, like new entrant of the profession. We can say otherwise. It's evolving in the response to the healthcare issues presented by the criminal violence. This introduces an innovative framework for forensic healthcare and for the nurse's role in processing the victims and families through the health and justice system. So we have to concentrate both the health aspect as well as the justice, or we can say the criminal cases as for the justice system. So in partnership with the forensic medical sciences and the criminal justice system, the emerging discipline of forensic nursing science is assuming the responsibility for those affected by the human violence. So we have to concentrate the special care, or we have to pay the attention on assuming the responsibility for the every nurse, those who are especially specialized in forensic science, that they have to see the human violence especially. And more importance, we'll see what are the importance. Why it is needed to know the importance. What is the importance of nursing, forensic nursing? So forensic nurses can play an important role in bridging the gap between the law and medicine. So we can say it's just like acting as a bridge between the law and medicine. Forensic nurses perform the duties that are much more specialized than nurses. Typically, they perform the duties as that of the routine ones. So some commonest, we can say the forensic nursing specializations that are including like sexual assault, medical legal consulting, death investigation, and forensic psychiatric nursing. These are some of the specialty areas of forensic nursing, such as sexual assault. That may be for the adult or for the adolescent, we can say. Medical legal consulting. So we have to concentrate on the aspect of medical legal aspect. Then the death investigation, especially that investigation to be performed along with the examiners, medical examiners. As a team, she has to act. And the forensic psychiatric nursing also plays an important role in forensic nursing. Although the forensic nursing is a relatively new field of nursing, its job growth forecast shows promising demand of forensic nurses. Still, we need, even though we are just like an infantile stage now, we need to go a long path to achieve the goals, the commonest goals of the forensic nursing. While the role of forensic nurse specialist augments and enhances the traditional nursing with existing and intellectually stimulating responsibilities, it also brings within a new identity, new language, new terms, and new definition. That's why it is called as an innovative. I mean, we can say that service, because it includes the new identification and the new language and the new ideas will be delivered out, and that will be implemented, and through the actions it will be accomplish the common goal. So it expands the traditional concept of holistic practice such as body, mind, spirit to include the law. So we have to coincide the body, mind, and spirit together. Now we'll see the history and development of forensic nursing. Historically, this healthcare role had been viewed worldwide as a medical specialty. Previously, it was considered for only for as a medical specialty as forensic medicine, and had been restricted to only for the physicians alone. American Journal of Nursing published an article that was on preserving evidence in the emergency department by Roger Milsman, a forensic pathologist, Hollis Goldberg, an emergency nurse, and David Dexman, a state attorney in Florida. This article emphasized the importance of recognizing nursing profession in forensic science. So we can say this is the area, I can say the people are feeling lacking of the nursing service, and hence the importance of recognizing the nursing profession in forensic nursing. Clinical physicians and forensic pathologists do not consider themselves responsible for the forensic issues surrounding living patients. So there is they need the supportive profession like nursing. The first national convention of sexual assault nurses took place in 1992. So we can say first of all the first convention was about was in the year of 1992, and were only 70 nurses attended this convention. And shortly after the convention, the International Association of Forensic Nurses was developed. It was until about 1996 that the American Nursing Association of Nurses, ANA, recognized the forensic nurses. American Association of Nurses recognized the forensic nurses' role and their importance. Clinical forensic practice, the combined energies of medicine, nursing, and law have developed into the mutually beneficial collaborative practice in which knowledge and responsibility are shared in order to reach the common goals. So what they have to do, they have to have the collaborative practice. They should have the teamwork and to update the information, and they have to get the work to be done by the experts and other team workers like medical professionals and paramedical professionals and social workers and the criminal judges. With that, they can achieve the common goals. So there is a collaborative work. We can say that it is a collaborative practice done by the forensic nurses. So forensic nursing has become the moving force in clinical forensic practice in India. So after, I think after a long time only in India it was practiced. We are in a, I already told you about that we are in the infantile stage. The integrated practice model for forensic nursing science incorporates a synthesis of shared theory from a variety of disciplines including social science, nursing science, and forensic science. So this is the integrated practice model was made on the basis of the disciplines that includes the social science, nursing science, and forensic science. Here we can see the model now. Before that, I would like to go ahead with the nursing process, forensic nursing process. The following concepts are among the variables that influence the nursing process. Like the 4 dimension, everybody knows the assessment, planning, implementation, rational evaluation. But here, how we are going to practice this? In during assessment, the identification of forensic situation, the potential victims will be assessed. Then second, in planning, we will only concentrate on the investigation. And intervention, during the phase of intervention, the documentation pertaining to the situation, collection of evidence, interviewing, provision of appropriate care, reporting to the appropriate legal agency. So we have to not only we have to do the collection of we have to collect the evidence or interviewing. Other than that, we have to report to the appropriate. This is very essential that we have to inform to the appropriate legal agency also. Then about the evaluation, this is the last one. That in the fourth dimension. So in which we will do the post-intervention review of that. This is a model. So you can find here the outer line consists of the social impact fields of expertise, healthcare system, and we can find here in the core we can find the triangle. In triangle, there are 3 components known as the clarification of roles, the role behavior, and the role expectation. So in the center, we can find the interlocking systems like we can say the nursing science and the healthcare and the social sanctions. So that is all interconnected or it is related to each other. Representation of model. This alignment reflects the awareness of connectedness that the healthcare system has to have the social system. So that's the priority. We have to concentrate on the social system of the community or the society or the interdisciplinary collaboration that integrates nursing into the multitude of highly specialized scientific, social, cultural areas. So that we have to, from the social system, it is getting connected to the psycho-cultural areas. Then afterwards, the bundle of public services that will shows the complexity and the weight of the public service obligations. And all together, we can see the modern system in our country now and as well as in the abroad. So finally, the scales of the justice. The justice will be emphasizing, or that we can say it will determine the truth and the notion that the patient care must now require the consideration of legal as well as the human rights. So they will have to include not only the legal aspects but also the human rights of each individual is also to be added. The framework for the forensic nursing specialty has evolved from society's need. So that is why I told you it is developed from the social system. So society needs should be evolved to reduce and prevent the interpersonal violence. First and foremost, duty of the forensic nurse, she has to, her aim or motto, or we can say the objective is to reduce and prevent the interpersonal violence and criminal behaviors. The second thing, benefits derived from clinical forensic interpretation and the collection and preservation of forensic evidences, effective sexual assault examinations, identification and reporting of abuse. And we will study detail about the abuses later on. Investigation of suspicious deaths, court-ordered mental health evaluations, and expert testimony by forensically skilled experts. So we have to have the clear about these things. Not only in societies, we can say that includes of the reports, or can say that exams are like the suspicious court or mental health evaluation, and also judged by the experts, especially people who are specialists, the skills and the skill, we can experts will do the judgment. They will raise the things and they will do the the roles and relevant for forensic nurse. Nurse can operate themselves and strategies for nurse. But they say that the roles are responsibility to the nurse or the area legal working in people or doctor, we can say legal forensic nurse, forensic investigator, forensic nurse, examiner, for correct nurses, so we can have clear, or we can say that different roles. There are multi roles by forensic nurse in abroad in India, especially it is for or adopted in abroad. We can say now one forensic nurse like working in emergency. Same, that is the sexual assault nurse examiner, nurse coroners. So otherwise we can say nurse forensic nurse investigators or nurse attorneys. They are the legal nurse consultants. Psychiatric and mental health, correctional death, and domestic violence. We'll see one by one. So in the trauma or the emergency room, they have to do the documentation. They have to see or the client or the person who is having the crime which is committed by the person and what we can do for this condition or situation. Then chain of custody. Chain of custody we can say. Then third one is the measurements in centimeters or the location we have to adopt and we have to see. So we have to use the digital technology. I mean, we can say the new technology that we have to adopt. Like nursing, we have studied the informatics. So this all will be carried out by the special nurse, or we can say forensic nurse. Description and photography will be taken. This is what I told you, the sexual assault nurse examiner. She is the registered nurse who has been specially trying to provide comprehensive care to sexual assault patients who demonstrate competency in conducting a forensic exam and the ability to be an expert into witness. Then SWAT. SWAT is nothing but the sexual assault response team. So they are having the team members like law enforcement, team works to be done like with the forensic scientists, with the counseling people, the physician, and with the registered nurse, and their responses will be assessed, and accordingly they will take the action. Then nurse coroner, or it does the investigation. The coroner is the public official who is primarily charged with the duty of determining how and why people under the coroner's jurisdiction die. So these jurisdictions vary from state to state, but typically you can say that including the sudden, unexpected, unexplained, or traumatic death. So this is the person who are responsible for the death investigation is called as the nurse coroner. Nurse attorneys, legal nurse consultant. Nurses want to make fundamental change in the way healthcare is delivered and recognizing that it needs to be legislation and political process as a big piece of it. So that is, we can say in the healthcare system delivered. So then the needs of legislation and the political process will be handled by the nurse, legal nurse. Like nurses, attorneys must interact with people who are vulnerable, who have been injured or traumatized, and who need assistance to regain their wholeness. So they help to regain the wholeness by giving them counseling and the treatment process. Client advocacy is also the skill nurse bringing to the profession. So that the person who is dealing with this, they will be skill experts, especially the nurse. So she will do the, she will take care of this advocacy, and she will bring to the profession, and she will find out the problems, and she will solve the problems accordingly. Issues and goals. The enhancement of appropriate care for the severe and persistently mentally ill. The integration of psychiatric and addiction treatments. Strategies for promotion of mental health and prevention of psychiatric disorders. So here we can say like the psychiatric nurse also plays an important role here, and they will find out the causes of sexual assault for both the adult and the adolescent. Correctional health nurses. Correctional health care is also uniquely a specialty area. So this here, the goals are to facilitate an improved working relationship between the private sector and the correctional staff in jails, adult and juvenile detention centers. So where we can say like it is it is a relationship that is made by the private sector and as well as the staff who is those are in the jails like juvenile, especially the adolescents, and the person adult, those are in the jails. For them, they will give the correctional. For them, they need the correction. So the correctional staff will help them out in the prisons and juvenile delinquencies, and they will help to promote the conventional, or we can say the correctional healthcare as a part of public health continuum. Domestic violence is the leading cause. It is a prevailing problem, we can say, in India also, not only in the world but also in India. So domestic violence is the leading non-obstetrical, or that is we can say that is cause of death to pregnant women. Is the commonest problem availing in abroad. And in India, we can say many other domestic violence due to dowry problems and other things, which is prevailing in India. So every 9 seconds, a woman is battered, and only 3 women are victim of domestic violence. Types of abuses. There are 3 types known as the physical one, emotional, and financial. The physical one, we can see the kicking, and strangulation, and with the weapons. And the emotional includes threats and the destruction of self-worth, isolation, and the isolation. And financial, that includes the working and working areas where the problem may prevail, the problem persists, and the advancement and access to finances and credential of the money. What does a forensic nurse do? So what are the, we can say, what are the job responsibilities we can say? Interviewing the patients to obtain the medical and forensic histories. First of all, the nurse has to collect the histories, especially that is coming under the first and foremost thing that she has to perform. Second one is conducting the head-to-toe physical assessment. Second is the assessment that includes the head-to internal and external assessment of the person. Then photographing findings. Then third one is collecting the evidence such as clothes, as well as the swabbing of the body fluids. The body fluids also will be sent for the examination. Then collecting the patient samples such as blood and urine, and cleaning the and treating with minor wounds. There is the like in domestic violence, if the wound is very mild, or we can say minor wounds, that she can do the treatment accordingly. Collaborating with other providers for prescription to prevent the pregnancy or sexually transmitted disease. So not only that, like we have discussed so many obstetrical problems at the time of due to the some domestic violence. So that we can concentrate, we can counsel them and we can give them provide the safe delivery, and also we can concentrate on sexually transmitted infections. Referring patients to community resources or other ongoing support. Then provide information by the law enforcement as a mandatory reporter. Then we can take testing the things, testing the exam, the examination, or we can say that investigation process. Then we will see where and when do the forensic nurses work, especially which we can work in the hospital systems. That includes emergency departments and women's health services. And second areas we can, that is the first area you all know, community programs that provide services to vulnerable populations. Third one, she can work in medical examiners, with the as a team to assess the deceased patients. And psychiatric institution also she can work to assist the victims who have a mental health diagnosis. If they are having mental diseases or illnesses, we can assist them how to come out of the illnesses. Then legal officers as nurse consultants or testifying experts. Then about the colleges, and she can work as a nurse educator. She can work and teach. And forensic nurse specializations, secure various certifications and responsibilities. Now we'll see what are the, where we can do the specialization and what are the certifications that we can keep for, we can say that that is for the forensic nurses. First one is the bachelor degree. BSc nursing is preferred by many employers. After graduating from nursing school, the next step to update, or we can say that take the national NCLEX or examination. Upon passing the NCLEX, an individual becomes an RN registered nurse and applies to the State Board of Nursing where they can do the job. This is in abroad, especially in United States. Then after 2 years of nursing experience, an RN may start a SANE. SANE means that I already told you, the sexual assault nurse examiner post certification process. It is of a 6 months or 9 months program, and that is they can do it like yearly. It is of in different countries it is rapid as 2 years. Some countries it is only for 9 months or 6 months. Depends upon this. So the same exam is held twice a year by the International Association of Forensic Nurses in abroad, especially US. As RNs forensic sciences, the nurses in the United States make around $70,000 a year. In 2020, the median pay for RN was $75,330 per annum and 36,330 for the hour per hour. Forensic nursing in India. Now we'll see what is going on in our India, or we can say what is forensic nursing in India. The Nursing Council, Indian Nursing Council has introduced forensic nursing in the graduate nursing program in the year of 2021. We are still in the infancy stage among the nursing aspirants in India. Master of Science in Forensic Nursing is a 2-year full-time program that is the postgraduate level in the nursing course offered by Rajiv Gandhi University of Health Sciences, Bangalore. So that we can say we are having post-diploma courses was running in our country. First, the Gujarat University, they have started the post-diploma course in forensic nursing. So we can say 2021, INC has also included special subject on forensic science, forensic nursing in the curriculum. And Masters of Science course, MSc in Forensic Nursing is also 2-year full-time program that is postgraduate level of nursing course. It is offered by Rajiv Gandhi University of Health Sciences, Bangalore. It is approved by the Indian Nursing Council. Colleges offering post-basic diploma courses. I already told you it was first started in Gujarat University. And now it is, we can say the colleges that those who are offering the post-basic diploma courses in Bangalore North University, Indus North University, Karnataka Folklore University, Central Institute of Higher Tibetan Studies, Starex University, Nirvan University, Sitkara University, Azim Premji University, APU. Now we'll see the challenges faced by forensic nurse. Background perspectives daily. Nurses are faced the extremes of human behavior, such as child abuse, domestic violence, crimes against the elderly, self-inflicted injuries, and maltreatment. So we can find in these areas, especially child abuse, is the commonest problem. We can say social problems is persisting, or we can say is prevailing in our country, and we can say this like for the elderly also there is gerontological problems related to this, and also they are also afflicted with many injuries and all. So we have to the forensic nurse has to deal, especially the areas he has to focus on, mainly the child abuse, domestic violence, crimes against the elderly people, self-inflicted injuries, and maltreatment. These incidents must be reported to the law enforcement agency and investigated. Special skills are also required of nurses who provide treatment or to court-ordered assessments of patients in legal custody. So we can say, so the incidents which are being reported, that should be taken judgmental, or that court has to give the order according to, and they have to do the assessment related to legal custody. Then, as trends in crime and violence change, new legislation is implemented as a means of anti-violence strategies. New resources are required in order to meet the needs of society at war against crime. So we have to see the new legislation also, which are implemented for the means of anti-violence strategies. That a long-term goal that we have to see, and we have to fight it against the crime in our country. Nurses have been challenged to conjoin the patient care with the legal system. So she has to be challenged, and because some of the lack of staffs also, staffing pattern, and we can say that leadership skills, or we can say the role of entrepreneurship, or so these also causes the challenges that is faced by the forensic nurses. Medical legal issues of forensic nurses. Failure to meet forensic requirements in the clinical settings can compromise the investigation. The nurse ignorance of forensic issues that also could have been unanswered for the unanswered questions related to trauma that later may be relevant in the court of law. So ignorance of forensic issues that also due to some of the nurses' ignorance, and also that may be like clinical depends upon the arrangement or the resource availability in the clinical settings also causes medical legal issues. And despite urgent any in the domain department for a multidisciplinary team, nurses responsibly collect and preserve all the forensic evidence. First to collect include patient details, the documents, the investigation, the made by physicians, and problems. Problems. What are the problems related to surgical aspect? She has to concentrate, and she has to make the plan. She has to collect the. She has to submit it to. Issues because current status concerns. Specialty area of interest. First of all, now we say this depends upon the interest, area of interest. So it is only the European development now. So it is appropriate for having interest. Interest they have the most proper. Education. They have to be skilled and attain the practice. They develop skills in the forensic. So specialty is depending on second education continue to evolve. Education is based upon that they have been then and the foreign is the facilities, correctional facilities, country prosecutors, police officers, medical examiners, insurance companies, psychiatric and disaster emergency management. So these are the current status of forensic nursing, where they can improve the skills and knowledge by equipping themselves to be a good forensic nurse. Forensic nursing is one of the fastest growing specialty areas. So it depends upon the individual interest as well as the people's support also it needs. So it is more, we can say most likely because of the violence is increasing. And not only that, violence is day by day it is keeping on increasing, and the cases, criminal cases also being increased. So we need to have to improve, or we have to add the programs accordingly. Then forensic nurses practice in a variety of different areas, including they have expanded and extended roles. Like in disaster and emergency management, they have to perform, they have to prepare the forensic issues such as the sexual assault, mass fatality, disposal of human remains, and critical incident stress. So they will also work in the disaster, like man-made or natural. Forensic nursing present and future. International Association of Forensic Nurses. Since its founding, it was initiated in 1992, the International Association of Forensic Nurses has promoted the education of forensic nurses and the implementation of forensic nursing roles worldwide. So we can say, first of all, I already told you about the history. In that, I told you it was first found in the year of 1992 by sexual assault nurses. In the conference, in the first convention, they have only 70 nurses were attended, and that afterwards, 4 years after only, they have started the international association. Association was made, or and the nurses have joined in the worldwide. With the establishment of graduate and undergraduate educational programs, role development in forensic nursing in the United States and abroad is recognized as an essential component of anti-violence strategies. So we can say when they have included and they have recognized the component, which is main for, especially for the anti-violence strategies, they have included in the syllabus. Interpersonal violence and its associated with a trauma impact all the societies. Crimes against women, children, and elderly are commonest. In order for the forensic nurses to better assist in the management of medical legal cases, they must be trained in transformational nursing. So we have practice like the International Association of Nursing Forensic Nurses. The International Association of Forensic Nurses is recognized authority on forensic nursing. The association is the catalyst for universal access or for the nursing care with patients impacted by violence and trauma. The association serves as a global network for forensic nurses to exchange ideas, serve as mentors, and enhance their practice. So they have made the network, global network also, and enhances their ideas and serve as mentors also. In 1992, 72 registered nurses came together from IAIMS. It's the International Association of Forensic Nursing. Today, International Association of Forensic Nurses have grown to 6,000 members after 3 years, we can say. With 30 chapters, they have across the globe. So now we'll see the membership in the association gives us the resources that will help us to practice and get recognized and to connect the people, and we can improve the standards of profession, especially in the field of forensic nursing. The association offers the certifications, continuing education through our online learning centers. Educational guidelines are available, networking through the member community, and there are some journal, we can say journal club. They can do the practices, and they can do the researches, and new innovations can be practiced. The Journal of Forensic Nursing is also available, and the International Conference on Forensic Nursing Science and Practice is the it is the ongoing process is going on. And then about the nurse, the Association of Staff and Volunteers welcome the questions about program and their development in this certification course. Every year, we can say November 7th to 11th is considered as Forensic Nurses Week. So this started in 2016 and is continuing till now. And now we'll go on to the summary. A strong working knowledge of the law promotes interaction with local law enforcement agencies and helps to develop an accurate approach to forensic nursing interventions. So we can concentrate, we have to improve the knowledge and we have to have the update skills, and we have to improve our standards of quality care, and then the nursing interventions will obtain the scale. Nurses who apply the concepts and strategies of forensic nursing science in their specialty practice are becoming recognized as vital resources. Now it is considered or recognized as vital resources to the global health and justice system. Now I would like to conclude this. Although forensic nursing is a relatively new field of nursing, its job growth forecast shows from promising demands for forensic nursing, especially the nurses who are in the abroad in India. Students can learn the truth about what it takes to be a forensic nurse, as well as gain valuable knowledge once enrolled in the forensic nursing program. Thank you all. Is there any doubt you can ask? Is there any queries, ma'am?
Thank you so much, ma'am.
Next video.
Thank you, ma'am. This was really a knowledgeable session, as the forensic nurse is the new role of nursing field in the upcoming law enforcement. Thank you once again.
Thank you, ma'am.
She didn't announce. You cannot share the screen. They're sharing.
I'd like to call upon our next keynote speaker, Professor Jesslyn Jabakani. Welcome you, ma'am. Professor Jesslyn Jabakani, currently working as a Vice Principal, SCA College of Nursing, Bangalore, India. She has over 10 years of experience in the field of nursing. She has attended many international and national webinars and conferences. She has published her research papers in national and international publications to her credit. She has been trained with various workshops, and she holds the prestigious memberships in various nursing associations, including Society for Nursing Practices. Over to you, ma'am.
Thank you, Ms. Sushmita. Good afternoon, one and all. Hope I'm audible. Hello. Hope I'm audible.
Yes, ma'am, you are audible.
Thank you.
You have shared your screen, ma'am. Please fix your screen to the PPT.
Yes.
Showing it, you cannot share the screen. Kindly.
It's showing you cannot share screen while other participant is sharing.
Just give me a minute, ma'am. I'll sort it out.
Yeah.
Yes, ma'am. You can share it from your side.
Yeah, sure. Good afternoon and welcome to the session.
You can put your PPT in slideshow, ma'am.
It's slide share only, ma'am.
Slideshow.
Slideshow.
Yes, ma'am. You can put it in slideshow.
Okay.
You have already shared your screen, ma'am. Your screen is visible, but in the PPT
Okay.
format.
All right. Hey, you will have
Excuse me, ma'am.
Yes, ma'am.
Your voice is not audible.
Am I audible now, ma'am?
Yes, you are.
Yeah. So we see that good afternoon, one and all, and I welcome you to this session. We see that people usually order groceries or they call for services and many other activities are carried out through this artificial intelligence. And the modalities that we use is usually the phone or the iPhone or the mobiles or the laptops. So when it is possible with in all these fields, why not with learning? So hence, we'll see what is the importance of artificial intelligence in nursing. So we see that all of us are very much aware of the COVID-19 pandemic, and the WHO, that is World Health Organization, felt that the technology, especially this artificial intelligence, it could be a important technology to deal with the situation. Since artificial intelligence was able to help with the detection and also the diagnosis the professional, that is healthcare professionals, they felt that this technology could be applied throughout the healthcare organizations because it had proved its importance. So let us see the definition of artificial intelligence. So artificial intelligence in healthcare, also known as deep medicine, it is an overreaching term which is used to describe the use of machine learning, algorithms, and software or artificial intelligence to mimic human cognition in the analysis, interpretation, presentation, and comprehension of complex medical and healthcare data. So algorithm means there is some input and certain calculation, mathematical calculations which are fed. So next, let's go into the history of artificial intelligence. So we can't say that artificial intelligence has just come into being. Artificial intelligence has been existing years long. So we see and we hear about the Turing test. We would have read in the papers, many of us. So during the year 1950, Turing test, that is Turing test is a method for determining the intelligence of a machine. During the year 1955, the term artificial intelligence was used for the first time. And during 1966, ELIZA, one of the first chatbots, simulates conversations as a psychotherapist. That means as for voice assistance it was used. And AI winter, that was after the boom of early research, there was a pause, there was silence, there was no importance given to this field of research for artificial intelligence. Then 1997, Deep Blue, chess computer Deep Blue wins against chess world champion Garry Kasparov. And 2011, Siri, the intelligent speech assistant, is integrated into the iPhone 4S for the first time. And 2011, Watson, supercomputer Watson, wins against two human rivals in the quiz show Jeopardy. And 2014, virtual assistant Alexa from Amazon moves into counties' homes. And 2016, chatbot Tay had to be reissued after a short time because of racist and sexist remarks, because they were against this. And 2017, AlphaGo, Google's AlphaGo beats the world champion in the game Go. And 2018, the European Union establishes guidelines for deadline with ethics in artificial intelligence. So all these, although we are going to discuss about its importance in the healthcare and in nursing, we need to know about this because nurses need to know about the transition and certain information about this. We need to know certain information about this artificial intelligence. So let us see what are the key components of artificial intelligence, because the students are even learning about computers. They would be better come to know about certain terminologies. So the key components of artificial intelligence, we have deep learning. So deep learning, it is a type of machine learning and artificial intelligence that imitates the way humans gain certain type of knowledge. So it includes statistics and also predictive modeling. Second one is neural network. So it reflects the behavior of the human brain and it allows the computers to recognize patterns and it solves the common problems in the fields of artificial intelligence, machine learning, and deep learning. So examples are, it could be used in the clinical diagnosis. It can predict cancer. It can also help in the recognition of speech. And it can also predict the length of stay of a patient in the hospital. The third one is NLP, or natural language processing. So it is a branch of computer science, and more specifically, it is the branch of artificial intelligence, or artificial intelligence, which is concerned with giving computers the ability to understand text and spoken words in much the same way compared to the human beings. And Next one, we have the machine learning. So it is a branch of computer science, or it is a branch of artificial intelligence, which is based on the idea that systems can learn from the data. It can identify the patterns and it can make decisions with minimal human interactions. So the intervention by human beings is very less required. So cognitive computing. Cognitive computing, it makes use of artificial intelligence and other type of underlying technologies. So it helps in attempting to have the computers mimic just like how the human brain works. And next one is computer vision. So computer vision is a field of artificial intelligence that helps the computers and the systems to derive the meaningful information from the digital images, or it could be from the visual inputs also. Next is computer aided inspection. That is, it can be helpful in the field of X-ray. It can help in the CT scans and MRI scanning also, especially about the internal organs. Detection of microscopic fractures in the bones and also detection of the tumors. So we'll discuss what are the types of artificial intelligence. So types of artificial intelligence. We have, it can be called as the stages, or it can be called as the types of artificial intelligence. So there are two classifications, that is based on the capabilities, we divide it into narrow AI, because artificial intelligence we also, in short form, we also call it as AI. Then general AI and super AI. And based on the functionalities, that is the types of function that it does, we divide it into reactive machine, limited memory, theory of mind, and self-awareness. So based on the artificial intelligence, which is based on the capabilities. So artificial intelligence based on the capabilities, also called as ANI, it is referred to as. So this type of artificial intelligence works in a limited content, because only very less amount of work it is able to do. That is why we call it as according to its capacity, and that is ANI. So examples we have, that is the Amazon and the Google search. All these, they come under this type. So artificial intelligence, also called as strong AI, it is the kind of artificial intelligence that allows the understanding and learning of any task related to the intellect that a human being can perform. So AGI, or artificial general intelligence, it can think, it can understand and act in a way which is indistinguishable from the human in certain situations. So more than just like a human being, it performs. And artificial super intelligence. So artificial super intelligence, also called as ASI. So it is currently, very much in use. It is believed that artificial intelligence not only understands, but it is able to perform much more than the human beings. Okay, so these are the three types of artificial intelligence based on the capabilities. Next one is types of artificial intelligence based on functionalities. It is according to the function what it does. So we have the classification that is reactive. Reactive, it has no memory, but it can respond only to different kinds of stimuli. And limited memory, it uses memory to learn and improve its responses. And third one is theory of mind. It understands the needs of other intelligent entities. And self-aware type of artificial intelligence. It has human-like intelligence and also self-awareness. So let us discuss what are the benefits of artificial intelligence in healthcare settings. It is used in the field of medical testing, so any kind of medical testing. Then predicting ICU transfers, that is, the patient can be admitted to the ICU, it can be decided. Then improving the clinical workflow, that is the work that we do in the hospital. Predicting hospital-acquired infections. Artificial intelligence also has the capacity to detect the hospital-acquired infections, which we refer to as HAI also. Predicting hospital readmission, that is whether the patient requires readmission or whether it is sufficient if he stays at home and is taken care of. Then sepsis prevention, that is, even studies are conducted on this sepsis prevention, where artificial intelligence is much useful in detection of sepsis and preventing it. Analyzing symptoms at a very faster rate, it is able to analyze the symptoms. And it is also able to suggest the personalized treatments, what kind of treatments are to be suited for that particular disease of a patient. Then predicting the risk factors. That is, what are the kinds of risks that may be faced by the patient. That is what we usually refer to as the potentials. Then detect abnormal results. Even any abnormal results which are found in the patient, it can be very easily detected through the artificial setting compared to the normal type of diagnosis. So next we know that robots, all of us, we are very interested in robotic activities, and also it has been applied in abroad countries and also in India. So this artificial intelligence and robotics, they can play wonders in the field of healthcare. So in both, we have certain areas where it is useful, that is early detection, diagnosis, decision making, treatment, end of life care, research, and training. So in these areas, it proves to be useful. So let us see, under keeping well, how it helps us. So this application of technology and apps, it encourages healthier behavior in the individuals, and it helps in the management of a healthy lifestyle. Just referring to any apps regarding health, it allows the individuals to follow or adopt to a healthy lifestyle, and it also helps in the management of various factors. Like, for example, it could be even diabetes, to manage it. And additionally, artificial intelligence increases the ability for healthcare professionals to understand the patterns of the day-to-day needs of the people whom they care for. And with that understanding, they are able to provide better feedback, and they are able to give better guidance and support to the patients for staying healthy. So it also helps in early detection. Artificial intelligence is already being used to detect the diseases like cancer more accurately and in the early stages compared to the other type of diagnostic measure that we use. So study suggests, it is found that according to the American Cancer Society, a high proportion of mammograms yield false results, that is leading to 1 in 2 healthy women being told they have cancer. So it is really a risk factor when people are diagnosed like that. And we see that the artificial intelligence has better capacity to diagnose cancer. That is, artificial intelligence has enabled to help in the detection of cancers, that is in doing mammograms 30 times faster with 99% accuracy. So that has reduced the need for unnecessary biopsies. And also the very first expert spoke about the wearables. The proliferation of consumer wearables and other medical devices combined with artificial intelligence also being applied to oversee early stage heart disease, and it enables the doctors and other caregivers to better monitor and detect potentially life-threatening episodes at earlier, more treatable stages. So we are aware that people come with fourth stage cancer and all that because they have not gone for early diagnosis, or diagnosis may have been, some error may have been found. But artificial intelligence, it is able to diagnose the condition at a very earlier stage, and it is easy to treat. That way the patients are benefited. Next one is diagnosis. So all of us are aware of IBM's Watson. So for health, it is helping the healthcare organizations to apply the cognitive technology to unlock the vast amounts of health data and power diagnosis. So it is all these companies which are helping us in the diagnosis. So Watson, it can review and store far more medical information. So every medical journal it is able to store. So we can get the information anytime required. It is able to store the symptoms and case studies of treatment and response around the world. So it is faster than any humans. And also we see that there is Google's DeepMind Health, which is working in partnership with the clinicians, with the researchers and patients to solve the real world healthcare problems. So the technology combines the machine learning and systems, neuroscience, which has the ability to build powerful general purpose learning algorithms into neural networks, which can mimic the human being, the brain of a human being. So next factor is decision making. So artificial intelligence, it helps in improving the care, which requires the alignment of big health data. So the big health data has to be collected for this purpose. So that is possible with artificial intelligence, with appropriate and timely decisions. So by the time human beings, we collect and we speak and all that, so those days are gone. So these type of technologies, it helps us to make the appropriate decisions and predict the analysis, and it can make and provide support in clinical decision making. And also it helps us to take the appropriate action and also to prioritize their administrative tasks. That is, in nursing, we already studied the importance of priority in nursing. So that is enabled by this artificial intelligence. Also using the pattern recognition, it identifies the patients who are at risk of developing a condition or condition which sees it, the deterioration due to the lifestyle. So lifestyle, it could be the person is not going for a regular checkup, especially we see that there's a diabetes, it plays an important role where the persons affected with diabetes, they have to go with this lifestyle changes. So for those people, it is very much useful. Then environmental, so conditions which may be a cause due to the environment or genomic, that is genetic factors, or any other factor where artificial intelligence is beginning to take hold in the healthcare scenario. So next is research. So nowadays research, much of importance is given to the field of research. We find that the doctors it could be, or the nurses it could be, or the companies, they are undertaking research in order to find a better solution to the diseases or causes that the human beings are facing. So by the time the ordinary research that we conduct in the labs, so the path from research lab to patient, it is very long process, and it is also a cost. According to the California Biomedical Research Association, it is found that it takes 12 years for a drug to travel from the research lab to the patient. So it is surprising. And we find that only 5 and 5,000 of the drugs that begin preclinical testing, so it ever make it to human testing, and just 1 out of these 5 is ever approved for human usage. So out of 5, only 1 is approved for the to be undertaken for the human beings. So we find that artificial intelligence, drug research and discovery, it is one of the most recent applications for artificial intelligence application in the field of healthcare. So by directing the latest advances in artificial intelligence, so the drug discovery and drug repurposing processes, there is a potential to cut both the time to the market for new drugs and their cost. So by the time research is conducted and it reaches the market, there is a variable amount of time that has to be spent. At the same time, cost is too much. So to make it cost effective and to reduce the time, we see that research is very much facilitated by the artificial intelligence to make it convenient for it to reach the people on time. So training, artificial intelligence allows the people, those in the training process to go through naturalistic simulations. So people learn things in a simulation environment. So that is in the form of a simple computer-driven rhythms which cannot do it. It could be done by this training, which can be undertaken through this artificial intelligence. So the advent of natural speech and the ability of intelligence computer to draw instantly on a large database of scenarios, which means the response to questions, the decisions or advice from a trainee can challenge in a way that a human cannot. So the human being cannot do this. But when people, even the nurses or even in the people who are in the medical field, when they undergo training in this artificial training, they can do it better compared to a normal human being who is not aware of this artificial intelligence. So the training program can learn from previous responses from the trainee. So that, which means that the challenges can be continually adjusted to meet the learning demands. So training can be done anywhere. So now you find even we are doing this program conference. So SFNP has taken a lot of initiative. So it's not that all of us we can collect together. So training can be done anywhere. So we are all doing it virtual with the power of artificial intelligence. So it could be on a smartphone, it could be like catching up with the quick sessions or after a tricky case in a clinic or while traveling, which is possible. So end of life care. So what can artificial intelligence and robotics do in the field of life care? We find that there was no proper treatments in the earlier days, especially when cancer was in the initial stages. When it was diagnosed, there was no treatments available for that. But later on, it was found out with research and all, the treatment was found out. And people, they were not living for much long period. But nowadays, people, although they live for sometimes longer than compared to the previous generation, so we find that people are dying in a different way, in a slow way. That is due to conditions like dementia, where the aged people, they are going through a process where they are unable to remember. So heart failures, that is a very frequent cause, and osteoporosis. So it is also a phase of life that it is often plagued by loneliness. People are suffering with loneliness. Excuse me. So this loneliness, it can be reduced for the elderly population. So we find that robots, they have the potential to revolutionize or change the end of life care. So helping people to remain independent for longer. That means they need not have people always. Nowadays, people are mostly accustomed to the modern type of a family, or they have to leave their families and go to another city, and the aged are left over in their places alone. So it reduces the need for hospitalization and care even in the homes. So artificial intelligence, when it is combined with the advancements in humanoid design, it helps in the robots to go even further, and it has conversations, it is able to converse, and it is also able to make even other social interactions, especially with the people who are aged, to keep their minds occupied. So the treatment, the artificial intelligence, what way it is helpful in the field of treatment. So beyond health records to help the providers, that is healthcare providers, in identifying chronically ill individuals who are at risk of an adverse episode. The chronically ill patient, not only they are suffering from that particular disease, we are all aware that it can be also leading to any other type of an adverse episode. Artificial intelligence, it can help the clinicians to take a more comprehensive approach for the management of the disease, and it is able to coordinate the care plans and help the patients to manage better and comply with the long-term treatment programs. So it decides what kind of treatment is suitable for these patients who are suffering with chronically ill episodes, so that it could be minimized with the help of this artificial intelligence. So robots have been used in medicine for more than 30 years. Already we have discussed about the history of artificial intelligence. It is not just today's, but it has been researched from years back. So they range from simple laboratory robots to highly complex surgical robots. So it can help the surgeon in performing the surgeries, or it can execute the operations by themselves. So in addition to surgery, they are also used in hospitals and also in the labs for doing the repetitive tasks, especially in the field of rehabilitating the patients, to provide physical therapy, that is physical assistance to the patient, and to support the patients who are suffering with long-term conditions. So let's see, so just we have discussed what way this artificial intelligence and along with the robotics, what way it plays an important role in the field of healthcare and helping and assisting in the field of this healthcare. So coming to the most important session of how it is helping, that is artificial intelligence, it is helping in the field of nursing. So with artificial intelligence, nurses may be able to personalize the patient care through the component, we call it as the TAVI. So TAVI, it is a virtual nursing platform that nurses can use to educate the patients about the management of their medical conditions and in helping them to lead a healthy life. And through this TAVI, we see that the nurse can direct the patient at home itself. So when he wants to check the BP or anything, so patients answer the simple questions that TAVI puts into an algorithm to select from a vast collection of educational videos. So that is made available to the and virtual nurse. For example, we have the Molly. A virtual nurse provides remote monitoring and support for common and high cost medical conditions. It can show the statistics like weight, recording of weight and blood pressure generated from Bluetooth connected monitoring devices. So we see that this app and its connected devices can be used to monitor congestive cardiac failure, chronic obstructive pulmonary diseases, etc. So from the home itself, a patient can manage his condition by monitoring the weight, the blood pressure, and his general health with the use of this virtual nurse, which is developed, and it is called as Molly. The next one is SoftBank's robotic nurses. So it is a type of human robotic nurses or nurse bots which are already being used to support the healthcare workers. So in Japan, for instance, there are a lot of elderly people who are found in Japan, and there is inadequate healthcare services for these aged population. So these nurse bots, which are the elderly patients, they carry out a lot of physical moving activities like assisting them and in their daily task like bathing them, dressing them up and giving them company. So the company claims that the robots can assist in simple tasks like helping welcome people or provide information and interact with the customers and also with the visitors. So much of nursing, it is based on clinical trials, studies, protocols, and time-tested methods. So artificial intelligence, it utilizes the algorithms and predictive models to assess the data about patient populations and breaks it down to provide accurate and personalized solutions for the delivery of the care. So since healthcare worker is rich in data, artificial intelligence is a natural fit for integrating into the nursing practice. So we see that Pepper is another robot, so which carries a touch screen that can be uploaded with information to assist the customers or the patients. For instance, in a hospital healthcare environment, Pepper can even question a visitor which patient they want to visit. So the connected touchpad can search through the hospital's online system and display the patient's name and room number. And infrared sonar sensors are the ones which are enabling the robots to self-navigate the surroundings on wheels, and that on wheels in the sense very fast, and help the visitors. So the robot can be connected to Bluetooth, Wi-Fi or internet and has 12 hours of battery life and auto docking capabilities. So Pepper can be used in patients with dementia by playing memory games or even the music. So artificial intelligence can enrich the nursing practice by helping nurses to make sound clinical judgments, educating them and supplementing their experience. So with artificial intelligence, nurses may be able to personalize the patient care. We have already heard about the smart shirts. So wearable technology that uses the artificial intelligence to detect the onset of chronic diseases. The sensors are able to assess the changes in the aerobic responses. So data is then used to predict the occurrence of type 2 diabetes and respiratory or cardiovascular diseases. So these are all the ones which are displayed. Like it could be even in the form of a watch. So the other thing is machine learning. So advanced analytics can be used to predict the likelihood that a patient may suffer from a stroke. The patient may not have suffered from a stroke, but you can identify that is almost going into that problem. Or it may be going into a coronary artery disease, or it may be going into a kidney failure. So machine learning is able to assess the previous blood pressure readings and the lab test reports, and it also helps it also considers the patient's race, the gender, the family history, and socioeconomic status along with the latest clinical trial data, because the data is stored. The nurses can apply the personalized information to form a healthcare plan. So what could be the future of artificial intelligence in healthcare? So I already told you that artificial intelligence, it has already been implemented in the healthcare services. So artificial intelligence in the future, the patients may enter an emergency department and could be greeted by a computerized triage nurse. The computer may apply algorithms. I told you what is an algorithm, that is inputs and mathematical inputs. They are fed into the systems to ask the patient questions based on their answers. So robots may also be used to draw the blood. They can develop a real-time nurse schedule. They can check the availability of the rooms for the admitting patients. So let's see about the research study that was conducted by Tetsuya Tanioka. So it was a research study was conducted and published in the Journal of Medical Invest. A study conducted on nursing and rehabilitative care of the elderly using the humanoid robots. It showed that observable effects include positive changes in relationships of patients, humanoid robots and healthcare providers, and better outcomes in terms of care, satisfaction among the elderly, and it also reduced the stay in the hospital. But it considered some ethical concerns and human person safety as critical factors of care. So how far the machine was safe for the patient, that was a question of concern, although it was able to provide care to the elderly. Another another study is the potential for artificial intelligence in healthcare. So it was conducted and it was found that artificial intelligence and related technologies have the potential to transform many aspects of patient care as well as administrative process within the provider, within the payer and pharmaceutical organizations. So the key categories of applications involve diagnosis and treatment recommendations, patient engagement and adherence, and administrative activities. So there are also a variety of ethical implications around the use of artificial intelligence in healthcare. So healthcare decisions have been made almost exclusively by humans in the past. And the use of smart machines to make or assist with them raises issues of accountability, transparency, permission, and privacy. So whatever it is, when we compare it to the human beings, it is only a machine. So there are certain areas where we need to be, it needs to be a cause of concern. Another study is artificial intelligence in healthcare transforming the practice of medicine. So the study conclusion is, it concluded that there are various artificial intelligence applications in healthcare like augmented care, remote monitoring, virtual assistants, and artificial intelligence chatbots. Prediction diagnostics, that is diagnostic imaging, diabetic retinopathy screening, precision therapeutics, artificial intelligence driven drug discovery, immunomics, and also synthetic biology. So based on this, the precision medicine that is empowered by this artificial intelligence, it empowered the healthcare professionals. That is in the form of identification and in providing timely care of patients at risk of deterioration. So it did not, the study found that it did not allow the people, the person or the patient to go into any kind of complication or deterioration. So they concluded that artificial intelligence could become a roadmap to build effective, reliable, and safe healthcare delivery system. So whatever we have, it could be useful, okay? So it is very much field of healthcare, this artificial intelligence. That is, it enhances the medical imaging analysis, and it is helpful as a virtual nursing assistant, and it is helpful in providing many other services like avoiding unnecessary surgeries, or even it helps in diagnosing the infectious diseases, etc. So all this work, it could not be possible, it would be impossible without power of the machine learning and artificial intelligence. That means the patients who have difficulty in to be diagnosed, those who are having the infectious diseases, are finally able to get a diagnosis and treatment. So this technology, it has been used by sufferers of chronic urinary tract infections and to detect potentially lethal cases of blood sepsis. That is when the sepsis spreads to the blood. And in case of severe gastrointestinal infections and still more. So although we have seen so much of uses that the artificial intelligence along with the robotics, it creates wonders and it has found to be effective. We have even seen the research study based on this artificial intelligence. So whatever we may implement, whatever we may think it to be very good or excellent, always there are pros and cons also. So let us see what are the pros and cons, that is advantages and disadvantages of this artificial intelligence technology. So the advantages are reducing the human error. So the human error reduction is definitely there because the machine usually doesn't commit the errors because the inputs are fed into it. And it allows for quicker decision making. Already we have discussed in detail about this decision making. And it reduces the risk, that is risk of deterioration or the risk of going into further complications. And it automates the repetition. So once again, so for example, second hourly or fourth hourly, you have to record the BP or whatever. So that repetition need not be kept on being informed, automatically the task is completed, and it assists with digital task, any kind of task that involves the digital use. And disadvantages are that we see that it necessitates higher overall cost. Not everybody can afford. People who are in the low socioeconomic arena, they cannot afford this. It causes job loss. So when the machines are doing it, there is no need for the individuals. There is no need for a healthcare provider to take up this job. And it lacks the ability to be creative. So whatever it is, a machine is a machine. It only does the work of a machine. So it cannot introduce any kind of creativity like the human beings. An emotional range isn't there. So there is no response to the emotional range. For example, a nurse can question, how are you feeling? And directly face to face, she has a conversation with the patient, but that we cannot expect with the machines. And there is inability to integrate ethical principles. So we are giving much of importance in the field of healthcare, in the field of nursing about the ethical principles that we cannot adopt when we are making use of the artificial intelligence in a healthcare or for the nursing care. So we find that there are certain things that we have discussed so far regarding this artificial intelligence, its importance, what way it is helpful, and what are the pros and cons, etc. So to conclude with this topic, I could say that healthcare is witnessing tremendous benefits from the applications of artificial intelligence. It has enabled the clinicians and also the providers of healthcare to digitize their services, which has led to world-class service delivery across the globe. So advancement in artificial intelligence, it is a revolution of healthcare, we could say, and we can expect artificial intelligence to support all sectors of healthcare, from diagnosis to the treatment, and from drug discoveries to the performance of surgeries. Artificial intelligence is poised to become a transformational force in the field of healthcare. So the application of artificial intelligence in healthcare has increased dramatically and will definitely continue to revolutionize the country. So you can, if there are any questions or any contributions in this area, I kindly welcome the delegates or the participants and any experts. No questions, no contributions. Hope I'm audible.
Yes, ma'am, you are audible.
If not, I would like to thank the SFNP Society for Nursing Practices for providing me an opportunity, this as a platform, and for all, not only for me, for all other nursing professionals, for uplifting the standard and for enriching our knowledge. And I also thank my principal, Dr. Hemam Sangita Devi, for enabling me to participate in this keynote address. Thank you so much.
Thank you, ma'am. It was really an informative session which emphasized on the rise of robotics and artificial intelligence. Artificial intelligence in nursing is a big data of analytics, is the boom of nursing field, which is the pathway to smart healthcare. Thank you once again.
Thank you.
I'd like to welcome our next keynote speaker, Dr. AIIMS Sangita Devi. Welcome you, ma'am. Dr. AIIMS Sangita Devi is currently working. is currently working as a principal of SEA College of Nursing, Bangalore, India. She has more than 15 years of experience in her field and has organized and conducted many national and international conferences. She holds the research coordinator position in her department and involves in teaching and supervising undergraduate and postgraduate programs, besides actively participating in clinical research. Her specialization and research interest includes critical care nursing and nursing leadership, and also nursing management. She has several publications in international healthcare journals and is a reviewer for international journals. Over to you, ma'am. I'd like to inform that the parallel sessions, child health nursing and obstetrics and gynecological nursing breakout rooms have been opened. The main hall session, that is Nursing Research 2, will occur after the keynote session. Participants, please be ready with your presentation. After 5 minutes of the keynote session is over, main hall session Nursing Research 2 will be started. Thank you.
Yeah, thank you very much. Good afternoon, one and all the participants. And hope you feel exhausted from morning you are listening. I do not know how far you will be listening for our topic. Anyway, we will start. And I'm extremely...
I request you to turn on your video, ma'am, if it is possible.
It is on. It is on. Is it visible?
Yes, ma'am. You can start with your presentation.
Yeah. Slide cannot do it.
Please unmute yourself and start your presentation, ma'am.
Yeah. Slides little problem here. Anyway, I'll start. I'm extremely thankful to the Society for Nursing Practice for organizing the conference, which fostered to the upliftment of nursing profession. Thank you so much for giving me this opportunity to explore more, be more fearless, and adapt to change better. Thank you. Yeah, I will talk on the topic of emerging and re-emerging diseases and the threat of bioterrorisms. So before that slides, starting from the beginning, I just want to mention about the objectives. The participants will have a clear understanding of emerging, re-emerging diseases and the threat of bioterrorisms and apply this knowledge in prevention and management of the same. And about the specific objectives, at the end of session, participants will be able to define emerging and re-emerging diseases, list out factors contributing to the emergence of infection disease, explain epidemiological threat related to emerging and re-emerging diseases, list out the causes of emergence and re-emergence, enlist emerging infections, disease and re-emerging infections diseases. These are come under the specific objective. And continuation of specific objectives that explain preventions of emerging infections disease, describe role of nurse in prevention and control of re-emerging infection disease, define bioterrorisms, explain reasons for using bioterrorisms, list out agents of bioterrorisms, and describe public health emergency, preparedness, and response to bioterrorist attack. So about the introductions of emerging infectious and re-emergence, emerging infectious diseases are disease of infections origin, and over 30 new infections agents have been detected, and throughout the history, communicable diseases have impacted the existence of mankind. However, the threat of these diseases has increased in many folds as time progressed and human populations exploded. The incidence of epidemic has made a marked time to time across the globe as connected communities grew. Diseases like influenza, smallpox, malaria, HIV, and tuberculosis have made a mark and thrive. Millions of lives have been lost as a result of these dreaded diseases. The recent COVID-19 pandemic inflicted the entire world, reminding that we are constantly under threat. Not just this global outbreak caused a heavy impact on the mortality rate, but also throws the global socioeconomic conditions out of gear. Billions of dollars are estimated to be lost, impacting agricultural production, weakening supply chains, increased trade deficit, increased unemployment, and massive job loss. Time and time again, this epidemic has challenged the medical fraternity. Questions such as, do we have the power or proper technology to neutralize these threats? Are we sufficiently equipped to face these threats? How much are we prepared? Not just the medical community, but these questions also bring the authorities and governments into the pictures. The answer to these questions are not simple and often controversial. In many of the occasions, people of the world are looking for a satisfactory answer. So let us see that what is the emerging and re-emerging infectious diseases. Here, the definitions of emerging, according to the medical definitions, they have given here that an emerging disease is one that has appeared in a population for the first time and may have existed previously, but is rapidly increasing in incidence or geographic range. And also it threatens to increase in the near futures. It is according to the WHO. And about the re-emerging, World Health Organizations have given the definitions. That is, a re-emerging disease is the one already occur and control, and once again the same cases are rising with new threats. So these are the simple definitions has given by the medical and recognized by the WHO. Next, we will see for factors contributing to the emergence of infectious diseases. Here we have demographic change and populations distributions. That perhaps the most contributing factors than any others, the global demographic changes and populations distributions continue to evolve rapidly, contributes to the globalizations of infection disease. Advance in medical treatment has led to more better life expectancy. In addition, the growth of people with immunosuppressions for various chronic medical conditions continues to fuel the spread of these diseases, especially in demographic factors. In these demographic factors, the population's growth and migrations and differential mortality alter the global demography. The population explosions in the planet with millions of people being added each year. Industrialized nations continue to aid and older people with chronic disease with better medical facilities and sanitations. As the elderly population increase, they are susceptible to infection disease due to declining immunity, and hence they increase the potential transmissions for communicable pathogens. Under the population distributions, in this population distribution is very rapidly changing with urbanization, especially in developing countries. The rapid growth of cities has forced the people in rural areas in search of better employment opportunities. Overcrowding and poor living conditions in this place provide ample ground for the spread of communicable disease like tuberculosis, cholera, and many other respiratory diseases. That is the reason we concern these demographic changes and population distributions as a factors contributions. Second one, human behavior and societal changes. Societal changes over the course of time, like increase in the employment of women, changes in food preparations and supply have increased the exposures of humans to infections, diseases. Under this human behavior, we have made three categories. It is sexual behavior and child care. And sexual behavior, we will see here in sexual behavior, societal attitude changes regarding premarital sexual activities and diversity have resulted in the rapid emergence of sexual transmitted diseases such as HIV, gonorrhea, syphilis, and human papilloma virus, etc. And also that multiple partners, sexual partners, same-sex physical relationship, and increase in prostitutions have resulted in the rapid spread of sexual transmission disease. And about child care, why we need this child care as a factors of contributions. Here, with the increase of working women folks, there is a dramatic rise in outside the home care of their children. Daycare system has mushroomed in all parts of the globe. The combinations of susceptible children, overcrowding, and unhygienic environment facilitates frequent episodes of common infections like gastrointestinal illness, cold and flu, etc. And kindergarten school also fall under the same scenario. That is the reasons we include this child care as a factor contributions for emergence and re-emergence. And the next slide continue with the human behaviors and societal changes, that is food and waterborne diseases. Here, rapid urbanizations and globalization has resulted in the blood habits of people around the world. And fast foods and packaged foods with more and more people dining outside of their home means that they are likely to be exposed to contaminated food even than previously done. Over the years, outbreak the gastrointestinal diseases like cholera and infections like enterocolitis cases due to Salmonella, E. coli have increased many folds. Cases of contaminated drinking water have caused havoc in many developing and underdeveloped countries. That is the reason here we include food and waterborne disease as a factors of contributing. And environmental changes, why we need to mention here for environmental changes. In recent phenomenon of global warming has caused a drastic change in the climate conditions of many countries across the globe. The rise in average temperatures have provided a favorable conditions to both the pathogens and vectors in expanding their populations and reach. Diseases such as malaria, dengue, yellow fever have shown a dramatic resurgence in the tropical regions, including Latin America, Central and East Africa and Asia. And about chronic manifestations of infectious disease. Infectious disease have created a substantial contributions to the total chronic disease burden. Despite costly and expensive treatments, infectious disease cast a big spell on the chronic disease mortality rate. Many among this chronic group also create a large pool of immunocompromised people who could be at the risk of contracting these infections. About enhanced detection, advancement in the clinical microbiological laboratory technology have resulted in the discovery and identifications of a number infectious agents in the recent years. The recent discoveries of these pathogens give an impression that these entitles have recently emerged, but the disease induced by these infections have around for a long time. Acute and chronic hepatitis A and B have been around for decades. With the advancement in the molecular cloning technique led to the detections of the new hepatitis virus C also enhanced detected. And microbial evolutions. Microorganisms are constantly evolving in response to the direct and indirect selection pressures in the environment. Respiratory pathogens, influenza virus is a very prominent example of such an evolutions. Many antigens and variations of the virus have evolved in a short span of time, causing annual epidemics. Influenza virus has been known to infect a diverse range of hosts, especially avian species. When the virus recently crossed to the humans, it came to be as bird flu. The emergence of drugs resistance microbes over the recent years is another source of concern. Abuse or overuse of antibiotics has been a major contributor to such a scenario. And breakdown of public health systems and biothreats. Here, the recent outbreak of SARS, COVID-19, has proven that the sudden outbreak of a large epidemic can shake and overwhelm the primary and public healthcare systems. Critical infrastructure support for public health initiatives is inadequate to at best and are not in a place in time. So these are the factors contributing to the emergence of infection diseases, that is demographic changes and populations distributions, human behavior and societal changes, environmental changes, chronic manifestations of infection disease, enhanced detection, microbial evolutions, breakdown of public health systems, and biothreats. Let us see for the epidemiological threat related to emerging and re-emerging disease. Here we have three categories, that is agent, host, and environment. Here in agent, the evolutions of pathogenic infectious agents such as bacteria, virus, fungi, parasites, helminths, these are come under the evolutions of pathogenic, and also some of the drugs develop of resistance that is wrongly prescribed by practice and non-adherence by patients, and sometimes use of anti-infective drug in animals and plants that might be the cause of this agent. And about host, that human demographic changes inhabiting in new areas and human behavior, say for example, unsafe sexual practice, it may cause HIV, gonorrhea, and syphilis. And sometimes it changes in agricultural and food production patterns. It might be for foodborne infections agents, especially from E. coli. And it also increased the international travel, like influenza and H1N1, SARS, COVID-19, all these also increased because of that international travel. and human susceptibility to infections, that is immunosuppression, and also poverty and society inequality. All these come under the host epidemiological trait. And the last one, that environment. Here in environment, changing ecosystem, global warming, food processing and handling, and deteriorations in surveillance systems. So these are the points come under the environment, but especially for changing ecosystems, the deforestation leads animals to have close human contact, which increase the possibility for agents to bridge species barriers between animals and humans. This triggers natural disaster and related outbreaks of infections, disease. In global warming, due to increase of urbanizations and industrializations, the spread of infectious diseases are increasing rapidly. And for food processing and handling, food act as an important vehicle for spread of infectious agents. And lack of political wills that comes under the deteriorations in surveillance systems. So these are the main important which is lead for the environment. And next slide goes to that causes of emergence and re-emergence. It is etiology of emergence and re-emergence. Let us see for the causes for this emergence. Here we have only two causes for emergence and re-emergence, that is unknown infections agents and non-agent. Here, for example, unknown infections agents, like a fever of unknown origins. Say, for example, that fever at least 101 to 103 degree Fahrenheit that lasts for 1 week or 2 weeks, but it was not subsided with any medicines. But unless until they go for the investigations, they will not know that what kind of infections they have happened. So that is the reasons we should find out that what agents have attacked and how the body temperatures become rise. So that few things we will not know that what agents is attacking and getting high temperatures in our body. And again, for the non-agents, it might be like fungal or bacteria or viruses or protozoa or helminths. Unless until we do that microscopic examinations, we will not know that what agents attacked it in our body. So here in emergence and re-emergence, especially for this etiology, we have include only two, that is unknown infections agents and also non-agents. And here list of emerging infectious diseases, few slides we are displaying. But in 1944, it started with hemorrhagic fever, that is in Crimea. But all this slide, it is not much important. I'll skip the slides. Especially here, you can see in 2011, that Ebola fever, it was started in Congo, Uganda. And again, 2014, the same fever Ebola was repeated in West Africa, and COVID-19 was started in the year 2019 in China. So these are the few examples which is I'm giving for the emerging, because in emerging infections, so many lists are there, but only recent one I'm mentioned here from 2011, that is Ebola fever again in 2014, and again in 2019, it is COVID-19. And list of re-emerging infections diseases. Here also, whatever it is affecting, that means in the definition itself, we came to know that what is the emerging and re-emerging. The first appearance in human, and again reappearance in the human. That is how we said that emergence and re-emerging. Here already in 1944, that Congo hemorrhagic fever have seen in Crimea, but again in the re-emerging in 1956, the same disease is reappearing in Congo. It might be changed the country, but name of the disease is repeating again after 9-10 years. So that is how we consider that re-emerging infections, it's happening again in human's body. Recently in 2020, that it starting again, it was started by 2019 in China and start again to 2020. So we consider as a re-emerging virus or re-emerging disease. And this COVID-19 started in worldwide. Again, in 2021, COVID-19 was spreading to worldwide. And in 2020-21, Zika virus was affected in India, especially in Kerala state. And in 2022, monkeypox started in multi-country. So these are the few name of the disease which I list out in the re-emerging and also that emerging. Now let us move to the another slide for top 10 identify emerging disease by WHO. Initially, the WHO listed out 8 diseases need urgent attention, which includes Crimean Congo hemorrhagic fever, which is affected in the emerging and also the re-emerging disease, Ebola virus. All these are the, initially, the WHO have announced that these are the diseases which we need urgent attention. That is how we focus here. The Crimean Congo hemorrhagic fever, it is also called that CCHF and caused by infections with tick-borne virus and also called that norovirus. And the next, Ebola virus disease. This Ebola virus disease also called as a Ebola hemorrhagic fever, and it is a rare but it's very severe and often fatal illness in humans, and it's also caused by an infections with a group of virus within the genus Ebola virus. And the third one, it is Marburg. This Marburg also same like a severe hemorrhagic fever. And the next, it is Lassa fever. This Lassa fever is an animal-borne or zoonotic acute viral illness spread by the common African rat, and this also very severe disease. And MERS, M-E-R-S, that is Middle East Respiratory Syndrome. It's a viral respiratory illness that is new to humans, and it was first reported in Saudi Arabia 2012. And SARS coronavirus disease. The SARS coronavirus disease also, it's very severe acute respiratory syndrome caused by coronavirus. And Nipah virus. This Nipah virus also, it is a zoonotic virus. And the leaf valley fever. That leaf valley fever is an acute viral disease that affects domestic animals such as cattle and buffalo, sheep, goat, and camels. So from the domestic animal only, it spread the infections. And these are the 8 diseases which we need urgent attentions. And other 3 diseases were designated by WHO as serious require attention as soon as possible. That is the chikungunya. Everyone knows that it is a virus spread to people by the bite of an infected mosquito, and severe fever with thrombocytopenia syndrome. That is newly recognized and viral hemorrhagic fever, and it also called as a tick-borne infection. And the last one, it is Zika fever. The Zika fever also look like, it is like a similar dengue fever and yellow fever. So these are the top 10 which is selected by the WHO for giving urgent attentions. Now let us move to the preventions of emerging infection disease. How to prevent for these emerging infections diseases. Here we have organized for around 4 interdependent goals like surveillance and response, applied research, infrastructures and training, preventions and control. Mainly here in surveillance systems at the state and national levels monitor emerging microbes and detect outbreaks of disease. When surveillance data or other informations uncover a change in the occurrence of distributions of a disease, or when a new strain of microbes becomes a health threat, public health workers investigate, assess the potential public health implications, and mount a rapid response. Through applied research, they provide answers to questions about the disease cause, transmission, diagnosis, prevention, and control. So here we need to have a strengthened infectious disease surveillance and response, improve method of gathering and evaluating the surveillance data, ensure the use of surveillance data to improve public health practice and medical treatment, and strengthen global capacity to monitor and respond to emerging infectious disease. And come to the applied research. In applied research, here various organizations like CDC, National Institutions of Allergy and Infectious Disease, National Institutions of Diabetics, and Digestive and Kidney Disease, and research contributions in field of HIV and AIDS, tuberculosis, malaria, hepatitis C, or better understanding of pathogenesis, host immunity, advance in genomics and proteomics, and drugs resistance, and identifying new drugs target and develop new vaccines and diagnosis. Here, mainly for the applied research, they focus on develop, evaluate, and disseminate tools for identifying and understanding emerging infectious disease, identify the behaviors, environment, and host factors that puts persons at increased risk for infectious disease and their sequelae, conduct research to develop and evaluate preventions and control strategies in the target areas. That is how they require that research, applied research for these preventions of emerging infectious disease. And in infrastructures and training, why we need here? Here, rebuilding the public health infrastructures will require an ongoing and sizable investment in modernizations and training to boost local, state, national, and global disease monitoring power and to augment outbreak response expertise. These improvements are the only way to prepare trained experts, well-equipped laboratories, and cutting-edge technology to head off emerging microbes in the decades to come. Public health infrastructures and training support public health actions. Mainly, we have to focus on that enhanced epidemiologic and laboratory capacity, improve CDC ability to communicate electronically with state and local health department, healthcare professionals, and others, enhance the nation's capacity to respond to the complex infectious disease threats internationally, including outbreaks that may result from bioterrorism, support and promote the disease control and preventions internationally. Last, that is preventions and control. It involves building a team, obtaining access, the traveling to affected area, recommending and implementing control measures. So we should implement and support and also do the evaluate the program for the preventions and control of emerging infections, the disease, and develop, evaluate, and promote strategies to help healthcare providers and other persons' behavior that facilitates disease transmissions. And especially we should do and we need support and promote disease control and preventions internationally to reduce occurrence of disease by proper immunizations and prophylaxis, to reduce transmissions of disease by isolations and universal precaution, to decrease morbidity and mortality rate, to reduce financial burden to the populations and country. That is how we need to focus on that preventions and control for emerging infections diseases. And here we will continue the same preventions and control of emerging and re-emerging infections disease. That controlling the reservoirs, interrupting the transmission, protecting the susceptible hosts, strengthening of the disease surveillance system, encouraging research for treatment, diagnostic, and methods of control measures. Here, target of areas of prevention, especially foodborne and waterborne infections and antimicrobial resistance, vector-borne and zoonotic disease transmitted through blood transfusion or blood products, and chronic disease caused by infections agents. And we have to arrange the vaccine development and use, disease of persons with impaired host defense, disease of pregnant women and newborn, and disease of travelers, immigrants, and refugees. All these we need to control and prevent. And also the role of nurses will continue here. And before this, I'll just continue for this slides, that is preventions and control of emerging and re-emerging, that is establishment of drug resistance, a proper sewage treatment and disposal, food safety program, and vaccinations program. So here shortly I'll explain about the controlling the reservoir, that is the early diagnosis of infection disease and notifications of infection disease case to the local health authorities so that control measures can be implemented, and early treatment of the disease. And quarantine is much because the quarantine by limiting the freedom of movements and interrupting of disease transmissions, breaking the chain of transmissions through isolations, safe water supply, control of insects and rodents. And also we can suggest for the immunizations of the susceptible hosts. And non-specific measures taken to improve the general sanitation's nutritional status and educations have an important role in controlling and preventing disease. And collaborative role as a nurse should work collaboratively with other public health professionals to establish immunizations and educational programs to improve community infections control policies and to develop a broad range of service to populations at risk. Here, role of nurses: monitoring of surveillance, controlling the reservoir, early treatment of disease, okay, then quarantine by limiting the freedom of movements. So monitoring of the surveillance here, sentinel surveillance, a method of identifying the missing case and thereby supplementing the notified case known as sentinel surveillance. And controlling the reservoir here, we should do again for early diagnosis of infection disease. And also we can focus on early treatment of the diseases. And we should keep for quarantine by limiting the freedom of movements. And it requires for isolations for a few days. And again, immunizations of the susceptible hosts and chemoprophylaxis, non-specific measures, collaborative role. Yeah, so we'll continue with the bioterrorisms. And bioterrorism is the intentional release or threats of release of biologic agent. Yes, in order to cause disease or death among human populations or food crops and livestock, to terrorize civilian populations or manipulate the government. Here, the key reasons for using bioterrorisms: to produce high degree of morbidity and mortality rate, high person-to-person spread with low infective dose. Rapid diagnostic measures should not be available, and vaccines and any other medications should not be available, and decrease the economical growth of the country. Yeah. So key reasons for using bioterrorism, it is to produce high degree, okay, then spread with low infective dose, then decrease the economical growth of country. Then agents of bioterrorism, so we have three categories of bioterrorism. It is category A and category B, category C. In category A, these high priority agents include organisms or toxins that pose the highest risks to the public and national security because they can be easily spread or transmitted from persons to person. They result in high death rates and have the potential for major public health impact. They might cause public panic and social disruptions, and they require special actions for public health preparedness. And for the category B, these agents are the second highest priority because they are moderately easy to spread. They result in moderate illness rate and low death rates. They require specific enhancement of CDC's laboratory capacity and enhanced disease monitoring. And in category C, these third highest priority agents include emerging pathogens that could be engineered for mass spread in the future because they are easily available and they are easily produced and spread, and they have potential for high morbidity and mortality rates and major health impact. And about agents of bioterrorism, here also the same, we have divided into category C, that is category A, B, and C. These are the agents name I have mentioned here. Please check the slides. These are the category A and B continuations, but we have agents of bioterrorism for category C. And public health emergency preparedness and response to bioterrorist attack is very important. Here, the preparedness phase, early warning phase, notification phase, response phase, and recovery phase. In the preparedness phase, this phase include action to be taken by different agencies to ensure required state of preparedness. This include evaluations of the laboratory facilities and upgrading the same, and evaluating the hospital preparedness in emergency response and case management in case of an imminent attack, conduct training of health professionals, rapid response team and quick response medical team who would be the first response, work out the legal provisions and their implications, ensure that requirements of safe drinking water is met, ensure availability of adequate stocks of medicines and vaccines, coordinate with security organizations, organize mock drills for health professionals, government departments, animal husbandry, security, law enforcing, and other agencies so as to assess this preparedness level to act in case of an attack. Prepare contact details so that communication is unhampered during the attack. Public should be kept aware about imminent attacks so that voluntary reporting is encouraged for the preparedness phase. And in early warning phase, the early warning phase, here the surveillance systems includes activities like case definitions, notifications, compilations, and interpretations of epidemiological data. Early detections and rapid investigations by public health epidemiologists is critical in determining the scope of magnitudes of the attack and implement effective interventions. And the third one, the notification phase. In the notification phase, it is mandatory to report any unusual syndrome or usual syndrome in unusual numbers to appropriate authorities. The activities in this phase include rapid epidemiological investigation, quick laboratory support for confirmations of diagnosis, quarantine, isolation, keeping healthcare facilities geared for impending casualty management, and involving public health facilities for control. And in response phase, we need to have activities include like rapid epidemiological investigations, quick laboratory support, mass casualty management, and initiations of prevention, curative and specific control measures for containing the further spread of the disease. In order to achieve them, we have listed out the topic that heading assess the situations, how we will assess the situations. Here, initiate the response by assessing the situations in terms of time, place, and person, distributions of those affected, route of transmission, its impact on critical infrastructures and health facilities. The agencies and organizations involved in responding to the event communicate to the public health responders, local, state, and national level emergency operations, centers for event management, etc. And come under the contact key health personnel that contact and coordinate with personnel within the health department that have emergency response roles and responsibilities, record all contact and follow-up actions. And develop actions plans. In develop actions plans, develop initial health response objectives that are specific, measurable, and achievable. Established in actions plan based on the assessment of the situations, assign responsibilities, and record all actions. And the last, that implementations of the action plan. What we will do here, the list of does and don't are circulated throughout the print and electronic media. The hospitals ensure that appropriate isolations, quarantine, waste disposal, and personal protective measures, all contaminated clothing and equipment are carefully disposed of by incinerations. And impact reassessment team assess the impact of the attack of humans and animals and plants. And the recovery phase. In the recovery phase, the setbacks suffered as a result of the bioterroric attack are restored, and lessons learned in this phase are incorporated in the future's preparedness plan. The damage done to the public health facilities and essential items utilized during the response phase are replenished. Public advisors are also issued regarding restorations of normalcy. The RRT compile and analyze data to identify the deficiencies experienced in the implementations of the response measure. The necessary modifications are then incorporated in the contingency plan for futures. These are the emergency preparedness we should respond to bioterrorist attack. And here some research have shown that emerging infectious diseases, and the results are found that the majority of the scientific surveillance effort focused on countries from where the important EID is least likely to originate. And here we will focus for the recapitulations, just review. Before conclusions, I just want to find out. Okay, what are the two kinds of transmissions what we have mentioned, that is direct and indirect? And why do disease re-emerge? That is happen breakdown in public health measures for disease that were once under control. They can also happen when new strains of non-diseases causing organisms appear. What is the most effective way to prevent infections? Proper hand washing is the most effective way to prevent spread of infections. So before this, I just would like to conclude my topic that the bioterrorism remains a legitimate threat both from domestic and international terrorist group. From a public health perspective, timely surveillance, awareness of syndromes resulting from bioterrorism, epidemiologic investigations capacity, laboratory diagnostic capacity, and ability to rapidly communicate critical informations on a need-to-know basics to manage public communications through the media are vital. Ensuring the adequate supply of drugs, laboratory reagents, antitoxins, and vaccines is essential. Formulating the putting into practice drills at all levels of healthcare will go a long way in minimizing majority and morbidity in case of a bioterroric attack. There is need to collaborate and create a integrated network to share knowledge and technology to deal with such threats at the earliest. Thank you for listening. And this is the reference which I have got from the internet. Any questions? Please welcome. Thank you.
Thank you, ma'am, for an informative session dealing with emerging and re-emerging disease from global to local perspective. The world has faced the threat of COVID-19, and there are chances to face the same or different issue in future also, which is unpredictable. Thank you for detailing us on the various dormant diseases, and we as nurses will be aware all time. Thank you.
Thank you.
We are happy to announce yet another grand and global nursing conference organized by Society for Nursing Practices and Narayana College of Nursing, Nellore, India. Fifth International Conference on Futuristic Nursing, which will be conducted on 28th, 29th and 30th of October 2022 at Narayana College of Nursing, Nellore, Andhra Pradesh, India. The conference will emphasize on the theme Futuristic Nursing, Navigating Beyond the Horizon. It is a hybrid event physically conducted in one of the renowned institutions, Narayana College of Nursing, Nellore, Andhra Pradesh, India. All the participants are requested to join the event and experience the future of nursing. The main key topics discussed are future of nursing, digital to physical, future of healthcare, pathways transforming the future of nursing, digital health technologies, and bioinformatics. Do not miss the opportunity to be the part of 5th International Conference on Futuristic Nursing. Mark your dates and your calendar and be a part of this global event. Thank you. Now we'll move on to the scientific sessions of day 2. The child health nursing and the obstetrics and gynecological nursing are parallelly going on. The participants who are in the main hall can move to the breakout rooms, which is respectively given to you, so that you can start with your presentation. I repeat, child health nursing and obstetrics and gynecological nursing separate breakout rooms have been done. The presenters who are in the main hall, you can assign yourself to the child health nursing and obstetrics and gynecological nursing to do your presentation. We'll start with the presentation of Nursing Research 2. Rules and regulations of the presentation. Oral presentation will go for 8 minutes of presentation and 2 minutes of discussion, and the poster presentation is 4 minutes of presentation and 1 minute of discussion. Please keep up with your timing. Kindly don't mistake me if I stop you when your time is up. I'd like to welcome our session chair for Nursing Research 2 session, Dr. Seema Singh, Principal and Professor, Srimati Radhika Bai Mege Memorial College of Nursing, DMIMS, Maharashtra, Wardha, India. I welcome you, ma'am.
Thank you, ma'am.
We'll be totally having around 17 presentations today. You'll be evaluating the session. I introduce Dr. Seema to all the presenters. You're free to ask the questions, any questions to the presenters, ma'am.
Sure, ma'am. If I have doubts, I will be asking them.
Definitely, ma'am. Thank you.
Thank you.
I'd like to call upon our first presenter, Lakshmi Biswas, who will be doing e-poster presentation from ESI Hospital, Manikkatla, Kolkata, West Bengal, India, on the topic, a study to assess the incidence of phlebitis and the factors responsible for it among hospitalized patients receiving intravenous medication. I hope Lakshmi is not joined yet. We'll move to the next presenter. Oral presentation by Shiba Annie Chako, Rufida College of Nursing, Jamia Hamdard University, New Delhi, India, on the topic, a study to find the effectiveness of structured teaching program on knowledge regarding medico-legal aspects in care of terminally ill patients among staff nurses at selected hospitals, Murabad. I request Reshma, MSc Nursing, second year Jamia Hamdard, to stop sharing your screen so that Shiba Annie Chako will be able to share her screen. Ms. Shiba Annie Chako, please share your screen and start with your presentation.
Yes, ma'am. Thank you, ma'am, for introducing me. Hope my screen is visible to all of you. And
Yes.
my voice is also audible for
Yes,
you
you
all.
are audible and the screen is visible. You can present.
Okay.
Thank you.
Lesson in life will be repeated until they are learned. A very good afternoon to all of you who are present here. So my topic is one of the same, that the medico-legal aspect, and my name is Shiba Annie Chako. So according to a quotation which is being told by Princess Diana, carry out a random act of kindness with no expectation of reward, safe in knowledge that one day someone might do the same for you. So the introduction. Nurses worldwide need to continue to look for solution, choices, and outcome for patients that represent the best available knowledge internationally to continually improve and authenticate nursing. As the leader in nursing profession knows that we are legally responsible for what we do in our action. Likewise, nowadays the public are aware about law. As you all know, that the public are more aware about the technologies and they are more updated. So we as nurses, we need to take much precautions so that we are able to take care of ourselves and for our patients also. And according to that, how could we do a proper recording of that? We can do a proper documentation and we can do a daily routine and decisions, whatever we are making, if we do well, so we could protect ourselves. And there are different laws, what I have taught in my teaching, I'll be just showing them. So according to my need of the study, every nurse must be aware to protect themselves from these ethical issues, so that thus to prevent all these legal issues, it is responsibility of we as nurse to be aware about legal responsibility, which is becoming more important in today's healthcare industry, as it was discussed in our conference. So statement of the problem, that is the effectiveness of structured teaching program or knowledge regarding medical legal aspect in care of terminally ill patient among staff nurses at selected hospital Moradabad. And the objective of the study were to assess the knowledge of the staff nurses and to evaluate the effectiveness of structured teaching program and to find the association of the staff nurse with their socio-demographic variables. The hypothesis were, first, was the significant difference between the pretest mean score and the post-test mean score, then to find out the association between the pretest knowledge and with their demographic variable. Coming to the methodology, the research design, that is the quantitative research approach with quasi-experimental research design was used, and the population was staff nurses. Sample were the selected staff nurses at Moradabad, and non-probability sampling technique using purposive sampling was applied, and 60 sample were the total size with structured knowledge questionnaire was the tool used. Analysis is being showed further. That is, you could see from the section A, it is being table which is being represented, and it is different social demographic variable they are being represented, which we could well visualize with the help of diagram, that a bar diagram which is representing social demographic variable, where the age below 30 years, the participants were more in this, and gender both were there. Both the male and female has occupied, and qualification, most of the staff nurses had GNM. Whereas the source of information they got from continuing education and books, and most of the staff nurses were from the ward. Coming with the distribution of sample according to their pre-test and post-test knowledge level, in experimental and the control group, that is the total population, the sample size was 60, we divided it into inadequate, moderate, and adequate, where you could see the range of score 0 to 10, 11 to 20, and 20 to 30. Here you could clearly see, that the adequate knowledge in pre-test was nothing. When we compare to the post-test, they had gained a higher level of knowledge as compared to the control group. There was no person or the staff nurses were there in the higher level of knowledge in the post-test. Same like that, it is being represented with the bar diagram, that the adequate level of knowledge was being achieved by the staff nurses who were in the experimental group after the post-test. Coming with the range, mean, medium, and the standard deviation of the experimental and the control group, you could see that yes, there is a vast difference in the experimental of the mean, that is 10.47 to 22, where if you compare with the control group, as such, there is very slight deviation in the control group. When we come to the table 4, that is the effectiveness of structured teaching program in the experimental group, if we see, and if we need to see the structured teaching program, its effectiveness, when we see the t value being 20.3 and compared to the 2.05, that it was significant. Then when we compare with the experimental and the control group, their post-test knowledge, so as I have already mentioned, that the mean score were higher in the post-test knowledge of the experimental group, and the control group, it was 10.37. So you could see that it was significant, the study was significant with the structured teaching program. Same, it is being represented with the diagram. You could well identify that the experimental group was showing the highest knowledge level, and the association, as such, it was not significant. Coming with the discussion, the current study result and the comparative study result. Here, if we see that the study which is being done by Malrevi and Samson, so the study which is being conducted on the knowledge and attitude of nurses on legal aspect in patient care, you could see that 44% of the nurses had poor knowledge. So we as nurses, I did the study, that the current study shows that yes, there was a significant difference between the pre-test and the post-test knowledge, where you could see the mean difference between the two score. Next, coming to the current result, the current study, and the comparative result regarding the structured teaching program. Then we saw a study here, that is Malley, Ramling, and Malley Newton. Here, when you see that the study which is being done on the knowledge regarding medical legal responsibilities among the nurses, here 70% of total sample did not attended any in-service education, and where these around 96% of these nurses were responsible for involved in medical legal case. Can you imagine? But when I did so according to that, when we compared my study, that is structured teaching program, when we calculated the t-value, it was 20.39. So it was a study which is significant. So this was the summary findings according to the age, regarding the age, gender, qualification, source of information, and the experience in our socio-demographic variable. And then the section B tells us about the post-test level of knowledge, and it was really a significant finding. You could see the comparison. Then section C, where structured teaching program, we had calculated the t-test to compare, to see that it was significant or not, and the comparison of the pre-test and the post-test knowledge of both the control group. Okay, then, so conclusion is that nurses should be provided with proper information and training to understand how to deal with a situation that can jeopardize their career if they do not take a decision that is justifiably legal and not just ethically. So please be careful whenever you are caring your patient. You need to be legally as well as ethically responsible while taking care of your patient. Most of the nurses are less updated regarding medical legal aspect. You might be thinking, what is medical legal aspect? In my study, it was actually regarding certain terminologies. As we had seen, there were certain discussions being held also. So you might have heard also or learned in your this college, that is, it is regarding advanced directive, medical power of attorney, durable power of attorney, tort, like that. There were different terms. So when I had gone through the studies, it was really imaginable that very less staff nurses were aware about them. But in this era, you need to avoid these issues to safeguard them and to provide the best quality care of the patient. It is responsibility of each nurses to be aware about the medical legal aspect, which are meant for medical and legal welfare of the patients. As we are nurses, we need to work for our patient. Being a good Samaritan nurse, as I had one of the term in my structured teaching program, that is good Samaritan law. So we need to fight for the justice of a patient, for the right of the patient. Don't think that something will happen to us. And there are different laws which are there in the medical legal aspect. Today or tomorrow, doctors won't be responsible for us. Even today also, there are many times we faces a lot of problem. And at time, doctor won't come for the nurses to protect our right. So we as nurses, we need to stand for us and for our patient also. So according to the Martin Luther King, according to him, he said, the first question that the priest and the Levite asked was, if I stop to help this man, what will happen to me? But the Good Samaritan reversed the question. If I do not stop to help this man, what will happen to him? So it is better, try to help your patient, take care of them, rather leave them or do a negligence or malpractice. So this was the glimpses of my study. It was the references. Thank you for patiently listening. Try not to close, while doing care, try not to close your eyes or your mouth, but being a vigilant nurse and a proper care provider and a keen observer and listener, please take care of your patient at time of emergency, and at any time, try to document each and every information so that you are being protected from the medical legal issues. Thank you all for listening.
Thank you for your presentation. Dr. Seema Singh, it's open for the discussion.
Yeah. Shiva madam?
Yes, ma'am.
I have got only two questions. First question is, how did you calculated your sample size?
Okay, ma'am.
And second is, what was your research methodology? Means which design you have taken to do it?
Ma'am, I took the quasi-experimental.
Okay.
That is pre-test design.
Pre-test one group, or did you had a control group also?
Yes, ma'am. Pre-test control group also I had.
Okay, so you have taken quasi-experimental 2 group pre-test and post-test.
Yes, 2 group pre-test and post-test. Yes, ma'am.
Okay, and how did you calculated your sample? Total 60, or you have taken each group 60-60?
Ma'am, actually 30 I took, that is 30 for experimental and 30 for staff nurses. Actually, I had I faced difficulty while collecting the staff nurses. They were not allowing me because actually they were in the shifts, that's why. So 30 I took in the experimental and in the control group.
Okay, as it is very important topic, because if your samples were little,
yes, ma'am,
size was little bigger.
Yes, ma'am. Yes, ma'am. It was a best study. I too know, and that is also my recommendation of the study, that the sample size should be larger.
Yeah,
Yes,
it is not only that you can include the ICU. Which nurses you have taken emphatically?
Ma'am, even my topic itself says that the terminally ill patient, but I even focused on the OT and ICU nurses, but because they are most of the time busy with the OTs and so the nursing superintendent told it is better to inform everyone, let all of them learn. It is not about just taking care of only the particular point of aspect. Because when I did the pilot study, so I faced difficulty at that time. I was not able to get all the ICU nurses or all the critical care nurses.
Yeah, that's why.
Yes, ma'am. I took
whether you have, if you could have calculated and if you could have taken all the nurses, then it would be better. So
yes,
that would have given a much more impact of your study.
Yes, ma'am. Surely.
Okay. Okay. Thank you so much.
Okay, ma'am. Thank you so much. Thank you, organizer, for giving me a chance to present here. Thank you very much.
Thank you, ma'am. I'd like to call upon our first presenter, Suli Sen, for her oral presentation on the topic effect of a stimulation assisted training program versus mobile app based training program on first aid and basic life support among undergraduate nursing students of selected universities in Haryana. She is from the organization Teen Thakkar Mahavir University, Uttar Pradesh, India. Seema ma'am, please note, in your evaluation, she will be the first person. Professor Suili Sin, please unmute yourself and start with your presentation.
Is it audible now?
Yes, you are audible and your screen is also visible.
Okay, ma'am. Thank you. So I would like to present a pilot study report of my study. Where the problem statement goes, a quasi-experimental study to evaluate the effectiveness of the simulation-assisted training program versus mobile app-based training program on first aid and basic life support on knowledge and practice among the undergraduate nursing students in selected universities of Haryana. The objectives of the study to assess and compare the knowledge and practice of UG students related to first aid and basic life support before and after administration of SATP. Second, to assess and compare the knowledge and practice of UG students related to first aid and basic life support after and before administration of mobile app-based training program. Third, to compare the knowledge and practice of undergraduate students on first aid and basic life support after the administration of SATP and mobile app-based training program. Fourth, to determine the relationship between the knowledge and practice of UG students before and after administration of SATP and mobile app-based training program. Fifth, to determine the association of knowledge and practice of UG students with selected demographic variables like age of the student, gender, name of the course studying, socioeconomic status, source of information, and undergone any certified training program on first aid and basic life support. The variables are: independent variable was SATP on first aid and basic life support. Second one is the mobile app-based training program on first aid and basic life support. Dependent variable was the knowledge and practice of UG students on FA and BLS. Third, extraneous variables, as I have already mentioned in the point objective number 5. The hypothesis where H1 was there will be significant difference in the pre-test and post-test knowledge scores of undergraduate students after implementation of SATP on first aid and basic life support as assessed by the structured knowledge questionnaire. Second, there will be significant difference in the pre-test post-test practice scores of UG students after implementation of SATP on first aid and basic life support as assessed by structured practice checklist. Third, there will be significant difference in the pre-test and post-test knowledge scores of UG students after implementation of mobile app-based training program on first aid and basic life support as assessed by structured knowledge questionnaire. And fourth hypothesis was the same. Instead of there is knowledge, the practice will be assessed. The fifth hypothesis, there will be significant difference in the post-test knowledge scores of the UG students receiving SATP mobile app-based training program on first aid and basic life support as assessed by the structured knowledge questionnaire. Sixth, there will be significant difference in the post-test practice scores of the UG students receiving SATP and mobile app-based training program on first aid and basic life support as assessed by the structured practice checklist. Seventh hypothesis, there will be significant correlation between the pre-test and post-test knowledge and practice scores regarding first aid and basic life support among the UG students. And eighth one, there will be a significant association of the pre-test and post-test knowledge and practice scores with the selected variables among the UG students. Coming to the research methodology, as affiliated by INC and also by the colleges which are situated in the Haryana. Sampling technique, non-probability purposive sampling. Samples and sample size was the nursing students studying in colleges of Haryana, recognized by Government of Haryana, affiliated by Pandit B.D. Sharma University of Health Sciences, by Indian Nursing Council. In my was total 300 samples which was being
Sauli madam, we cannot hear you. Hello. 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 Hello.
Yes, ma'am.
Sauli, madam, we cannot hear, we cannot listen to you. I think there is.
This is Sushmita. Just a minute. She is sorting it out, I suppose.
Yeah.
Ma'am, can we move with the next presentation if you're not able to sort it out? Sauli Sen, ma'am.
Yes.
I hope there is a network issue from your side, ma'am.
Yes, ma'am. Is it audible now?
Yes, ma'am. Please make sure that
I
you're not in.
think maybe some network. Ma'am, I'm trying. If it is, ma'am, if it is running shortage with the time, we can proceed with the next.
Ma'am, we are moving to the next presentation, ma'am.
Okay, ma'am.
Thank you. Thank you for your presentation.
Thank you, ma'am.
I welcome our next presenter, Mr. Rajendra Kumar Sahu, Mahamana Pandit Madan Mohan Malviya Cancer Institute, Varanasi, Uttar Pradesh, India, on the topic retrospective analysis of stroma complication in ostomy patients visiting at level 2 tertiary care center in North India.
Hello, is my voice is audible, ma'am?
Yes, sir, your voice is audible and your screen is also visible. Please proceed with your presentation.
Okay, ma'am. Okay, so good afternoon to all. Myself Rajendra Kumar Sahu. Today I am going to present my research topic. The title of the topic is the retrospective analysis of the stoma complication in the ostomy patients visiting in at level 2 tertiary care cancer center in the North India. So first I would like to introduce the topic stoma. So stoma is the surgically created opening in the bowel that brings the bowel onto the surface of the abdomen. Stoma creation is performed to divert the flow of the feces or urine. There are three types of the stoma is made in the hospital setting. The first one is the colostomy. Is in this colostomy, the opening is made into the colon. Second one is the ileostomy. In that, a opening is made into the ileum. And third one is the urostomy. In that, opening is into the urinary tract. So these three major types of the stoma which is created in the hospital. So the serious complication need immediate reoperation, and patients who have the stoma may experience certain types of the physiological or psychological problem. In that, a poor stoma sitting, high urine output or high stoma output, skin irritation, ischemia, retraction, peristomal hernia, and stoma prolapse. These are the common complications which is faced by the stoma patients. Stoma complication is mainly classified in the two types, early complication and late complication. Early complication occurs within the 13 days of the surgery. In this, stomal ischemia necrosis, stoma retraction, mucocutaneous separation, and peristomal abscess. It is the common types of the early stoma complication. The next one complication is the late complication. So it's clear by the name. Late complication occurs after the 30 days of the surgery, and it includes peristomal hernia, stoma prolapse, and stoma retraction and stoma varices. These are the common types of the late stoma complication. Stoma complication may be minimized by and preventable by taking adequate measure. Several studies indicate that preoperative assessment and immediate care by the specialized stoma care nurse therapist can significantly reduce the complication of stoma after the surgery. And before surgery, if adequate stoma marking done before the surgery by the trained nurses and trained interostomal nurse therapist along with the doctor, and careful perioperative ostomy care and education of the patient by the ostomy nurse is essential to reduce the modifiable risk factor related to creation of the stoma. Aims and objective of this study is the aim of the study was the evaluating the retrospective analysis of the prevalence of the stoma complication. Objective of the study is the first objective of this study was a retrospective analysis of the prevalence of the early and late complication. Secondary objective of the study was finding the association between the prevalence and the socio-demographic profile of the subject. So in the next methodology, this study was the retrospective analysis. In that, the patient who visited in the stomach clinic between the 1st January 2021 to 31st December 2021, this all patient data is included in this research. In this research, 203 patients data were included in the analysis of the data, and for the analysis of the data, SPSS 21 version of the software was used for the analyzing the data. Then next result. So in the result, first I would like to say about the socio-demographic profile of the participant. So in this study, regarding the age, majority of the participant were belongs to the 18 to 40 year of the age. It comes 38.9% of the participants belongs to that age category. Next, majority of the participant were 41 to 60 year, that is 35.5%. And 19.9% were the age above the 60 year, and only 6.4%, that is only 30 participants belong to the age below the 18 year. Regarding the gender, majority of the participants were male, that is the 58.1%. Regarding the education, majority of the participants were having the education up to the secondary level. And regarding the surgery, majority of the participants were having the open abdominal surgery. It's incorporate 71.4% of the participants were having the open abdominal surgery. Regarding the year of the surgery, majority of the participants, that is 90.1%, patients surgery were done in the year of the 2021. And next, regarding the types of the stoma, majority of the participants having the ileostomy. It contributes 36% of the all the data. Then regarding the stoma complication, in overall the 203 patients, 183 patients having the no stoma complication. They were having the healthy stoma, and remaining at 9.85%, that is
Excuse me, sorry to interrupt. Your time is up. Please finish up with your presentation.
So only 9.85% were having the stoma complication. Regarding the association, there was no association exist between the socio-demographic variable and stoma complication. Then regarding the overall, in this study, 90.15% stoma patients were having the healthy stoma, and only the 9.85% stoma patients were having the stoma complication. This is the very minimal as comparing to the other study which is conducted in the North India and other part of the India. And in this study, the majority of the problem was the skin problem, that contribute to 5.91%, where the skin problem, and very least complication were the bleeding, mucocutaneous separation, and stoma retraction. It contribute only 0.46% of the complication. And this study only 1 year data were included. So it is suggested that for the better evaluation, more than 1 year data can be included. So overall, the conclusion of this study is the most of the complications that can be manageable by the preoperative assessment, like a preoperative stoma marking, or preoperative care and education to the patient and caregiver regarding the care of the stoma in home. So that measure can be taken to reduce the complication of the stoma. So it's all about my study. So thanks to all for listening patiently. These all are the reference in the that I have included their data in the research. So thanks to all.
Mr. Rajendra, I have got one question.
Yeah, ma'am.
Since your retrospective study it is there.
Yeah, ma'am.
You have shown in 2021, you have shown 183.
No, ma'am, 203 total participants were there. In that, 183 was the healthy, and only that 20 participants having the stoma complication. It was 203, ma'am. Total sample size was.
Okay, in 21, how many were there?
Ma'am, in 20, there was two types of the complication we are seen, ma'am.
No, I'm not asking about that. How many surgery occurred in 2021? Yeah, black slide.
This one, ma'am. This is total surgery, ma'am. In that, ma'am, there was some patient who did surgery in the outside and their data was not included. In our hospital, more than 200 surgery were done, ma'am.
In overall?
Overall, yeah, ma'am.
Okay, fine. Okay, so what were your issues while collecting this data?
Ma'am, regarding the collecting data, there was so many information were not included in that. So for that, I have seen that there was in our hospital EMRC facilities available, like online data is there. So I found that, and most of the data was not included. So I called that patient regarding the asking that. So that problem I faced, ma'am, during the getting information regarding that.
Okay, thank you.
Okay.
Thank you for your presentation. Next, I would call upon Bharati Sachdeva Saini, Faculty of Nursing, SGT University, Gurgaon, India, on the topic Post-Anesthetic Discharge Scoring Scales, a Systematic Review. Seema ma'am, please note that she will be 16th on your evaluation form.
Good afternoon, ma'am. Good afternoon, ma'am. Can I start?
Yes, ma'am, you can start. Kindly share your slides.
Yes. Thank you so much, ma'am. Thanks for allowing me. I hope the screens are visible now.
Yes, ma'am, it is visible. You can carry on.
Yes, thank you so much. So I have carried out a systematic review on post-anesthetic discharge scoring scales. Let me introduce myself. I am Bharati Sachdeva Saini, working as Associate Professor in Faculty of Nursing and also a PhD scholar in SGT University, Gurugram, Haryana. So the background of study is that why I have chosen this, that a number of scales are available to determine safe recovery from anesthesia and patient discharge readiness from post-anesthesia care unit. But it has been seen that there is no consensus on the clinical parameters which have been included in various scales that we look these in the upcoming slides. So PSU is an area in the hospital where the patients are placed in their immediate post-operative period, and a number of factors are considered while planning the discharge or transfer from the PSU. These include blood pressure, respiratory status, pulse, temperature, skin color or oxygen saturation, pain, nausea, vomiting, level of consciousness, activity, bleeding, oral intake, urine output, and psychomotor activities. And there are various scoring systems in the post-operative period which are available. These include post-anesthesia recovery score, Eldred score. This was the first one to be used on the post-anesthesia patients. And this includes the oxygen in place of oxygen saturation. It includes the skin color, because this was the time when pulse oximeters were not invented. Then after the time, modified Eldred score came into practice. Then based on the same lines,
Bharati ma'am, we could not hear your voice.
then the discharge is delayed. So we try to keep only those essential parameters which are actually essential for the patient's readiness for discharge. So the research design and method of my review included that it was a systematic review focusing only on the quantitative studies, and the retrieved literature from several databases was evaluated and organized as per the PRISMA approach. Electronic search strategies included that the databases of PubMed, ResearchGate, ProQuest, and Google Scholar were searched. Only English language publications were included in the search criteria, and the timeline which was set was from 2000 to 2022, and the reference list of included studies was also included. Methods of review that the abstracts were evaluated if they are suitable to be included in the review, and these inclusion requirements are mentioned as that only quantitative studies, as I mentioned earlier. And in terms of patient criteria, that the surgeries happened on adult patients only included, more than 18 years, no pediatric surgeries were the part of this. Both males and females were the part of these studies, and those who were admitted in the PACU except for neurosurgeries. So neurosurgeries were the exclusion criteria for our review. And according to the PRISMA chart, because it was a 22 years long search from 2000 to 2022, so the records what we retrieved in the first attempt were 2,318. The records after moving duplicate reviews included 1,294, and these many records only were screened by the researcher along with the colleague, with the help of colleagues. And 594 records were excluded based on the exclusion criteria and inclusion criteria. Full text articles were assessed, that is 594, and articles excluded with some reason like neurosurgeries or the surgeries who were happening on the pediatric patients, they were excluded, and studies included in the synthesis were 14 studies. So the data was extracted from these papers, and the pertinent information from the articles was gathered and then condensed. So the condensed information stated that the many tools like they take blood pressure, pulse rate, respiratory rate, either solely or combinedly as one feature like vital signs, and those vital signs will include all temperature, pulse, respiration, and blood pressure. And some were like they might have included excluded the temperature, and they just kept the individual parameters or combinedly into consideration along with others such as, which I mentioned, oxygen saturation, pain, nausea, and vomiting, etc. And there are still others who propose to consider like that oral intake should be included or urine output should be included, bleeding, activity, temperature, and laboratory parameters, which are the critical ones in deciding the discharge readiness for a person. But the literature says that the parameters which are mentioned on the second column, these oral intake, urine output, these are not essential to be measured in the immediate post-operative period, that is post-anesthesia care. In that period, it is not required. So we can just focus on the vital signs and the pain, nausea, vomiting, and the oxygen saturation especially. These parameters like oral intake, urine output, these parameters can be taken care of when the patient shifts to the post-operative ward rather than the PACU itself. So the variables assessed for the PACU discharge readiness, the parameters with a common agreement were found to be pain, nausea, vomiting, level of consciousness, and vital signs. And parameters with doubtful opinion were urine output, oral intake, and psychomotor testing. Like retaining the patient in the PACU just because that the urine output and oral intake are not into normal limits, there is no point in retaining the patient in that. So because the maximum limit on the very same day itself, the patient needs to be shifted to the ward and or shifted from or transferred from the PACU. So that is why these parameters did not find any common agreement to be used. So the recommendations are, because since even till now there is no consensus available on the parameters to be included in the criteria, discharge criteria. So meta-analysis of the existing literature can be done, and the comparison of the existing scales can be done, like psychometric testing and Delphi technique can be used, that which parameter to be included or not included in the immediate post-operative period. Thank you, ma'am. Ma'am, I'm done with the presentations.
Okay, ma'am. Ma'am, what problems did you face while doing the study?
Ma'am, it was systematic review only. So as such, there was no problem because I'm working at a university. There we have a central library and access to the indexed journals. Like we have our own database, JGate, ProQuest, and Google Scholar is obviously universally accessible. So as such, there was no problem. Time, I must say that it was a constraint for me.
Yeah, that's why, because it is a systematic review. So how much time did you took to do it?
Ma'am, it took me around 8 months to do.
Okay. Did you get enough time to do this much of, how many total you have taken in the systematic review?
Ma'am, 14.
14.
Yes.
Okay. Only one suggestion, you could have included more, because this is one of the most important topic that we need to discuss on.
Exactly. I realized it, ma'am. So that's why I put in my recommendations that meta-analysis or a larger scale studies can be.
Yeah, because it is very less number when you're saying a systematic review.
Yes, yes. I admit it, ma'am.
Yeah, yeah. Okay, that's all from my side.
Thank you. Thank you so much. I take your suggestions. I'll try to implement this.
Thank you, ma'am. Thank you, Seema ma'am. Thank you, Bharati ma'am. Next, I would call upon Dr. Geeta C for her oral presentation from Kasturba Gandhi Nursing College, Sri Balaji Vidyapreet, Puducherry, India, on the topic Assessment Artificial Intelligence in Cancer Diagnosis and Prognosis Opportunity and Challenges. She will be the 11th person in your evaluation form, ma'am. Dr. Geeta, you can just unmute yourself.
Yes, ma'am. Yes.
You can share your screen and start presenting. Thank you.
Is it visible, ma'am? Hello? Is it visible for you?
Your video is visible, ma'am. You have not yet shared your screen.
1 minute, ma'am.
Yes.
Is it okay, ma'am?
Yes, ma'am.
Visible now?
Yes, it is visible, ma'am.
Okay.
You can start presenting.
Very good afternoon to all. And I welcome all of you for this 4th International Conference. And I am Dr. Geeta Singh, Professor in the Department of Child Health Nursing and Associate Dean Research, Sri Balaji Vidyapeeth, Puducherry. So now I am going to talk about artificial intelligence and cancer diagnosis and prognosis opportunities and challenges. The objective of this presentations are introduction on cancer, diagnosis of cancer, artificial intelligence and its benefits, and application of artificial intelligence in detecting cancer for good prognosis, and AI opportunities and challenges. So introduction of this, the cancer, actually we all know this is a second leading cause of death in worldwide. In all types of cancers are there, and it remains a critical public health problem and a substantial burden in our society. New cancer cases are expected to increase by about 2/3 over the next 20 years. It's predicted by 2040, there will be 2,750 new cases of cancer worldwide each year. As a class of clinical diseases with a complex diagnosis, treatment, and prognosis, researchers have not found a practical and a feasible strategy so far. Meeting these challenges will be one of the major tasks for our healthcare providers. So the main thing is, with this AI, easily we can find out the cancer. So if it is easy identification of cancer, we can detect and we can treat the persons. And a small overview about the cancer. So the human issues, usually the normal cells are like this, and the cancerous, that is immature. We all know that is abnormal cells or immature cells in our body in anywhere. So when cancer develops, this orderly process breaks down. As cells become increasingly abnormal or destroyed cells survive when they should die, and new cells from when they are not needed. These extra cells can divide without stopping and may form the growths called the tumor. That is the excessive abnormal cells growth only is a cancer. So this is about the cancer. It's a general name for group of more than 100 diseases. Although cancer includes different types of diseases, they all start because of the abnormal cell growth in our body. Without treatment, if the cancer need the treatment. If without treatment, cancer can cause the serious health problems and even loss of life. Every year, cancer claims the lives of every 8 million people. Early detection of cancer may reduce mortality and morbidity. And to fight this epidemic, World Health Organization is encouraging government to focus on early non-invasive detections, which has been shown dramatically increase the treatment success. That is one is the artificial intelligence. So early detection of cancer, the patient's survival and quality of life depend on the large degree on stage of diagnosis and making early detection in critical way. In 50% of the cancers at an advanced stage, usually we can identify the cancer symptoms at the end of the stage. That is a severe stage only we can identify. So late detection is the cause of 70% of the cancer death in India. Early detection of cancer or precancerous change allows early intervention to try to slow or prevent the cancer development earlier. So this is about the current status of the cancer. Most cancers have limited or no early screening technology available, reducing the opportunity to detect them early and leading to worse survival rates. A lot of challenges in providing the screening in an accurate and timely way, such as the limited availability of specialist staff in implementing the screening, the cancer and human error, etc. And these are the current types of medical images to diagnose the cancer. So previous day and all will take time to checking and identification of the cancer cell. But nowadays, we are going to implement this artificial intelligence in cancer diagnosis also. So this is a plain X-rays include the chest X-ray and the position of emission tomography, that is a PET scan imaging. And these are can be used in the radiology, ultrasound, and nuclear medicine, which includes such tests as the bone scan, thyroid and thallium cardiac test, and CT scan, and CT angiography, and fluoroscopy, including the upper GI and barium enema, and MRI, and mammography. So technologies in cancer diagnosis and prognosis, how we can use this artificial intelligence, like technologies we can use in the cancer diagnosis and prognosis. So unfortunately, the current diagnostic testing and screening tools lack the necessary accuracy rates, meaning many patients remain the undiagnosed because of the errors. As the incidence rate of cancer and its mortality have risen sharply and prolonging the survival and reducing local recurrences have become increasingly dependent on modern laparoscopy surgery and robotic surgery and tumor adjuvant therapy. Effectiveness of cancer treatment has improved significantly. However, despite the profusion of new technologies came down and scientifically satisfactory curative results for each sick individual are elusive due to uncertainties in diagnostic precision. This technological advancement in statistics and computer software have enabled computer engineers and health scientists to collaborate closely toward prognosis improvements using the multi-factor analysis, conventional logistic regression. So how does artificial intelligence in a cancer diagnosis? To enable the early diagnosis and screening for the wide array of cancer types, the usage of circulating the microRNAs instead of more commonly used the circulating tumor DNA and circulating cancer cells. It also uses the innovative deep learning artificial intelligence algorithms to provide the real-time analysis of polymerase chain reaction and microarray and next generation sequencing data, all essential factors in detecting the earliest stages of cancer progression. So what is artificial intelligence? So everywhere nowadays we are talking about artificial intelligence. So this year in engineering also they have started the artificial intelligence, and it's a field of computer science that is associated with the concept of machines thinking like humans to perform tasks such as the learning, problem solving, planning, reasoning, and identifying the patterns. So wherever we are using the human thinking, so nowadays we are going to use the computers, that is artificial intelligence, the cognitive computing and computer vision and machine learning. So these are the steps one by one, and neural networks and deep learning and natural languages proceeding. So these are the some basic terminologies in artificial intelligence. The machine learning is a computational learning using algorithms to learn from, make predictions on data. So, and a neural network is a system that consists of many simple processing elements operating in a parallel, which can achieve, store, and use the experimental knowledge. And a deep learning, it's a type of machine learning based on the artificial neural network in which multiple layers of processing are used to extract progressively higher level features from the data. And computer vision as an enabled system to derive the meaningful information from digital images, videos, and other visual inputs, and take actions and make the recommendations based on that information. And natural language processing is an application of computerized techniques to the analysis and synthesis of natural language and speech. So at last, the cognitive computing as the use of computerized models to stimulate the human thought process in complex situations where the answers may be ambiguous and uncertain. So there is no error in this AI. And these are the milestones of artificial intelligence.
Sorry to interrupt, ma'am. 10
hello,
minutes
yes.
10 minutes is over. Please move on to the conclusion, ma'am.
Okay. So these are the milestones in the artificial intelligence. And in 1915, it is artificial intelligence and machine learning. And after that, in the year of 2010, it is deep learning. And these are the history of artificial intelligence. 1955, and this is introduced, and 1960 slowly developed, and the first problem solving is made by the artificial intelligence, and 1980 to 90, and the system introduced in the healthcare, and 2010 to 2019, and the genomics sequencing databases introduced, and 2019 onwards, discovery and development of the drugs and a personalized healthcare and a preclinical research also started in AI. And these are the application detection of cancer. So when testing the cancer imaging tests such as the CT scans, MRIs, or the rays are taken to produce the detailed images area where a tumor may be formed. So easily we can identify the tumor in the artificial intelligence. And this traditionally radiologists individually inspect each image to look for the tumors, but nowadays it is easy to identify everything through this artificial intelligence. Now we can use this artificial intelligence technology to analyze these images and detect the cancer, which aid radiologists and clinicians in establishing quicker and more accurate diagnosis. And this is a process diagram of cancer detection. So this AI will take the images from this natural one. After that, the future extraction from that will create the data and this all basic criteria following. And after that, we'll get the answers. And these are the benefits of healthcare and cancer detection and screening and the early diagnosis and blood test and all tumor detections and diagnosis in all type of cancers. And early detection can be used in screening and non-invasive technique also. We are using the artificial intelligence and unique selling points. And so the advantages of the cancer detection, and it can be help in hospitals to train the junior physicians, and also the self-adaptation, simultaneously treatment of quantitative and qualitative knowledge, and validated the results from the number of clinical studies and clinical trials. And what are the challenges? This technology faces some important challenges, that is the cancer diagnosis and the prognosis. And for example, medical imaging data cannot be used as a input data directly. And the development and the population of technology, in addition, the weight coefficient in the neural network models are tested, calculated, and the confidence interval as a reasonable. So medical interpretation need the further research. And another issue, the future of AI in a medicine involves the privacy and the data security assurance. And these are some pros and cons of the artificial intelligence. The advantages, the integration of information, treatment time, and 24 hours available, and reduce the unnecessary hospital visits, and create the time-saving administration duties. And the cons are the lack of curated healthcare data, and this is a high initial capital investment, the lack of interpretability, and a lack of precision, and increased patient face time, and increased time on critical cases. And in future, these are the 10 artificial intelligence applications that could change the healthcare. So there's artificial intelligence is very much needed in the nursing profession also. In future, we will get this artificial intelligence application in nursing service also. And this can be very much useful in the cancer detection and diagnosis as well as the treatment. So that's all my presentation. Thank you for giving me the opportunity.
Thank you, ma'am.
Ma'am, we can move to the next.
Yes, ma'am. I'd like to call upon our next presenter, Ilayaraja, for his oral presentation from SEA College of Nursing, Bangalore, India, on a topic, a study to assess the effectiveness of self-destructive module on knowledge with regard to assessment of delirium in ICU patients among staff nurses in selected hospitals, Bangalore. Mr. Ilayaraja, please unmute yourself and you can start sharing your screen. No, not in.
Hello, am I audible?
Yes, you are
Hello.
audible, sir. Please share your screen.
Yes. Not sure. Hello, am I audible?
Yes, sir.
So good evening to everyone. Myself, Ilayaraja, lecturer and Department of Medical and Surgical Nursing, Southeast Asian College of Nursing, Bangalore. So introduction, delirium is the fluctuating and rapid onset of cognitive impairment and disturbance of consciousness. More than 60% of patients with ICU delirium are missed by staff nurses. Nurses give direct care to patient and spend much time with patient during hospitalization. Nurses should be vigilant to identify the delirium in ICU patient and to assess it with along with the medical team. Therefore, the investigator felt the need. Problem statement. A study to assess the effectiveness of self-directive module on knowledge with regard to assessment of delirium in ICU patient among staff nurses in selected hospitals, Bangalore. Objectives of the study. The pre and post-test knowledge level regarding assessment of delirium in ICU patient among staff nurses. Second one, the effectiveness of self-directed module on assessment of delirium in ICU patient among staff nurses. Third one, a relationship between staff nurses and demographic variable post-testing knowledge of the staff nurses regarding assessment of delirium in ICU patients. Hypothesis. First one, there will be significant difference between pre and post-test knowledge score with regard to assessment of delirium in ICU patient among staff nurses. Second one, there will be significant association between post-test knowledge score in relation to assessment of delirium in ICU patient among staff nurses with selected demographic variable data. Next, for this study, I used conceptual framework J.W. Kenney Open System Model. Material and methods. In the present study, 60 staff nurses from selected hospital, that is Sri Satya Sai Institute of Higher Medical Science, Bangalore. Using purposive sampling technique and data was collected using a self-direct module. A group pre and post-test pre-experimental design was used, and J.W. Kenney open system model used for the theoretical framework of the study, and descriptive and inferential statistical data used for the analysis. Result, the mean post-test knowledge score of participant, which is 72.7%, was higher than the mean pre-test score of 32.3%, and which is found to be overall obtained value 17.86, which is a greater than the table value at 0.05 level of significance. Conclusion. The study shows that the self-direct module was effective in increasing the knowledge level of staff nurses regarding assessment of delirium in ICU patient. My sincere gratitude and thanks to my guide, Dr. M. Sangita Devi, Principal, Southeast Asian College of Nursing, Bangalore. Thank you. Thank you all.
Thank you, sir.
Thank you.
Seema ma'am, your questions.
Yes, ma'am. Sir, I have got one question. How did you calculated your sample? Because you have taken 60 sample only.
Yes,
so
ma'am.
how did you calculated your sample?
Descriptive.
So descriptive is then it is very less number. How did you calculate it? That's why I'm asking. Because
Hello.
descriptive study is, if you're telling 60 sample, then your sample for your descriptive study is very less.
Pre-experiment.
Pardon?
Because of experimental study.
So still, it's very less. How did you calculated it? There are certain calculation to calculate the sample sizes. Did you did that?
Yes, ma'am.
So which this thing you have, which prevalence have you taken, or what thing you have calculated with?
Carl-Pearson formula I used for this, ma'am.
So for the calculation of the sample size?
Sample size is 60, ma'am.
Sir, I'm asking which calculation.
Sorry, ma'am. I'm not understanding your question, ma'am.
How did you calculated your sample size?
Ma'am, I use the formula standard deviation and pre-test knowledge score.
So that you have done for your calculation of your overall analysis. I'm not asking for that.
Yes,
I'm asking how did you selected 60 sample? What formula you have taken? Have you taken the prevalence size?
Yes, ma'am. Actually, initially I got like 80 nurses. Hello.
Yes, go on. Tell me.
Yeah, ma'am. Finally, while conducting a pilot study with the staff nurses, I faced some of the problems. So only I used 60 samples, ma'am.
I think so. You should go back to your study and just see it where it is there. Okay.
Yeah, ma'am.
That's all from my side.
Okay.
Thank you, ma'am. Thank you, sir. We'll move on to the next presenter. Oral presentation by Anu K. Wells from SCA College of Nursing, Bangalore, India, on the topic, a study to assess the effectiveness of structured teaching program on knowledge regarding postoperative complications of anterior cervical discectomy among third-year BSc nursing students in selected nursing colleges, Bangalore.
Hello, ma'am. My voice is audible.
Yes, your voice is audible. Your screen is also visible. Please proceed.
Okay, thank you, ma'am. A very good evening to everyone. Myself, Anu K. Wells, Assistant Professor, SCA College of Nursing, deemed it a great honor and privilege to be the part of 4th International Conference. And today my paper presentation is on the topic, the effectiveness of structured teaching program on knowledge regarding postoperative complication of anterior cervical discectomy among third-year BSc nursing students. As we all know that anterior cervical discectomy is the most common surgical procedure to treat the damaged cervical disc. So as a nurse, we should be vigilant to identify postoperative complications, to identify and to give proper care to the patients.
Kappa will not be coming.
So hence, I felt a need to assess the effectiveness of structured teaching program on knowledge regarding postoperative complications of anterior cervical discectomy among third-year BSc nursing students. Moreover, that I felt that it will be helpful to impart a knowledge regarding postoperative complication of anterior cervical discectomy among the student nurse. So in future, they can aid proper nursing care by preventing and identifying the complications of anterior cervical discectomy and faster the recovery of the ACD patients. So the problem statement is a study to assess the effectiveness of structured teaching program on knowledge regarding postoperative complications of anterior cervical discectomy among third-year BSc nursing students in selected nursing colleges, Bangalore. Coming to the objectives, there are 3 objectives. First objective measures, it assesses the pre-test knowledge scores. Second one, it assesses the effectiveness of structured teaching program. And third one, it finds out the association between post-test knowledge scores with the selected demographic variable. Coming to the hypothesis, there are 2 hypotheses. First one is there will be a significant difference between pre-test and post-test knowledge score. And second hypothesis states that there will be a significant association between post-test knowledge scores with the selected demographic variables. And the reviews were added to these studies. I have classified into 3 sections. First section, it is related to cervical spine problems and its management. Second section, it is related to the postoperative complications of anterior cervical discectomy. And third sections, reviews related to the effectiveness of structured teaching program on anterior cervical discectomy. And the research variable included in this study are, the dependent variable is the knowledge regarding postoperative complication of ACD. Independent variable is structured teaching program, and the demographic variables include age, gender, religion, category of the students based on the result, knowledge about ACD, ACD patient care, and complication of ACD, and sources of information. Then the modified conceptual framework adopted for the present study is based on Weidenbach's The Helping Art of Clinical Nursing. This is the diagrammatic representation of the theory, what I have used for my research study. Next is coming to the research methodology. The research design used is the pre-experimental one group pre-test post-test design. And the setting is Adventist College of Nursing and Koshish College of Nursing, Bangalore. Population, target population is third year BSc Nursing student in Bangalore. Accessible population is third year BSc Nursing students in Adventist College of Nursing and Koshish College of Nursing, Bangalore. And sample size is 60 third year BSc Nursing student. And sampling technique is purposive sampling technique. And data collection tool is structured questionnaire. Coming to the main study details, I have conducted pilot study in ACA College of Nursing. After that, I have conducted the main study among 60 third year BSc Nursing students in both Adventist and Koshish College of Nursing after obtaining the permission from concerned authority. On the first day, pre-test was conducted by using structured knowledge questionnaire regarding postoperative complication of anterior cervical discectomy. On the same day, after the pre-test, the structured teaching program was administered. The post-test was conducted after 7 days using the same structured knowledge questionnaire. After that, with the collected data, the data was analyzed by using inferential and descriptive statistics such as t-test and chi-square test. Coming to the result, the first result related to the demographic characters of the sample, that is, majority of the respondents are in the age group of 19 to 21 years, females, and they have cleared both first year and second year BSc Nursing courses, and the sample don't have adequate knowledge about ACD, knowledge about ACD patient care, about complication of ACD, and they don't have experience in ACD patient care also. Coming to the pre-test and post-test knowledge score comparison, in pre-test we can see that there was 11.66% had adequate knowledge. But coming to the post-test, it is increased. It is 98.33%. So here you can see overall pre-test knowledge score is 37.06%. Post-test is 74.34%. So there is a vast or significant increase in the post-test knowledge score, that is about 32.28%, which is really reliable. Coming to the t-test value, what I have obtained is 22.83, which is greater than the table value at the degree of freedom 59, and it was found significant at the level of 5%. Hence, the first hypothesis, we state that there will be significant difference in pre-test and post-test knowledge score is accepted, which shows there is effectiveness of structured teaching program. Next is findings related to the association between post-test knowledge score with the selected demographic variables. The post-test knowledge level on postoperative complication of anterior cervical discectomy is significant at 5% level to certain demographic variables like results, students' result, clinical experience, their knowledge. So second hypothesis is accepted for the few demographic variables. Coming to the conclusion of my study, the study showed that the structured teaching program was effective to increase the knowledge of the student nurses regarding postoperative complication of anterior cervical discectomy. Every nurse should update it in providing care to the patients with an emphasis on early detection and prevention of complications. Training programs have a major role in accomplishing above mentioned aims. This is the end of my presentation. Thank you to everyone. Special mention to conference organizing committee, respected evaluator Dr. Seema Singh, my respected guide Dr. Hemant Sangeeta Devi, and all other participants. Thank you all.
Thank you, ma'am. Seema ma'am, your questions.
Ma'am, we can move for the next.
Okay, thank you, ma'am.
I'd like to call upon Ms. Ramya AR for his oral presentation. Ma'am, are you there? Your screen you have shared, ma'am, but please unmute yourself and start speaking.
Yes, ma'am. Can you audible, ma'am?
Yes, you are audible. Please put your PPT in slideshow. It is in the PPT format.
Hello.
Yes, ma'am, you are audible and your screen is visible.
Hello. Yes, madam. 2 minutes. Is it okay, madam? Hello. Hello.
It has not been changed yet, ma'am.
It's changed, madam, already.
Please fix your screen as full screen, ma'am.
I maximized actually.
No need to maximize, just go with the slideshow.
Yes, madam, I did.
F5, ma'am. It is still in the PPT mode. Or you can proceed with your presentation, ma'am. No problem. Proceed with your presentation.
Okay, fine. Good evening, one and all present here. Myself, Ramya Yea, Associate Professor, Medical Surgical Nursing, SCA College of Nursing, Bangalore. Like as if we know, like alcohol, it will induce liver damage. So especially who are drinking alcohol, daily drinking volume for the consumption greater than 200 ml per day, the duration of drinking for more than 14 years are most significantly having the problem with the liver damage. Liver damage. So next we'll move on to the problem statement. A study to evaluate the effectiveness of video-assisted teaching or knowledge regarding alcoholic cirrhosis among alcohol users in selected de-addiction center, Bangalore. My objectives are to assess the pretest knowledge regarding the alcoholic cirrhosis among alcohol users, to evaluate the effectiveness of video-assisted teaching or knowledge regarding alcoholic cirrhosis among alcohol users, to determine the association between post-test knowledge regarding the alcohol cirrhosis among alcohol users with the selected demographic variables. Hypotheses are H1, there will be significant difference between pre-test and post-test score on knowledge regarding the alcoholic cirrhosis among alcohol users. H2, there will be a significant association between post-test knowledge regarding the alcoholic cirrhosis among the alcohol users with the selected demographic variables. Review of literature. The review of literature divided into 3 sections. In the first section, the literature related to knowledge regarding alcoholic cirrhosis, and literature related to incidents on alcoholic cirrhosis, and literature related to effectiveness of video-assisted teaching program. Then next, research variable. Mainly the dependent variable is, it refers to the knowledge regarding the alcoholic cirrhosis. Independent variable, it refers to video-assisted teaching program. Demographic variable, like education, age, income, year of consuming alcohol, source of information about the alcoholic cirrhosis. Then methodology. In the present study, a pre-experimental evaluative approach was selected. One group pre-test and post-test design was adapted. Sample size was 30 alcohol users who are admitted in the de-addiction center, was selected by using the purposive sampling technique. Data was collected.
Excuse me, ma'am.
Yes, ma'am.
Ma'am, your slides are not changing. It is still in the good afternoon slide.
Okay.
Please make sure.
Just a minute. Shall I connect with another one? Badura, 1 minute. I'm doing.
Excuse me, ma'am. Excuse me, ma'am.
Yes, madam.
Can we continue or we can move to the next?
Ma'am, let her continue, let her complete it within the time limit and then we can go.
Yes, ma'am. You then go for the presentation, ma'am.
Okay,
Leave with the slides and you can continue with the presentation. As Seema ma'am said.
Okay, ma'am. The sample size was selected 30 alcohol users who are admitted in de-addiction center was selected by using the purposive sampling technique. Data was selected through structured knowledge questionnaire. The questionnaire consists of two sections, section A and section B. The section A seeking information on the demographic variables like age, sex, marital status, education status, religion, income, and year of consuming alcohol, and previous information and source of information regarding the alcoholic cirrhosis. And section B regarding 25 items on the knowledge regarding alcoholic cirrhosis. Then the prepared tool was validated by the expert from the different field. The reliability of the tool was 0.9481. This indicated that tool was reliable. Pilot studies shows that study was feasible. Then study result is the findings related to the association between demographic variables and knowledge score on alcoholic cirrhosis among the alcohol users. The pretest score is 44.8% and post-test score is 76.7%, and the enhancement after administering the video assisted teaching program is 31.9%. The conclusion of the study is the video assisted teaching is very effective to increasing the knowledge about the alcoholic cirrhosis among the alcohol users and those who are admitted in the de-addiction center. Thank you, one and all. Hello.
Sushmita ma'am, we can move for the next candidate.
Yes, ma'am, we'll move. Thank you, ma'am.
Thank you.
We'll move to the next presenter. Oral presentation by Janarana Rahman, Rufaida College of Nursing, Jamia Hamdard University, New Delhi, India, on the topic Mobile phone usage among adolescents and among adults, a review on pattern self-esteem, academic performance, and effectiveness of various interventions.
Yes, ma'am. Good afternoon, ma'am. Actually,
just a minute,
ma'am. Madam has to stop sharing.
Yes, I'll. Yes, you can proceed, ma'am.
Yes, thank you, ma'am. Ma'am, is the slide visible? Ma'am, is the slide visible?
Yes, it is visible. You can go forward.
Yes, ma'am, it is visible. Your voice is also audible.
Yes, thank you so much, ma'am. Ma'am, I'm Jahara Rahman, Assistant Professor working in Rufaida College of Nursing, Jamia Hamdard, New Delhi. I'm going to present a narrative review on mobile phone usage, on pattern, self-esteem, academic performance, and effectiveness of various intervention among adolescents and young adults. Mobile phone provided great convenience in communication among people by way of either calling or texting, and adolescents are more inclined towards using mobile phones. So, however, although the mobile phone provided many advantages, but it has also caused some problem also. And some adolescents are using the mobile phone so excessively that it assumes the form of addiction. So a narrative review was prepared by reviewing 16 research articles, and the literature search was carried out for material published in last 5 years. The consultation was carried out through PubMed, Scopus, and Google Scholar. The narrative review is categorized under the main theme and the sub-themes as objectives. So these are the four sub-themes or objectives of this narrative review. First one, to assess the problems emerged in adolescent and young adults with the pattern of using their mobile phone. Second, to identify the effect of using mobile phone on self-esteem of adolescent and young adult. Third is to assess the effect of mobile phone on academic performance of adolescent. And fourth one is to evaluate the importance of various intervention to reduce the problem generated due to overusage of mobile phone. So the first four papers included in this narrative review was studied to assess the problems emerged in adolescent and young adults with the pattern of using their mobile phone. And the following information were extracted, like the study was the research articles included from these four reviews were from India, that is from Bhopal, Karnataka, Mumbai, and Gujarat were included. And the research design incorporated in these four papers were cross-sectional study. Study sample ranges from 113 to 496, and mainly here mobile phone usage questionnaire was administered to collect the data. And the findings revealed that on an average, the age group of the adolescent ranges from 13 to 17.8 years in these four papers, and average daytime used by the adolescent were 2 to 4 hours, and the prevalence of mobile phone dependency ranges from 31.33% to 67.2%. And the most common mobile phone dependency area was found in one of the studies done by Bhardwaj D et al. Was for calling friends, that is 96%. The second four papers were reviewed to identify the effect of using mobile phone on self-esteem of adolescents and young adults. These studies were conducted in Wuhan, China, Iran, Egypt, and Shanghai, China. Research design adopted was survey and cross-sectional design. Sampling technique used was convenient sampling and stratified sampling, and sample size varies from 140 to 653 students, and different self-esteem scale were used, and mobile phone addiction scale were also used to collect the data. Finding of these four papers indicated that there were significant negative association between self-esteem and problematic mobile phone use. And one of the research papers showed that there was statistically negative correlation between self-esteem and mobile phone addiction. Third paper, which was done by Nohadi et al., it highlighted that moderate self-esteem was found to be 34.58 plus minus 11.81. The next set of four papers was reviewed to assess the effect of usage of mobile phone on academic performance of adolescent and young adults. In these four papers, the setting of the study were Spain, Malaysia, India, and China. The setting of the study, mainly the research design used were cross-sectional study and correlational study and survey. Sample size varies from 285 to 1,150 adolescents from schools, and mainly self-report academic performance scale, academic performance tools, and GPA were used to collect the data. The finding of this paper revealed that the first paper revealed mainly that the bedtime mobile phone was significantly and negatively correlated with sleep time quality. And second paper, the main finding were all mean subject score decreased with prolonged mobile phone use. One of the paper highlighted that high use of mobile phone was related to worse result in physical fitness test and academic performance. Fourth set of papers were reviewed to evaluate the importance of various interventions to reduce the problem generated due to overusage of mobile phone by adolescent and young adults. Here, mainly the setting were Korea, Rawalpindi, United Kingdom, and South Korea. And the research design adopted in this intervention evaluation were mainly cross-sectional study, 12-weekly single blind RCT and online RCT. And the tools used were a smartphone addiction scale, smartphone addiction self-reported scale, self-control scale, and stress coping scale, etc. And findings of these four papers control as intervention, three studies, that is IACBT was astrological well-being, and also mind subtraction meditation on smartphone addiction was also effective in reducing smartphone addiction among the adolescent. So based on the finding, the review to assess the pattern of using mobile phone among adolescents. So here only the cross-sectional, mainly the study was done cross-sectionally, and other things like socioeconomic status, family income, and pocket money of the student were not assessed, and better method can be developed for objectively collecting data, and personality be associated with usage of like mobile phones. So it can. So second paper, the result that discussion was made that other mediating factors can also be explored. Like the range was also not explained in this study. The third objective, the discussion from out of the on academic performance of adolescent, like only two cognitive function domain were assessed, like attention and verbal memory was only assessed in the present papers. So other goals in future studies. And the fourth set of review were done to assess the intervention to reduce the mobile phone dependency. And here the researchers were unable to fully control the interaction, like the mind subtraction meditation. There were two groups. Control the interaction between the intervention and control group, and the sampling technique was also one of the paper to convenience sampling technique. So the general and should be explored in future. So based on the recommendation were made, new mobile phone usage pattern among adolescent and young adults can be explored, and also health problems like eye vision problems. So an integrated prevention model like educational program regarding awareness concerning behavior addiction and the adverse effect of problematic mobile phone also can be explored. So these are the 16 list of 16 references which was used to write this narrative review. Thank you so much.
Thank you, ma'am. Seema ma'am, your questions, please.
Madam, I want to ask one question. During this, your data collection or yes, your review, what were your review pattern system?
Ma'am, review pattern system was I have to collect 16 papers for that will be published in last 5 years, and preferably Scopus and PubMed. But I have incorporated one study from Google Scholar also, ma'am.
Okay, that's
yes.
all.
Yes, ma'am. Thank you so much, ma'am. Thank you, ma'am.
Let's move on to the next presentation. Oral presentation by Riddhima Josrita, Lovely Professional University, Punjab, India, on the topic retrospective study of abnormal cytology smears in patients with routine LBC as a screening procedure.
Good evening, everyone.
Yes, ma'am, you're audible. Yes, you are audible, ma'am, and your screen is also visible. You can start with your presentation.
Okay, good evening, everyone, and welcome to my presentation. It's an honor to have the opportunity to present in 4th Conference on Nursing Science and Healthcare. I am Ridhima and I am doing my PhD from Lovely Professional University, and my supervisor name is Dr. Reena Singh. The title of my study is Retrospective Study of Abnormal Cytology Smear in Patients with Routine LVC as a Screening Procedure. Reason for taking this topic is to complete the research gap of cervical cancer in Jammu region. Cervical cancer is 4th most common cancer in India. In India, cervical cancer contributes to approximately 6 to 29% of all cancer in women. Various studies have been conducted on cervical cancer in India, but limited studies have covered women of Jammu. So there is dire need to do the epidemiological study in Jammu region also. So to find out the incidence, epidemiology, and risk factor related to cervical cancer, I have done this study in 4 years. First of all, what is cervical cancer and what is cervix? Cervix is a narrow part of the lower uterus, often referred to as the neck of the womb. And cervical cancer is a type of cancer that starts in the cervix. Cervical cancer can affect the deeper tissue of cervix and may spread to other parts of the body, often the lungs, liver, vagina, and rectum. Human papilloma virus is a sexually transmitted virus and considered as one of the primary and major risk factors for causing cancer of anogenital regions in both men and women. There are various risk factors of cervical cancer. First one is early marriage, early pregnancy, vaginal bleeding, low socioeconomic status, smoking, multiparity, uses of contraceptive pills and at an early age, history of STD and HPV. As I earlier discussed, that HPV, that is human papilloma virus, is the main risk factor of cervical cancer. This study was conducted from 2018 to 2021 in the Swastik Diagnostic Laboratory, Jammu, and Department of Gynaecology, Government Medical Jammu. The study was carried out after obtaining the permission from the Institutional Ethical Committee of the Department of Gynaecology, Jammu. Sample collection, PAP and LBC are two types of screening methods to screen cervical cancer. So I have taken both the methods in my study. PAP and LBC smear has been sent to us from patients attending the gynecologist, and then PAP LBC smear examination has been done. If there is any abnormal finding on PAP or LBC, these findings were selected and detailed history was taken. The inclusion criteria of my study is only married women between the age of 25 to 65 years were selected, and exclusion criteria is pregnant women were also excluded. This is the procedure of liquid-based cytology. In this form, samples we take from the gynecologist, then slides are maintained. We centrifuge these slides stand, and after centrifugation, slide comes out to be like this. After that, LBC staining is proceeded, and slide after staining is examined by the pathologist. I have studied 2,500 patients in my study, and the type of sample and the type of known probability sampling is taken. The risk factors which are coming out in my study is first, in 20 out of 2,500 women that undergo screening, it was found out that 47 were early married, 34% were having a history of STD, 41 women had an early pregnancy, and 41% of women were having the problem of vaginal bleeding. 20% of the women are having the factor of smoking, and 52% of women have low socioeconomic factors. 22% of women were using oral contraceptive pills at an early stage. 39% of the women were having more than 2 children. These are the pie chart of my study. Next slide. This slide shows incidence of normal, active, inflammatory, LCIL, HCIL, and SCC. Whereas NILM indicates the normal patient. Active is lesion with border nuclear changes that are not diagnostic of definitive LCIL. Next one is LCIL, that is low-grade squamous intraapical lesion. Squamous intraapical lesions where abnormal cells have entered 1/3 of the lining of the cervix. Third one is HCIL, that is high-grade squamous intraapical lesion. Squamous intraapical lesions were abnormal cells which are found 2/3 of the lining of the cervix. Last one is squamous cell carcinoma, that is cervical cancer. Squamous intraapical lesion where abnormal cells are found invading under the tissue. So in my study, out of the total subjects screened for LBC, maximum of 81.3 were found to be normal. 13.9 of the LBC appeared inflammatory, 3.1 LBC cases were active, and 1% cases were LCIL. 0.6% cases were HCIL, and 0.1% cases were SCC. This is a histogram of LBC findings. Statistical analysis. Chi-square tests were used to calculate p-value at a 0.05 level of significance for measuring the significant association of different epidemiological factors with LBC positivity. First of all, LBC positivity with early marriage. So this shows a significant correlation of LBC positivity with early marriage. Next one is early pregnancy. Early pregnancy also shows significant correlation with LBC positivity. Third one is multiparity. Multiparity also shows positive correlation with
Excuse
LBC
me, ma'am.
positivity.
Sorry to interrupt.
Yes, ma'am.
The 10 minutes is over. Please move on to the conclusion, ma'am.
Oh, okay, ma'am. So in my study, early detection is pivotal in cancer therapeutics as it improves the prognosis and overall survival. We found that the pap smear and LBC are simple, cost-effective yet efficient tools in the preliminary screening of cervical cancer. Last one, research outcomes. From my study, what will be the research outcomes? The research conducted will be beneficial as the masses and doctors will get aware of the advantage of combined cervical cytology and HPV testing. This will reduce the incidence of cervical cancer in the Jammu region by spreading awareness about cervical cancer. There is a dire need to inform women about cervical cancer screening and its advantage. This study will help the government to create cervical cancer prevention policies and strategies at all levels and to implement new screening programs like other developed countries. Cervical cancer is a diagnosis resources of fundamental importance. It allows early detection of lesions before they progress to malignant form. Thank you.
Thank you, ma'am. Seema, ma'am, your questions, please.
Ma'am, we can move to next session.
Yes, ma'am. Next session will be oral presentation by Sureka Appireddigari, from SEA College of Nursing, Bangalore, India, on the topic, assess the level of family support and quality of life in patients with epilepsy at selected hospitals in Chennai.
Hello. Hello, good evening, ma'am. My voice is audible. Hello. Hello.
Yes, ma'am, your voice is audible. Please increase your volume, ma'am.
Okay.
Please share your screen also.
Madhura, come mine, sir. Hello, 1 minute, ma'am. 1 minute, ma'am. Which one, ma'am? PPT. Sorry for interruption.
No, ma'am.
Is it visible, ma'am? Hello. Hello, is it visible, ma'am? Hello. My voice is audible and screen
Yes,
is
ma'am, it is audible.
My screen is visible?
No, ma'am, it is not visible.
So, now, ma'am?
Yes, ma'am, it is visible.
To all, myself Sureka Apparetigari, Associate Professor in the Department of Medical Surgical Nursing, SEA College of Nursing, Bangalore. Introduction. Epilepsy is one of the most common serious disorders of the brain that affects the people in every country of the world. Epilepsy affects 65 million people worldwide. It strikes most often among the very young and the very old. Although anyone can develop epilepsy at any age, it not only affects the individual but also has an effect on their family. Family support and quality of life plays a very vital role in patients with epilepsy. If you see the need for the study, epilepsy is one of the most common neurological disorders. Epilepsy affects all dimensions of life. Intisar, Kudur, Fakiria, and Mehabis in 2012, these authors conducted a study to compare the physical and psychological functions of 100 normal persons between the age of 18 to 60 years and 100 persons with epilepsy to understand the impact of epilepsy on it. The research shows that in physical dimensions, 75% of the patients with epilepsy have fear about injury after attack, 60% compliance of losing the memory, and 48% was non-compliance with their medications. In psychological domain, 88% had fear of death, 76% of samples fear from attack and sequence. In social domain, 86% of the patients were affected by social stigma, and 64% felt burden on the family. The study concluded that understanding patients' problem can aid in planning nursing interventions, which will ultimately improve family support and quality of life. Problem statement: a study to assess the level of family support and quality of life of patients with epilepsy at selected hospitals in Chennai. Objectives of the study: to assess the level of family support of patients with epilepsy, to assess the quality of life of patients with epilepsy, to correlate the level of family support and quality of life of patients with epilepsy, to associate the level of family support of patients with epilepsy with selected demographical variables and clinical variables,
to associate the level of quality of life of patients with epilepsy with selected demographical variables and clinical variables. Projected outcomes, the study will help to assess and correlate the family support and quality of life. The study will help to identify the influence of demographical variables and clinical variables and level of family support and quality of life. The findings of the study will help the investigator to make recommendations to improve the family support and quality of life for patients with epilepsy. Conceptual framework used for this study is Rosenstock's health belief model. This model provides a way of understanding and assessing the importance of family support and quality of life of clients in relation to their health and the well-being and the way they combine with the instructions given by the healthcare professionals. The model consists of individual perception, modifying factor, likelihood of action. Review of literature. Based upon the objectives, the review of literature is presented under the following headings: studies related to patients with epilepsy, general information and studies related to family support of patients with epilepsy, studies related to quality of life of patients with epilepsy. Methodology. The research approach is evaluative, research design is descriptive, sample 60 size, sample technique used non-probability purposes sampling was used to select 60 epilepsy patients. Settings of the study, selected hospitals at Chennai. Method of data collection was with the help of semi-structured interview schedule. The data collection tool, it consists of two parts. Section A, part 1, in section A, demographical data. A is gender, marital status, religion, educational status, occupational, monthly income, dietary habit, and type of family. Section B, clinical data. A is the diagnosis, duration of illness, family support, sleep pattern, habit of alcohol, habit of smoking, and anti-epileptic medications. Part 2, section A, 25 questions to assess the level of family support includes physical, psychological, financial, social, safety and security, and gender. Section B, 40 questions modified WHO breath scale to assess the quality of life includes physical, psychological, financial, self-perception, and social. Data analysis and interpretation. Section 1, frequency and percentage distribution of demographical variables of patients with epilepsy at selected hospitals. Section 2, frequency and percentage distribution of clinical variables of patients with epilepsy at selected hospitals. Section 3, assessment of level of family support of patients with epilepsy at selected hospitals. Section 4, assessment of level of quality of life for patients with epilepsy at selected hospitals. Section 5, correlation of level of family support and quality of life of patients with epilepsy at selected hospitals. Section 6, association of level of family support of patients with epilepsy with selected demographical variables and clinical variables. Section 7, association of level of quality of life of patients with epilepsy with selected demographical variables and clinical variables. The results, there is a satisfactory significance correlation between the family support and quality of life of patients with epilepsy. The assessment of the overall family support shows that majority 83.3% of the samples have moderate level of family support, 16.7% of the samples have high level of family support. The assessment of the overall quality of life shows that majority 81.7% of the samples have moderate quality of life, whereas 80.3% of the samples have poor quality of life. These are the overall level of family support of patients with epilepsy. Is the quality of life, the frequency and percentage distribution. There is a moderate and a poor quality of life. Conclusion, the study concluded that patients with epilepsy have moderate level of family support and the quality of life is moderate. There is a positive correlation between the family support and quality of life. Thank you all. My sincere thanks to our principal, Dr. AIIMS Sangeeta Devi, and the speakers who are presented yesterday and today. And a special thanks to FSNP to made this day to participate in here. Thank you all.
Thank you, ma'am. Seema ma'am, can we move to the next presenter?
Yes, ma'am. Thank you, ma'am.
The next presentation will be oral presentation by Deepthi Raut. Srimati Radhikabai Mege Memorial College of Nursing, DMIMS, Maharashtra, Wardha, India, on the topic Assess the Knowledge and Attitude Regarding Respiratory Problem Among Petrol Pump Workers. I'd like to call upon Deepthi Raut.
Good afternoon, ma'am.
Good afternoon, ma'am. Yes, you're audible.
Am I audible?
Yes, ma'am.
Is my PPT is visible to you?
Yes, your screen is also visible. You can start presenting.
Okay. My name is Deepthi Raut. I'm from Wardha. I'm a MSc Nursing first year student. My oral presentation on assess the knowledge and attitude regarding respiratory problem among petrol pump workers. My problem statement is assess the knowledge and attitude regarding respiratory problems among petrol pump workers. Introductions. Occupational health is a promotion and maintenance of the highest degree of physical, mental, and social well-being of the employee in all the profession through the avoidance of the health departures, the management of the risk, and the adaptation of work to people and their jobs. As a petrol pump worker, work constantly for more than 8 hours per day for 6 days a week, and thus constantly exposed to the petrol pump disease fumes are a high risk of developing the respiratory problems. My objectives are to study the knowledge of petrol pump worker regarding respiratory problem, to assess the attitude regarding respiratory problem among the petrol pump workers, to find out the association between knowledge scored with the selected demographic variables, to find out the association between attitude towards respiratory problems with the demographic variables. Methodology, the descriptive survey method was used. 100 samples of the petrol pump workers were selected by the purposive sampling techniques. Results are, the result reveal that there is a significant association between knowledge and attitude of the worker. The obtained p-value include that positive correlation was established between the knowledge and the score of and attitude of the petrol pump workers. Age in a year of petrol pump worker are statistically associated with the knowledge score, and working hours of petrol pump workers is statistically associated with the attitude score. Then conclusion, air pollution from the vehicle is an inescapable part of the urban life. Long-term exposure to the petrol and diesel fumes lead to the deleterious effects of the respiratory function. This fact of the vehicle petrol pump workers are also exposed to the vapors of petrols. Preventing works-related disease and accident must be the goal of occupational health rather than attempting to solve the problems after they have already developed. Keywords are airway obstruction, pulmonary disease, fuel worker, and pump workers. Bibliography are below. And then thank you.
Shushmita madam, we can move for the next.
Yes, ma'am. The next presenter would be oral presentation by Sagar Kamble.
Hello, ma'am. Am I audible? Hello.
Oral presentation by Sagar Kamble from Srimati Radhikabai Mege Memorial College of Nursing, DMIMS, Maharashtra, Wardha, India, on the topic to assess the psychological readiness in the pandemic among adults.
Hello, ma'am.
Yes, sir, you are audible.
Okay, ma'am. Thank you, ma'am. I am Sagar Kamble. I am from the SFNP College of Nursing from Saudi Arabia. My oral presentation on to assess the psychological readiness among the pandemic among the adults. The presenter is MSc Nursing First Year, Department of Medical Surgical Nursing, Srimati Radhika Megi College of Memorial Nursing, the Megi Institute of Medical Sciences, Varda, Maharashtra. Introduction. According to the World Health Organization, the world pandemic refers to the worldwide spread of new disease. A pandemic is also defined as an epidemic occurring worldwide, a very wide area crossing the international boundary and usually affects the large number of people. The people have experienced different epidemics throughout the year. Some of the most common cases are Ebola, the kind of global scenario can cause a condition and accelerate the existing ones. So many people may facing the increasing level of alcohol and drug use, insomnia, anxiety, psychological status, essentially during this global crisis. Hello.
Yes, sir, you're audible.
Aim to assess the psychological readiness, stress, anxiety, and depression to the pandemic among the adults. The tools consist of two sections. The section 1, it consists of demographic like age, gender, education, occupation, monthly income, and the section 2, modified DAS 21 scale for assessing anxiety, stress, and depression. In the DAS assessment, it will be full form will be the depression, anxiety, stress scale. The objective of study to assess the level of stress, anxiety, depression to the pandemic among the adults, to assess the psychological readiness to the pandemic among adults, to associate level of stress and depression to the pandemic among the adults with their selected demographic variables. The assumptions of study, adult may not have the psychological prepared the pandemic DAS 21 scale to measure the levels of anxiety, stress, and depression may help to assess the psychological readiness to the pandemic among the adults, and the criteria for samples include criteria adults belonging to the 18 to 35 years of age group who are willing to participate in the study, who are available at the time of data collection, and the exclusion criteria adult who had already participated in the study on the same topic, whose parents are health professionals and who are already affected by the pandemics. The methodology used in this methodology, the research screening model was used from the quantitative research method, and 100 sample size was selected for the study. And the question form will be the structured form prepared for the study. In this graph, there are showing the mark about it, showing that 45% of people are had a mild anxiety score and had moderate. Only them had severe level of anxiety score in the mild percentage. In the assessment of stress score, the score of pandemic among the adults, mild range is 48% and moderate is 44%. Assessment of level, depression of score to the pandemic have been shown by 46% and 42%. The result, the study was done with the association of level of anxiety, stress, and depression to the pandemic among the adults in the relation of gender occupation, and the monthly income. The assessment revealed that the age in the year, the gender of adult was not statistically associated with their anxiety, stress, and depression, because due to the pandemic, the so many people have having lost their job because of that they have got depressed. So it will be not associated with the pandemic of the people, pandemic of the COVID. And conclusion, it is found that the level of anxiety, stress, depression are low in the adult. Thus, it can be conclude that the adults were psychologically ready for the pandemic. None of the demographic variables were associated with the level of anxiety, stress, and the depression, except the genders and the occupation of adults with the depression. The keyword psychological readiness, adult, and pandemic references have been noted. Thank you, ma'am.
Thank you, sir.
Thank you, ma'am.
Ma'am, can we move to the next presentation, ma'am? Moving on to the next presentation. Oral presentation by Swati Ramesh Rathod by Srimati Radhika Bai Mege Memorial College of Nursing, DMIMS, Maharashtra, Wardha, India, on the topic, a study to assess the effectiveness of structured teaching program on knowledge regarding prevention and warning signs of stroke among patients in selected hospitals.
Hello.
Hello.
Hello, am I audible, ma'am?
Is it Swati Rathod?
Hello.
Is it Swati?
Yes, ma'am.
Yes.
Yes, ma'am.
Is it your
Good
presentation, ma'am?
Yes, ma'am.
But in presentation, it is showing Sharda Patel. Please check after it.
Madam, it is written Swati Ramesh Rathod.
Yes, ma'am.
Yes, ma'am. In the oral presentation, which she has been shared her screen, the topic is different. She has opened Sharda Patel's PPT.
Okay. PPT you have to change, Swati. The title which... Yes,
No problem. Just close this PPT and open your PPT. No problem.
PPT.
No problem. No problem.
आता कोणाची दिसत आहे? बघा माझं दिसत आहे का? माझं दिसत आहे. सर या ना. Hello, ma'am.
Yes, you are audible. You can start with your presentation.
Okay, ma'am. Thank you, ma'am. Good evening, ma'am. My name is Swati Rathod from MSc Nursing first year department from the college Srimati Radhika Mege Memorial College of Nursing. My presentation topic is study to assess the effectiveness of a structured teaching program on knowledge regarding prevention and warning signs of stroke among patients in a selected hospital. Introduction. Stroke is a major public health concern and it is a leading cause serious long-term disability. It is caused by the interruption of the blood supply to the brain, usually because of a burst of blood vessels or by clot block in the blood vessels. These cuts off the supply of oxygen and nutrients, causing damage to the brain tissue. The effects of a stroke depend on the size and severity of brain injury. Very severe stroke can cause sudden death. The most common symptom of a stroke is sudden weakness or a numbness of a face and an arm or a leg, most often on one side of the body. Other symptoms include confusion, difficulty seeing with one or both eyes, difficulty walking, dizziness, loss of balance or coordination, severe headache with non-vomiting or unconsciousness. Developing countries like India are facing a double burden, communicable and non-communicable diseases. Stroke is one of the leading cause of a death and disability in India. The population greatest risk for the least knowledge about stroke warning signs. My problem statement is a study to assess the effectiveness of a structured teaching program on knowledge regarding prevention and warning signs of a stroke among patients in a selected hospital. Objectives of the study is to assess the pretest knowledge level regarding prevention and warning signs of a stroke among patients, to evaluate the effectiveness of a structured teaching program on knowledge regarding warning signs and the prevention of a stroke among patients, to find the association between selected demographic variable and post-knowledge score. Review of literature. The study was conducted to assess the effect of a structured teaching program on knowledge regarding the prevention and the warning signs of stroke among high-risk medical outpatient department in selected hospital at a Varkala quasi-experimental group pre-test post-test design was employed in the study. A study was conducted to assess public awareness of warning symptoms, risk factors, and treatment of stroke in Ludhiana, Punjab, Northwest India. 23% of the participants did not know a single warning symptom of a stroke. 21% of the subject could not identify even a single risk factor for a stroke. A study was conducted at a village in a Kanchipuram district. Quantitative research and descriptive survey design was adopted to the study. The study findings revealed that among 40 samples, 57.5 samples, a cross-sectional study was conducted at primary healthcare centers in Gulf countries to assess the knowledge of a stroke in the general public. Nicole et al. Summarized the findings of a 15 studies about knowledge of a stroke, warning signs, and risk factor in both high and low risk population. In general, there appears to be low levels of knowledge, both risk factor and warning signs among community studies. A cross-study was conducted to assess the awareness of a strong warning signs in a Nigerians at increased risk at a Iriwa Special Teaching Hospital in southern Nigeria. About 225 patients with diagnosis of a hypertension, diabetes, or both were interviewed for warning signs of a stroke in the outpatient clinic by trained interviewer. Variable. There are three variables. First is dependent variable, knowledge score of prevention and warning signs of a stroke. Independent variable, structured teaching program of prevention and warning signs of a stroke. Attribute variable, age, gender, educational level, occupational, personal habit, diet, previous knowledge of a stroke, family stroke. First, the nurses utilize the structured teaching program prepared for this study as a model for preparing other teaching materials. The findings of the study can be used to make awareness about warning signs of a stroke in a patient-centered way. The planned teaching program prepared in the study can be used by nurses working in community health center for giving health patient high risk patients. Nursing implication. nursing education. The study findings can serve as a background for the further study. Teachers can utilize the findings to teach students in classroom and clinical setting. Nurse educator can encourage the student to conduct education programs regarding prevention and warning signs of a stroke. Nursing administration, nurse administrator can use this planned teaching program, conduct awareness program for the public regarding prevention and warning signs of a stroke. Nurse administrator can utilize the planned teaching program to organize continuing education program for health teachers worker in various healthcare settings. Nursing research, the study finding can be utilized as a background for the further studies. Tool used in the study can be standardized by conducting further studies. More researches can be conducted in this area using other hypotheses. Yeah, there is no significant difference between the knowledge score in pre-test and post-test scores among patients. There is a significant difference between the knowledge score, pre-test and post-test scores among patients. Assumption: the patient may not have any knowledge of a warning signs of a stroke. Sample criteria, inclusive criteria. In inclusive criteria, patients who are willing to participate in the age group of a 31 to 60 years, both male and female, able to communicate in Marathi, Hindi, and English. Exclusive criteria, patients who are unwilling to participate. Then second is patient unable to communicate. Third is unconscious patient. Statistics: in 2022, 1 in 6 deaths from cardiovascular disease was due to the stroke. Every 40 seconds, someone in the United States has a stroke. Every minute, someone dies of a stroke. Every year, more than 7,95,000 people in the United States have a stroke. About 6,10,000 of these are a first or a new stroke. About 1,85,000 strokes, nearly 1 in 4 are in people who have previous stroke. Stroke-related costs in United States came to nearly 53 billion between 2017 and 2018. This total includes the cost of healthcare services, medicines to treat stroke, and missed days of work. Why study is important? Our brain is an amazing 3-pound organ with about 100 billion neurons tightly inside. It controls every aspect of our day, from the ability to feel joy and sadness to coordinating the complete movement of our legs while we walk. When neurons die in a stroke, now, what's new? At altiplace, dissolved blood clots that are blocking arteries supplying oxygen, rich blood to the lungs or a brain, and has been approved for the immediate treatment of ischemic strokes. A newer medication, tenecteplase, is also a clot-busting medication and is a bioengineered variant of altiplase, and there are ongoing studies to determine its safety, efficacy, and
Sorry
treatment
to interrupt,
parameters.
Swati. Please move on to the
Yes, ma'am.
conclusion. Your time is
Yes.
up.
Conclusion: the major conclusion drawn from this study was that structured teaching program found to be effective in improving the knowledge of patients regarding warning signs and prevention of a stroke. Thank you, ma'am.
Thank you, ma'am. Seema ma'am, moving to the next presentation.
Yes, ma'am.
Next presentation is oral presentation by Besti Varghese from Krishna Institute of Medical Sciences, deemed to be University, Maharashtra, India, on the topic a comparative study to assess the effect of discontinuation of proton pump inhibitors after 48 hours on admission in critical care unit on incidence on nosocomial pneumonia. Ms. Besti Varghese. Excuse me, ma'am, are you there? Can we move on to the next presentation? I hope she is facing some network issues. We'll move to the next presenter.
Audible right now?
Yes, ma'am, you're audible. Please make sure that your volume is up. Excuse me, ma'am.
Yeah, is it audible right now?
Yes, ma'am, you're audible. Please share your screen.
Okay. Is it visible?
Yes, ma'am, it is visible. You can start with your presentation, ma'am.
Yeah, myself, Besti Varghese. I did MBA in Healthcare Management and I MSc Nurse Practitioner Critical Care. And right now I'm working as a nursing superintendent in Dr. P.K. Saha Hospital, West Bengal. Okay, I have done my research project under the guidance of Dr. Mahadev Shinde, who is a professor and the specialty of medical surgical nursing, KIMS Karad, Krishna Institute of Nursing Science Karad, and under the guidance of Dr. Archana Gautam, who is the medical receptor and consultant intensivist in critical care unit, Krishna Institute of Medical Science Karad. So my the problem statement was a comparative study to assess the effect of discontinuation of proton pump inhibitors after 48 hours on admission in critical care unit on incidence of nosocomial pneumonia. So the introduction, the proton pump inhibitors are powerful acid-reducing drugs. PPA drugs target proton pumps in the stomach. These tiny pumps cause the chemical reaction that produces stomach acid. The PPAs limit the amount of acid in pumps produces. Why I did this research? There is no evidence of previous study to reduce the nosocomial pneumonia rate due to the proton pump inhibitors after 48 hours of hospitalization in the critical care unit of Krishna Hospital, Kerala. And secondly, the assessment of acute Apache and chronic health evaluation score, Apache score, and the clinical pulmonary infection score on ventilator patients to assess WAP to decide PPA indicator was not being carried out before at selected settings. So my aim was to investigate the association between the uses of proton pump inhibitors and nosocomial pneumonia in critical care patients receiving feeding. And secondly, to carry over a comparative study to assess the use of proton pump inhibitors. So these are my objectives: to assess the patients who had an Apache and Apache score of less than 25, to calculate CPIS to confirm WAP. If the score is 7 out of 14, need to be obtained. To compare between the patients with the PPI chill discharge and another study group stopping of the proton pump inhibitors after 48 hours on incidence of nosocomial pneumonia or after initiation of enteral feeding. So the objective which is relevant to this study, to determine whether the use of gastric acid suppressive agents increases the risk of nosocomial pneumonia in the critical care population or not. So hypothesis, the holding PPA after 48 hours of hospitalization after enteral feeding with reduced NP, nosocomial pneumonia. That was the first hypothesis. And secondly, I did there is no proper guidelines or the protocol to stop PPIs even after enteral feeding, and stopping of PPIs will reduce the adverse effect associated with the PPI. So these were the hypotheses which I obtained. So ethical aspect, the study was conducted after the prior permission of the ethical committee of Krishna Institute of Nursing Science, and their written permission is, I obtained a written permission from the higher authorities of for data collection, MD, Dean and HOD's permission letters I have received. Then the privacy and the confidentiality have been maintained by myself.
and the scientific objectivity was maintained with the honesty and impartiality. The consent from the patient's close relatives has been taken for the data collection to fulfill the research activities in 3 different languages, like for example in English, Hindi, and Marathi. So, need for the study. The proton pump inhibitors, PPIs, are the most commonly prescribed drugs in all over the world. There is no sufficient study on the prevention of NP, nosocomial pneumonia associated with the PPIs, and concerns about the long-term use of PPI, the increased risk of developing the gastric acid, CKD, chronic arthritis in women. My study aim is to stop PPI and reduce the risk of developing the nosocomial pneumonia and associated disorders. So the organization of the literature review. Some I have cited some among the studies. The Matthew, the author who did the studies, his findings are the use of gastric acid suppressive agents increases the risk of NP. Then related to this study, the prior use of proton pump inhibitors did not correlate with the significant increase in the risk of developing nosocomial. But the findings which I did after my completion of this research study, I found that the risk for the patient who received PPIs was not significantly different than that of non-exposed patients. So second study, I took Alan Thomas, the proton pump inhibitors, and the risk of pneumonia. That is a common nosocomial infection occurring in the mechanically ventilated patients. So according to the CPI score, there was 2 or the 6.6%, I can say, the patient from the PPA group, first PPA group, and the 2.3% is the patient to no PPA group where who suffered from that, which was my findings. Then the sources of literature, I cited only 4 among various studies I have gone through, and among that 4 is cited over here. Olison in 2009 and Matthew 2008. These studies relevant to these studies I have just mentioned. Bioavailability of the entirely administered PPI was lower than that of IV. Then the study relevant in this nursing, acid suppressing ability of the enteral administration was greater than need of further study. And Matthew, the PPI did not correlate with the significant risk of developing NPs. The previous slides also it was mentioned in that. The risk high along with the invasive procedures like CVP and all, which was I found. I will explain later. Then the Megan James, the association of between the PPI use and the infection, Clostridium and pneumonia. The PPI the study relevant to in nursing, the PPA contributes development of the micronutrient deficiencies need. It required some need of higher quality studies. Then the PPI caused the hospital-acquired infection, community acquired infection, not hospital-acquired infection. They need to use PPI judicially. We need further studies for this confirmation. Then the conception framework, which is the conceptual framework which is applied on this study. I carried out the input, throughput, and output. This was the method which I obtained in this. Among that, the input, my inputs was the demographic values and the diagnosis studies like X-rays and the patient's all clinical the data which I used, and by using the tool, the Apache, I estimate the ICU mortality and severity. Like the 2 groups were there. One group was continued with the PPA, and the second one with the holder PPA with prior permission of the doctor, and that means they started after starting the enteral feeding or after confirmation of that. So CPI's calculator I used, Apache score also used, and then our provides the I analyzed the results and the interpretation was carried out. Next slide. Okay, the review of the literature summary I just mentioned over here. The potential interaction between the PPIs and the antiplatelet agents has been the subject of multiple studies like the CKD, chronic kidney disease and dementia. The PPI proton pump inhibitors produce an environment conducive to certain infections, development of certain infections as producing if we are using the PPIs. It is observed that the little consistent evidence of an increased risk of gastric cancer with PPI use and hypomagnesemia, rheumatoid arthritis in women. These are the some studies I have gone through, and the use of the proton pump inhibitors and the increased clostridium difficile infection risk are also increased. So methodology and the procedure which I carried over for this study, the step one, the methodology adopted was an experimenting method which with respect to the effectiveness of the proton pump inhibitors in two different study groups. Then secondly, the identification of the target and the accessible population. The researcher identified 200 bedded multi-critical care units, that is Krishna Institute of Medical Science, that included 60 critically ill patients from the period from January 2021 to October 2021 at Krishna Hospital. Thirdly, what research design I carried out. Performed the experimental study with the non-probability purposive sampling technique I carried out. And then fourthly, I divided into two groups. After initiation of enteral feeding on the random basis, one group of patients with PPA and another group of patients without PPA. Okay, for that, without PPA, I took prior permission of the critical care specialist doctor for doing this experiment. Both of the groups were evaluated with the risk of suspected hospital acquired infection with the guidance of medical classification tools like medical classification tools, Apache, TCS, and CPIS at the time of admission, and followed by the consequent times irrespective of the diagnosis and treatment. That means I have 60 different groups. I have 60 randomized samples I have collected, and after that, what I did, I have calculated these three tools I have done at the during the admission. Then after the 48 hours, then before discharge, like that, 4 times I have calculated all the data. Then selection criteria, inclusion criteria. The patient admitted in the critical care unit with the need of enteral feeding. That was the inclusion criteria. And the age group is above 14 years of age, no less than 14. Then exclusion criteria. NPM patient is excluded from this clinic because enteral feeding is mandatory. The patient's relatives not willing for this study, because I have taken permission from relative and patients with the consent I have taken. The patients admitted in critical community with the multiple comorbidities also I have excluded. The patients who are mentally challenged, because it's very difficult. Then pilot study. What I did before starting the full study, I have done a pilot study for checking the feasibility of this study. For the study was conducted over 5 subjects. Only 5. I took 5 subjects to assess the feasibility of this study. Non-probability purposes sampling was used to select these subjects. The management and the administrative permissions were also taken prior conducting this pilot study. The study was found feasible after the pilot study. Okay, then afterwards I have done full 60 samples collected and done the study. The research and analysis and interpretation of the data. Unpaired t-test was done with the guidance of the instant worksheet software, and a comparative study was performed. One group of patients with the proton pump inhibitors therapy, and the second group with the stopping of PPI after 48 hours to discharge. There was, I found that there was no.
Sorry, ma'am, to interrupt. Please wind up with the presentation. 10 minutes is over.
The graphic representation I have done. Then this is the unpaired t-test was done to compare between the two patients, and there is no significant difference between the two groups after this. And some limitation which I found that apart from the PPA, there was some treatments nursing care received by the critical care patients various because it is also important to treat the predisposing existing clinical condition also, because this study was resulted very less patients with causing hospital acquired infection or without the PPA treatment due to large number of different types of critical care diagnosis irrespective of hemodynamics, because hemodynamic status also we need to check. That was the interpretation which I found. The study is required to carry over much more recommendation. To clarify the cause of hospital acquired pneumonia or without medication on different types of diagnosis on similar immunity, this is required. Actually, the classification clarify for the accurate result, we should take with or without PPI medication, different types of diagnosis on similar hemodynamic status, which is required. I found that. To identify the definite cause of increase in the hospital mortality rate with the effect of the PPI treatment and to compare with the non-PPI. To find out the long-term effect of PPI use with the enteral feeding, the diagnostic criteria. To develop, it will help to diagnose criteria, to develop a diagnostic criteria, develop a standardized categorical and dimensional criteria for diagnosing the various clinical conditions that may include in the vulnerable categories as well. The long-term use of PPI, early recognition of the hospital-acquired infection and the treatment of longitudinal outcome. One standardized criteria for the diagnosis is actively developed. Both prospective and retrospective studies using case control methodology to facilitate this objective. So, conclusion, long-term use of proton pump inhibitors did not correlate with the significant increase in the risk of developing nosocomial pneumonia. There was no significant difference between two groups for any of the scores, indicates very few cases of nosocomial pneumonia in Krishna Hospital, which is a good thing. And this is the bibliography. And thank you for the listening. And okay.
Thank you, ma'am. Seema, ma'am, any questions?
No, ma'am, we can move for next.
Yes, ma'am. Next presentation. Oral presentation by Anjali Kaushik, Rufida College of Nursing, Jamia Hamdard University, New Delhi, India, on the topic, a study to assess the knowledge of students and faculty members regarding plagiarism.
Very good evening to one and all. Yeah, yes, let me share the screen. I hope the screen is visible to all.
Yes, it is, ma'am.
Okay. So a very good evening to one and all present here. I am Anjali Kaushik, working as a faculty in Rufida College of Nursing, Jamia Hamdard. First of all, I would like to thank the organizers, SFNP, Ms. Shishmitha, Madam Seema, for giving me this opportunity to be here and present this paper in front of all of you. So the topic of my study is a study to assess the knowledge of students and faculty members regarding plagiarism. Madam, I would like to tell you that this study I did during COVID-19 because a lot of articles were published and some of the people, they were not aware of the plagiarism. So introduction, today in every profession, we know that people, they write articles, they publish their research work, and sometimes they even copy others' work. And that is without citation. And in some of the professional programs, like in our nursing programs also, during BSc or MSc nursing or in PhD, we need to submit research work in group or individually. So students sometimes, in order to complete that in time, they copy others' ideas, their work, and even their findings and publish in their names. So this can happen with faculty as well, intentionally or unintentionally. Verbatim plagiarism, mosaic plagiarism, paraphrasing, self-plagiarism, cyber plagiarism, image plagiarism are some of the types of plagiarism. Plagiarism is plagiarism, whether done intentionally or unintentionally. In today's world, in the competition of having more and more publications, people are copying others' work without proper citation, thereby contributing to plagiarism. It's a chronic and troublesome issue for scientific journals. It is crucial that unacceptable copying be detected to preserve the integrity of the scientific literature. In the past, it was difficult to detect plagiarism and publishers mainly dependent on the editors for the same. But now, with the availability of different softwares to detect plagiarism, this work has become easy. Madam, now we have Turnitin, Grammarly, Duplicate Checker, PlagScan, CopyLeaks, Plagiarism Checker. These are the software that can be used to detect plagiarism. Regarding need of the study, in the older times, there were few sources for plagiarism like magazine, newspaper, etc. But nowadays, access to electronic media made it easier to copy others' work and use it in your name. This condition is getting worse day by day. Reason can be lack of awareness among people regarding plagiarism, especially students and even faculty. If the faculty is knowledgeable and knows about plagiarism, then they can play an important role in educating and deterring students from plagiarizing. Therefore, investigator felt a need to conduct a study in this area. So objective of my study was to assess the knowledge of student and faculty members regarding plagiarism. So research approach adopted for this study was descriptive survey approach with cross-sectional design. Purposive sampling was done with 108 students and faculty members were selected. An online structured questionnaire was administered through Google Docs for the data collection. Section 1 of the tool had demographic items. Section 2 had knowledge items about plagiarism. The maximum score on knowledge items was 19, with score 1 for each correct answer. Score of 80% and above was considered as good knowledge, and between 60 to 79 as average knowledge, and below 60% as poor knowledge. And analysis of data was done with the help of descriptive statistics. So result shows that among 118 samples consisting of 46 faculty members and 72 students, 63% were in the age group of 18 to 28 years, followed by 49 to 58 years. 17 candidates were in this age group. 84% were female, and educational status of 52.5% of participants was bachelor, and 90% were from nursing profession. 60% participants were students, while 40% were faculty members. 54.7% participants were actively involved in paper presentation, article publication, etc. Majority, that is 83% participants, heard of plagiarism, and no participant was ever punished for plagiarism. Majority, that is 91.5%, agreed that a person doing plagiarism should be punished. These are the knowledge scores of sample. So out of 118 sample subjects, majority gave correct answer of the question regarding plagiarism, and 78.8% participants answered that paraphrasing and citing the source is to be done to avoid plagiarism. 69.5% participants were aware of softwares used for detecting plagiarism. 69.5% were aware of the consequences of plagiarism. 38% participants were not aware of UGC guidelines related to plagiarism, and only 6% mentioned that plagiarism is not a type of research misconduct. 29 out of 118 were not knowing that softwares are available for checking plagiarism. 11 mentioned that they did not know whether plagiarism is cheating or not. So it is evident that most of the participants, that 72% had good knowledge about plagiarism, 20% had average knowledge, and 8% had poor knowledge about plagiarism. So discussion, as per a study done by Shirazi, Zafri, and Moazam, where knowledge and perceptions regarding plagiarism was conducted on fourth-year medical students and medical faculty members of private and public medical colleges in Karachi, it was found out that there is a general lack of information regarding plagiarism among medical students and faculty members. Whereas in the present study, the results showed that 72% of the participants had good knowledge about plagiarism. In another online survey, which was designed and delivered through Google Docs, Google Forms to the participants, it was found out that 89.1% of them know the meaning of the term plagiarism, which is in line with the findings of the present study, where 87.3% participants know the definition of plagiarism. As per their findings, 35% participants admitted that they had been involved in plagiarism, which are in contrast with the findings of the present study, where none was involved in the act of plagiarism. According to a study done by Yadav Pooja et al., it was found out that most of the participants were aware about plagiarism, which is in line with the findings of the present study, where 72% participants were aware of plagiarism. In this study, about 70% of the students had plagiarized to some extent in the past, whereas the findings of the present study showed that none was involved in plagiarism. So we can conclude that this study was an attempt to assess knowledge of faculty and students regarding plagiarism, and results of the study showed that participants had good knowledge about plagiarism. But the problem will be solved only when more and more people become aware about plagiarism. Unfortunately, people know about it, but still they commit the crime of plagiarism. Teachers have the responsibility of teaching the students about the consequences of plagiarism so that at an early step, they understand the importance of original work. So these are the references. Thank you so much for the patience listening. Thank you, ma'am.
Thank you, ma'am. Any questions, Seema, ma'am?
No, ma'am.
Yes. Then the session Nursing Research 2 is done. I thank all the presenters for presenting their wonderful research, and also thank our session chair, Dr. Seema, Principal cum Professor of SRMM Con, for evaluating the session patiently. Thank you, ma'am. Thank you, presenters. We now move on to the valediction session. I call upon Tejashwini Lokhre, MSc Nursing student, Srimati Radhika Bai Meghe Memorial College of Nursing, DMIMS Maharashtra, Wardha, India, to deliver the vote of thanks.
Thank you, ma'am. Am I audible?
Yes, ma'am.
Good evening, all. Thank you is such a prayer that cannot be seen or touched. It must be felt by heart. I, Ms. Tejasvi Lohkare, feel honored and privileged to get the opportunity to propose a vote of thanks on this special occasion. My special thanks to our Honorable Chief Guest, Dr. L. Gopichandran, President, TNAI, Associate Professor, College of Nursing, AIIMS, New Delhi, for his gracious presence. At this juncture, I would also like to thank our guest of honor, Dr. Indira, Nursing Dean, Narayana College of Nursing, Nellore, India, for various help we received toward this conference. I'm also thankful to the conference co-chairperson, Professor Sudhar S.P. Varna Kulasurya, and conference joint secretary, Dr. Vijayana Mary Victor, ma'am. They help us in obtaining the necessary administrative approval for organizing the event. They supported in all possible manner to organize this conference. I would like to thank all the honorable delegates who blessed us with their presence. I'm also thankful to all the program National Advisory Committee members, Mohammad Said bin Nurumal, Associate Professor, Medical and Health Sciences, and Lily Mary Lazarus, Lecturer, Ministry of Health, Malaysia, Anis Farhana, Occupational Health Nurse, Perak, Malaysia, Selvarani Palani, Nursing Manager, Retired Nursing Manager at Ministry of Health, Malaysia, Shamil Dhulpakar, Assistant Nurse Manager, Emergency and Critical Care, Malaysia, and special thanks to all the invited speakers, Ms. Neetu Kataria, College of Nursing, AIIMS, Rishikesh, India, Veena Sharma, Principal, Rufaida College of Nursing, Jamia Hamdard, Dr. Seema Singh, Principal, and Professor Srimati Radhikabai Meghe Memorial College of Nursing, Maharashtra, India, Dr. Carol, Nurse Scientist and Clinical Educator, Professor Vaishali Taksandi, Vice Principal, Srimati Radhikabai Meghe Memorial College of Nursing, Maharashtra, India, Professor Ashokan R, Department of Medical Surgical Nursing and in charge of Research and Development, Kalinga Institute of Nursing Sciences, Maitri Chaudhary, Principal, Nurses Training Institute, West Tirupura, India, Dr. Karpagavalli Nageswaran, Dean cum Principal, Ganpat University, Kumud and Bhupesh Institute of Nursing, India, Mr. Ravi Barot, Associate Professor, Ganpat University, Kumud and Bhupesh Institute of Nursing, India, Professor Jacqueline Javagani, Vice Principal, SEA College of Nursing, Bangalore, Jane Nesamani Sonaja is Assistant Professor, Department of OBG, College of Nursing, Aligarh Muslim University, Uttar Pradesh, Dr. Hemam Sangita Devi, Principal, SE College of Nursing, Bangalore, India. Words are not enough to thank their constant guidance and support to shape the conference. I, on behalf of all organizing committee and international organizing secretary, Veena Sharma, Principal, Rufaida College of Nursing, Jamia Hamdard University, New Delhi, Dr. Seema Singh, Principal and Professor, Srimati Radhika Memorial College of Nursing, Dr. Karpagavalli Nageswaran, Dean cum Principal, Ganpat University, North Gujarat, India, Dr. Mercy Dayal, Principal, Universal Institute of Nursing, Punjab, India, Dr. Hamem Sangita Devi, Principal, SE College of Nursing, Bangalore, India, Professor Dr. Niyati Das, Principal, Kalinga Institute of Nursing Sciences, Bhubaneswar, India. I convey deep regards and hearty thanks to all the participants We will ever remain grateful to you and we thank you for being with us today. I am very much thankful to all our current and former faculty, colleagues, and non-teaching staff members who always stand by us and motivate us. I feel proud and thank you for making this event a successful one. An event of this dimension cannot happen overnight. The wheels start rolling months in advance. We have been fortunate enough to be backed by a team of very motivated and dedicated committee and volunteers. I cannot thank everyone enough for the involvement they have shown and the willingness they have expressed to take on the completion of tasks beyond their comfort zone. I am very much thankful to the national sponsoring agencies and academic partners, media partners, and research partners. It would have been impossible to organize it without their support. Thank you very much again. If time is money, then today you have spent millions for us. Thank you uh, all of you for making this event successful. Thank you. Thank you once again.
Thank you, Tejasvi. From my side, from SFNP, I'd like to thank our academic partners, Rufida College of Nursing, Universal Institute of Nursing, Srimati Radhika Bai Mege Memorial College of Nursing, Ganpat University, Kumud and Bhupesh Institute of Nursing, SCA College of Nursing, and Kalinga Institute of Nursing Sciences for their active participation in 4th International Nursing Conference. I'd like to extend my thanks to our international organizing secretaries, International Organizing Committee members, National Advisory Committee members, and the day 1 and day 2 keynote speakers, our session chairs, and last but not the least, our management SFNP for making this 4th International Nursing Conference a grand success. I'd like to give the update on the upcoming conference that would be on 28th to 30th of October 2022. We are happy to announce you yet another grand and global nursing event organized by Society for Nursing Practices in association with Narayana College of Nursing, Nellore, India. 5th International Conference on Futuristic Nursing, which will be held on 28th, 29th, and 30th of October 2022 at Narayana College of Nursing as a 3-day event, where the first day will be conducted as fully virtual and the 29th and 30th will be conducted as a physical event at Narayana College of Nursing, Nellore, Andhra Pradesh, India. The conference emphasized on the theme Futuristic Nursing, Navigating Beyond the Horizon. It is a hybrid event physically conducted in one of the renowned institutions, Narayana College of Nursing. All the participants are requested to join the event and experience the future of nursing. Do not miss the opportunity to be the part of 5th International Nursing Conference that is on futuristic nursing. Mark your dates on your calendar and be the part of this global event. Thank you, one and all. The certificate downloading link and the feedback link will be sent to your registered mail IDs via mail. You can start downloading from tomorrow. Today also you can do, but if you rush with the downloading, it may crash sometime. So from tomorrow you can start doing. All the participants, make sure that you're entering your registered mail ID, then only you will be able to download your certificate as listeners and presenters separately. In the chat box, I am placing the feedback link and the certificate link. You can sign in into our dashboard and you can download the certificates that is present there. The forum is open for video feedbacks and return feedbacks also, a short video 30 seconds feedback that we will be incorporating as a video and will be placing in the 5th International Conference website. So we are welcome for that also. You can mail us or WhatsApp the 30 seconds feedback video on the experience of 4th International Nursing Conference. Thank you once again. Thank you all.
Thank you, ma'am.
Ms. Besti Varghese, do you have anything to share?
Where is the link? I am not getting.
In the chat we have posted, ma'am.
Chat, I'm signed from my mobile. I'm not getting that one. Let me check with the PC.
I'm just sending the chat to you. Is it visible, ma'am?
Okay.
The same link will be sent to you via mail also.
Mail is there. Okay, then no problem. And for publication, if I want to publish, in what I need to do?
Ma'am, once the conference is over, we can talk about it, ma'am.
Okay, sure. Thank you.
Thank you, ma'am. The conference is officially over. You can leave the session.
Okay.
Thank you, ma'am. Thank you.
Me? Hello?
Yes, ma'am.
Yeah, it was very good conference, very well organized. I want to give this feedback. And
thank you so much, ma'am. This is really meaningful to us.
A virtual conference, but it executed very well, very nicely organized. Congratulations to the organizers.
Thank you, ma'am. Thank you so much, ma'am. These words are really motivating, ma'am.
Yeah, so we are also motivated to participate in this conference. And also I want to know you have shared the two links. One is for the feedback and one for the certificate.
Yes, ma'am.
This for certificate, no, that is asking for the password. So which password that?
If you have already registered, via the dashboard, you can enter your mail ID and your password and go on, ma'am, or you can newly sign up as a member.
Okay.
We do have the sign up option in your left hand side corner. You can sign up and you can enter your OTP and you can.
It's the option most of the participants have left, so they will not receive the link for the certificate.
No, ma'am, it will be sent to them via mail.
Okay, so it will be sent.
Yes, ma'am. It has been scheduled after 6 o'clock. They will receive after 6 o'clock via mail.
Okay. Thank you so much.
Thank you, ma'am.
I do not do it now, then I will be getting it, no?
No, ma'am, you will be definitely, it will be there for 10-20 days. It will be there.
Okay. Thank you so much.
Thank you, ma'am. Thank you, ma'am. SFNP will be organizing such college conferences also. You can motivate your college side to participate in the conferences as academic partners, ma'am.
Okay, one question I have, Sushmita, this link will work after 6 o'clock only.
Yes, ma'am.
Okay.
Now also, Hello, excuse me, ma'am. You can, the link will be working now.
Okay.
But possibly the mail will be sent to everyone after 6 o'clock. You can use this link now also.
Okay, but it's not accepting actually. I was trying.
The link is open only, ma'am. The access is open to everyone now itself. The mail is drafted, is scheduled after 6 o'clock.
Okay, okay.
Yes, ma'am.
Okay. Thank you so much.
Thank you, ma'am. Thank you, ma'am. Any other doubts? Thank you once again.
Okay. I think we can leave now. No?
Yes, ma'am, you can leave.
Okay. Thank you then. Thank you.
Thank you, ma'am. Thank you, ma'am. Take care.